The Senate will come to order. Senator Murphy. This is for a call of the Senate. If we're doing a call of the Senate, then we'll go there. Senator Murphy.
Mr. President, I impose a call of the Senate.
The Senate is now under call. Senator Murphy for a motion.
Mr. President, I move that further proceedings under the roll call be dispensed with and that the Sergeant at Arms be instructed to bring in the absent members.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Members remaining under motions and resolutions will revert to the third order of business. Messages from the House. The Secretary will read the first message.
Mr. President, I have the honor to inform you that the House of Representatives of the State of Minnesota is now duly organized for the 2025 special session pursuant to law. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, no action is required. The Secretary will now read the next message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted. House File Number 1. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, no action is required. The next order of business is the fourth order of business, first reading of House bills. The Secretary will give the bill its first reading.
House File Number 1, a bill for an act relating to health modifying Minnesota care coverage eligibility.
The House file has been given its first reading. Remaining under motions and resolutions, I will now call on Senator Rasmusson for a motion.
Thank you, Mr. President. I move that an urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to House File 1, and that the rules of the Senate be so far suspended to give House File 1 its second and third reading and place it on final passage. And Mr. President, I would request a roll call.
Roll call requested, roll call granted. The Secretary will take the roll on the motion to suspend the rules. Senator Rasmusson, for those voting pursuant to Rule 40.7, since you're still waiting, you need a couple more minutes. Senator Rasmusson, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
And thank you, Mr. President. Senator Drazkowski votes aye.
And Senator Drazkowski votes aye. All members having voted, who desires a vote? Oh. All members having voted who desires to vote, the secretary will close the roll. There being 48 ayes and 16 noes, the motion to suspend the rules is adopted. The secretary will give the House file its second reading.
House File Number 1.
The House file has been given its second reading. I have now called on Senator Rasmusson to explain the bill.
Thank you, Mr. President. The bill before the body, House File 1, pulls back on taxpayer dollars going to fund Minnesota Care for illegal immigrants. We should be honest about what's happening here. Minnesota Care is a generous benefit in Minnesota, and it's designed to help people in need. It's a growing part of our state budget, and we have spent an entire session talking about the rate of growth in the Health and Human Services budget and what we can do to rein it in. The enrollment of illegal immigrants on Minnesota Care has grown exponentially. Just going back to January 1, when enrollment opened for taxpayer-funded health care for illegal immigrants, the Minnesota Department of Human Services projected that we'd have about 5,800 illegal immigrant enrollees by the end of this year. However, by mid-April, more than 20,000 illegal immigrants had enrolled in this program. Well, back in the February forecast, the Walz administration projected that this program would cost $220 million over 4 years. With triple the enrollment, it could add hundreds of millions of dollars to Minnesota's deficit going forward and leading to additional cuts to Minnesota nursing homes and other critical services. Mr. President, it's very clear that Minnesota Care for illegal immigrants has helped make Minnesota a magnet for illegal immigration. And unlike other healthcare programs that receive federal matching dollars, such as those for nursing homes, services for families with disabilities, and low-income legal residents, Minnesota must cover 100% of the costs of this taxpayer-funded benefit for illegal immigrants. And Mr. President, Minnesota is now really the only state in the country that provides this broad-based coverage for all illegal immigrants. We have seen liberal governors in both California and Illinois take steps to pull back similar programs in their state after they had seen the costs balloon out of control. In California, costing taxpayers billions of dollars, and in Illinois, almost exceeding 300% of the initial cost estimate. Mr. President, I think for most Minnesotans, this issue is quite simple. We shouldn't be incentivizing illegal immigration to our state by making it easy, providing taxpayer-funded benefits, and looking the other way when someone came here to break our laws. At a time when we're facing cuts to special education, to nursing homes, to disability services, hundreds of millions of dollars of cuts to these important services, I think it's important that we set an example with this bill and set our priorities by putting Minnesotans first. And so, Mr. President, I'm here to ask for members' support of this bill today that would end taxpayer coverage for Minnesota Care for illegal immigrant adults by year end. And I would stand for any questions and debate, Mr. President.
Members, we only do first any amendments. We're only doing amendments, and then after third reading, then we have a list. Senator McQuaid.
Thank you, Mr. President. I would move the A50 amendment.
Senator McQuaid moves the A50 amendment. The Secretary will report the A50 amendment.
Senator McQuaid moves to amend House File Number 1 as follows. Page 1, delete lines 20 to 23 and insert. This is the A50 amendment.
Senator McQuaid to your A50 amendment.
Thank you, Mr. President. Members, the A50 amendment before you does something very important. We can all pretend that kicking people off of Medicaid somehow reduces costs, but I think we all know that when people don't get preventative health care treatment, the cost balloons and it is borne by society. And so the A50 amendment here allows Minnesotans who are under 18, over 59, or enrolled in Minnesota Care while they were a child and have critical health conditions to continue to receive Minnesota Care. And the reasons for that are humane. People who are receiving dialysis, cancer treatment, who turn 18 and can no longer afford their inhalers. We want to make sure that not only are these workers, because that is what they are tax-paying Minnesotans who pay hundreds of millions of dollars in taxes in this state every year. They are part of our workforce, they are part of our communities and our churches. These are people who live in our community. They're also people we don't even know yet, because they're making people undocumented every single day. Ukrainian refugees and Afghanistan refugees. But I digress. This would make sure that the most critical folks, the hardship, they can still receive the care that they need to live and to continue to work and to care for their families. I know we have a budget to pass, and I actually worry that some people who want us to go to a government shutdown, we have folks in this chamber, would mess with this bill and vote for this amendment. So while I would love to vote for this amendment and put it up so we could see who cares about the children and the seniors and the critically ill, with that, Mr. President, I withdraw the A50.
The A50 has been withdrawn. The Secretary will give the bill its third reading.
House File Number 1, a bill for an act relating to health modifying Minnesota Care coverage eligibility.
Third reading, Senator Wiklund.
Thank you, Mr. President. I rise in opposition to the bill before us. 2 years ago, I worked hard to include coverage for undocumented Minnesotans in the HHS budget bill. While I initially included coverage for children, over many discussions that I had with constituents, stakeholders, immigrant advocates, healthcare providers, hospital systems, and in hearing testimony in my own committee, I came to understand how important it was to make sure we included all ages. I heard stories of the devastating impact of illness during the pandemic, when essential workers had to show up every day to perform critical tasks, and they lacked a way to access health care. They kept our economy going in a way that we all benefited from. I also heard stories of people who came forward and said how access to Minnesota Care would change their lives due to chronic conditions or severe disease, diseases that kept them from fully being able to parent their children, work to support their families, and participating in our communities like we do every day. Passing the bill in 2023 gave people the opportunity to enroll in coverage and change the course of their lives. This is what makes me believe that removing coverage for adults is contrary to working towards the goal of a healthier, more prosperous Minnesota. It will place greater burdens on our healthcare system. And I hear many on both sides of the aisle talk about how that's one of our priorities should be, and how do we stabilize our hospital system? Well, this will increase the burdens on our hospital system due to greater use of emergency services, higher acuity care, and becomes uncompensated care. This bill is contrary to making access to health care possible for all Minnesotans, and having it be something within their means. It takes away access to health care for a group of low-income Minnesotans, and the impact is to put them in a position that is worse off than other low-income Minnesotans. They do not have access to subsidies for health insurance, and this is despite the fact that these are Minnesotans that are integral to Minnesota's economy. They are paying taxes, they are supporting our communities, and there are not the supports for this group that other Minnesotans benefit from. As legislators, we have a responsibility to respond to needs in our state. The legislation to expand access to Minnesota Care to undocumented immigrants in the same way as other Minnesotans at their same income level was the right thing to do in 2023, and it is a mistake to move backwards and remove this access now.
Senator Kunesh.
I want to share a story about a factory worker whose name is Gabby. And Gabby lives in Owatonna, Minnesota. I think that's Senator Jasinski's district. And she writes this. She says, I have lived in southern Minnesota for the past 24 years. Minnesota is my home, and I've been working in packing factories since I arrived here. I am an essential worker and showed up to work every single day during the COVID-19 pandemic. Every single day. My job ensured that all Minnesotans were able to receive products that needed to be shipped. I have been a diabetic for the last 15 years. Accessing just minimal care to manage my condition was nearly impossible. Sometimes my coworkers pitched in so I could afford my insulin, but most of the time I rationed it or stopped taking it because I had no health insurance. Because of my condition and that it was so poorly managed, I lost my right foot, and it has been incredibly difficult to continue to keep going. I have been unsuccessfully trying to purchase a prosthetic for years. My life changed when I was able to purchase Minnesota Care. So she purchased Minnesota Care in 2025. This is the first time Gabby had access to consistent medical care since she arrived in Minnesota over 2 decades ago. She can now afford her insulin and her pills. She also is getting regular blood pressure checks. So when my health navigator told me that Minnesota Care might be cut, she had a major panic attack. She says, I cannot go back to not having health insurance, as I am very scared that I could lose another limb. I'm also very scared about the possibility of not being able to continue working to support myself and my family. Members, it is our job to make sure that our essential workers retain access to Minnesota Care.
Senator Dibble.
Thank you, Mr. President. Mr. President, members, I also have a story to share about a Minnesotan. His name is Manuel. He's a construction worker. He lives in St. Paul. Manuel is in his early 50s. He's lived here since 2013. He's built homes and apartments, and he feels very, very proud every time he sees his work and how that has helped Minnesota become a better place. He says that he is very happy to file his federal and his Minnesota state taxes. A few years ago, Manuel was the victim of a felony assault with a deadly weapon. He cooperated with law enforcement. And as members may be aware, when folks are targeted and they're a victim of crime, they cooperate with law enforcement. That's something we, of course, all want, because that helps the whole community be safer. And the federal government has developed the U-Visa application in recognition of that, so that there is not a disincentive in stepping forward and engaging with law enforcement when crime and violence is happening in our community and in our midst. But there's been a processing delay, and so he's remained undocumented, and he's awaiting a decision on his application. In his line of work, of course, it's a line of work in which injuries are common. He injured his back, left him unemployed for several months. But because of Senator Wiklund's initiative to expand Minnesota Care, he was able to receive life-changing care to treat that back injury, allowing him to return to work and continue paying those taxes. He is the primary caregiver for his nephew, Gabriel. He's now able to go back to work. He's working with construction crew members like himself who also need access to medical care. Their jobs are dangerous, injuries are common, and members, we know that this is an essential workforce that has been relied upon for a number of years. Drive by any work site, and you'll see that. And members, as I was driving into work this morning, I was listening on the radio how now literally thousands and thousands of people who are in the U visa application process are not only suffering these application delays, but because they're in the U visa application process, because they have stepped forward and cooperated with law enforcement in an effort to make sure that crime in our community is addressed, they're being targeted by the federal government. Being targeted and arrested and processed for deportation. Is that what we want? We want people who don't have access to health care, who aren't working, who aren't paying those taxes, hundreds of millions of dollars in Minnesota taxes we're talking about. And I think, as was articulated earlier, it's not as if though we're not going to pay. It comes in the form of uncompensated care, charity care, and from our property taxes. Thank you, Mr. President.
Senator Fateh.
Thank you, Mr. President, and I also have a story here to share, but before that, I want to be really brief. That here in Minnesota, we do value our undocumented Minnesotans because they are Minnesotans. They exist, we value them, they contribute to our society. Their kids, just like our kids or any other child, contributes to the school experiences of our children. They work hard. They pay over $200 million in state and local taxes. And I just want to be clear, they are not a strain or a burden on our state. And they are not to be negotiation chips for our legislative process. These are human beings, and I want to make that very clear. The story that I wanted to share comes from Jose, who lives in Minneapolis, Minnesota. He says, "My name is Jose, and I've lived in Minneapolis, Minnesota with my family. The importance of the expansion of Minnesota Care for undocumented people is deeply personal to me. My parents immigrated to the United States decades ago. My father is an essential worker and taxpayer working in maintenance and painting, and my mother is a child care worker. Both were unable to shelter at home during the COVID-19 pandemic as their jobs required them to show up in person, and they proudly did, as Minnesota is their home. My parents have always contributed to our community without asking for anything in return. Since their arrival, they have avoided any sort of medical care due to high costs. However, since becoming eligible for Minnesota Care, they finally received the necessary medical treatment they need, especially for my mother, who is diabetic. Before the expansion of Minnesota Care, she paid about $500 without insurance for her insulin, putting a lot of strain on our family's finances. However, the expansion of Minnesota Care, as well as the cap on the cost of insulin, has been transformative for our family. My mom can now access regular medical checkups to manage her illness. Removing health care from essential workers in our community would create an unnecessary burden during difficult times and signal a lack of care. As Minnesotans, we look after each other, ensuring everyone has what they need to live a fulfilling life. Restricting health care would be a step backward, and that's not who we are as a state. So I'm here to stand up against this cruel and inhumane legislation. I hope we all vote no. Thank you.
Senator Bowden.
Thank you, Mr. President. I rise in the strongest of opposition to this bill. In my community of Rochester, we have been having a painful conversation over the last several weeks about who belongs and how we treat our neighbors. So I want to be clear to our undocumented neighbors that you belong. You deserve health care. Health care is a human right. and everyone should have access to the care that they need. This is not what we should be doing. And I want people to know that there are members in this body and in this Capitol who will continue to fight so everyone has the health care that they deserve, in this Capitol and outside of this Capitol. There is no good reason to pass this bill. It is cruel, it is harmful, and I think we should be very clear that it will affect people, moms, dads, brothers, aunts, uncles, grandparents, loved ones, members of our community, neighbors, workers, people who matter, people who deserve care, upwards of 15,000 people. People like Juana, who lives in Rochester, a middle-aged working woman with no spouse and grown kids, who said, when I was approved for Minnesota Care, she said, I've been wanting this more than a work permit. People like Jonathan, who lives in Mankato, who's a construction worker, who suffered a severe visual impairment due to an accident when he was a child, which resulted in the loss of his left eye. And because of the eye injury, he needs special prescription glasses that need to be checked every 6 months. The first time he went to the doctor, the cost was over $1,000, and he had relied on borrowing money from a neighbor to help him get some glasses. And he said now with Minnesota Care, he could finally take care of that eye injury. He could get the care that he needed so he could take care of his eye. These are the people that, with the push of our button from members in this chamber, we all have access to health care. We all have health care coverage. Our families have coverage. With the push of a button, we are going to take that care away from 15,000 Minnesotans for no good reason. This bill is not going to save us money. I agree with the author of this bill with one of the things that he said, that we should be honest about what's happening here. We should be. This bill is not going to save us money. This bill is going to cost the state money. As a nurse who takes care of patients in a hospital, I can tell you that it is more expensive when people do not have health care coverage. They put off care until it becomes an emergency, and then they are seen in the emergency room where care is far more expensive. Everyone is better off when people have access to health care coverage. Hospitals and clinics, which is why they supported this measure when we passed it previously, and they opposed taking it away. And all community members, we are all better off when people have access to coverage. My son was hospitalized last week. Started with a clinic visit, then some testing. He was seen in the emergency room, more testing, overnight in the hospital, more testing, and then clinic visits. At no point during all of that did I have to consider, gosh, should I do what the doctors are saying needs to be done? I didn't have to consider, should I do that or not? Can I do that or not? Because I have health care coverage, he has health care coverage, but that's going to be the reality for thousands of Minnesotans after this. This is not what we should be doing, members. Our job here is to make people's lives better, to help people, to improve people's lives. This is not what we should be doing. It is going to harm people, and we should be very clear about that. Vote no.
Senator Pa.
Thank you, Mr. President. I rise in strong opposition to this bill as well because of the stories like the one I'm about to share from Rosa in Worthington, Minnesota. I'm a 57-year-old farm worker who lives in Worthington since 2007. I wake up at 3:30 a.m. every day to begin my 5 a.m. shift at a hog farm. Breast cancer runs in my family. A few years ago, my family received devastating news that my aunt and niece were diagnosed with stage 2 breast cancer. Because these are multiple close relatives, I'm at risk of developing disease, and that doubles as my relatives were diagnosed before the age of 50. Before the Minnesota Care expansion, I was getting regular checkups without insurance. It was extremely costly. With Minnesota Care, I can now access regular mammograms, which means peace of mind for me, and I'm taking the care that I need for my health. Every time I get a checkup, I feel a sense of relief when I get a clean bill of health. Since the expansion of Minnesota Care, I have been able to finally sleep at night. Stopping my mammogram will prevent my doctors from detecting cancer early, increasing my risk of dying from this disease. Please do not cut essential workers from Minnesota Care. Mr. President, I want to thank Rosa for her courageous story and for sharing this story with all of us. My own mother-in-law passed away from breast cancer 16 years ago, and I remember how vital it was for her to receive the treatment that she needed while she had this disease and while she was in remission. To take life-saving health care away from people is unimaginable, and it is wrong. No one should be left to die simply because they cannot afford health care and treatment. Every single person, every single Minnesotan deserves the dignity of health care. Thank you, Mr. President.
Senator Clark.
Thank you, Mr. President. Mr. President, in my faith tradition, we read story after story of the need, the command to welcome the immigrant. During the depths of the pandemic, people across America rose up to the occasion to do the essential work to keep this country running. People like Emilio of Richfield, who stepped up to do the work that allowed others to shelter and slow the spread of COVID. During Emilio's work, he contracted COVID and still suffers from the effects of COVID today. Minnesota Care gives Emilio the health care he needs. Today's bill rips that away. Today's bill undermines the expectation of welcome and care that people in my faith community are committed to, and we recommit ourselves to every day. Today's bill does not live up to the promise that is Minnesota. I urge this body to vote no. Thank you, Mr. President.
Senator Ann Johnson Stewart.
Thank you, Mr. President. Well, let me be clear, this bill will not save money. It's punitive, it's cruel, and if you're looking for a reason to vote no that's a little bit more objective, I have a story. As you know, I owned a consulting business for 30 years, and several years ago, before universal health care became a thing, I had an intern named Mason. He fell on a job site into a rebar cage, and he literally got scratches on his legs, just scratches, and so I told him to go to the doctor to make sure he was okay and to get a tetanus shot. Now, Mason had grown up in a very low-income family. He'd never had insurance before, so when I told him to go to the doctor, he went to the doctor, which for him was the emergency room for scratches on his legs. When I found out that he went to the ER, I went through the roof. I couldn't believe that he went to the ER for scratches. The cost was many times what a simple visit to urgent care would have been. I remember the cost was about $1,600. When I asked him, why did you go to the ER? He was very confused. To him, the ER was where the doctor was. That's the only place in his life he had seen a doctor. And that's where the doctor is going to be for the people that we take insurance away from. So pretending that this is a bill that will save money is cruel, it's ridiculous, and I urge my colleagues to make the best financial decision for our state and vote no on this bill. Thank you, Mr. President.
Senator Friends.
Thank you, Mr. President, and thank you, members. Our nation's involved in a discussion about immigration, and as I look around the room, I see just about every one of us immigrated here from somewhere through our ancestors. So that discussion is legitimate. I'm a no on this bill, Mr. President, and I'll tell you why. I hear a lot of people talking about the work that our immigrants do, about the taxes that they pay, and I'd ask the members of this chamber, what is the logic of saying we will take your tax money and then saying, but you can't buy into our healthcare system? Ask yourself, when our ancestors came to North America with indigenous peoples here, if they would have treated us like that, what we would have said. and ask us, what kind of nation are we? A nation of immigrants, a nation that reaches out and lifts up. That's the duty of this chamber. That's the duty of our democracy. Mr. President, treat people well, and they'll remember that. Treat people poorly, and they'll remember that too. I'm a no on the bill. Thank you, Mr. President. Thank you, members.
Senator Marty.
Thank you, Mr. President. First thing I want to say is to be clear that the rhetoric from supporters of this bill is very offensive. It's intended to dehumanize our neighbors. The people this bill is kicking off of health care are not illegal. They're undocumented. They're not legally in the country under our current law, but no person is illegal, not even those who are accused of crimes, not even those who are convicted of crimes, not even the President of the United States with multiple felony convictions. They're not illegal people. They've done illegal actions. Calling people illegal is designed to dehumanize them. And all people, without exception, deserve health care. I urge you to read the letter on your desk from the Children's Defense Fund that talks about some of the harms of taking away health care from people. This is clearly the most disturbing provision in this year's bills, and it was done because it was required by Republicans in order to get a budget bill passed. Senator Wiklund and Representative Liebling 2 years ago fought very hard and gave coverage to at least a portion of the people who were not able to be covered under federal law. Next year, we're not going to stop this now. Next year, let's begin reversing course and providing health care to everyone. Let's make a commitment. Maybe within 5 years, we say we want to cover every person with no exception for all their medical needs. Everybody, young people, old people, immigrants, documented or undocumented, native-born people, everybody in this state without exception deserves health care. This is the most disturbing thing we're doing this year, and I urge your rejection of it.
Senator Herr.
Thank you, Mr. President, and I rise to oppose to this bill. I want to tell a story about Michaela, a small business owner in Minneapolis. She lived in Minnesota since 1994, and she's a small business owner, as I said. She's a taxpayer, and she believed that nobody should get a free handout. That's the reason she started working as a clerk at the store and now become a business owner. She had to work very hard while saving every penny that she earned in order to purchase her own businesses. Her job is very physical, and the daily demands of the job have taken a toll on her body, especially her knees. She has no cartilage left on her left leg, and last time she saw a doctor, her bone was crumbling. She has been waiting for a surgery for more than a decade. The pain is unbearable, she wrote. The pain is unbearable, and the gradual loss of my mobility has also affected my blood pressure and my kidney. For years, my family has been trying to find me a surgery, even offering to set up a payment plan to pay for it out of my own pocket, but we simply can't afford it. I became eligible to access Minnesota Care in January, thanks to the expansion. This is life-changing for my family, as I have my first knee appointment scheduled for June 10th, 2025. I have not been able to sleep since I heard that a adult might be getting cut from the program. Please allow me to get the care I have been waiting for decades. I want to be able to continue running my store. Otherwise, I will close my only source of income. This is what Michaela wrote. So please do not cut the essential worker from Minnesota Care. Members.
Senator Westland.
Thank you, Mr. President and members. I rise in deep, deep opposition to this bill. And I agree with what others have said. Evidence and facts do matter, but there have been so few facts put out to the people of Minnesota about the actual truth of our undocumented friends and neighbors who are, for the most part, paying, at least in part, for their insurance coverage. One of the most appalling things about the vote that's going to be taken shortly is that the full HHS budget bill is being held hostage to passage of this. If we do not pass this bill, taking thousands of Minnesotans off of health care, HHS will be defunded, and I find that repugnant. I'd even say it's an abomination. So what are the facts? The facts are that the number of people receiving care, the cost of that care has been so overblown and misinformed, and misinformation has been presented to the people of Minnesota. And as my good friend, Senator Marty, said, one of the things that is really the most appalling about the current atmosphere against our immigrant neighbors and brothers and sisters is the dehumanization that allows people to target some of the most vulnerable people in our society. It's a lot easier to take health care away from people. It's a lot easier to disappear people when you think of them only as, quote, illegal aliens, unquote. They are human beings. There's a party in this country that seeks to scapegoat people in our society. Your ills are because of somebody else. And the current scapegoat happens to be immigrants. And it is a shameful chapter in the history of our country. And we are about to take a vote in this chamber that will be a shameful chapter in Minnesota. And as a member of the Jewish community who is part of a people who have been othered, there's danger. We are treading on dangerous ground. This may be who we are, but this is not who we should be. This is not who we should be. And in my faith tradition, the sage Hillel was asked by a follower one day, "Can you please explain the entire Torah to me while standing on one foot?" And Hillel looked at the man and the temerity of the question, and he said, "Love your neighbor as yourself. The rest is commentary. Go learn it." And I don't know about you, but my faith tradition tells me that neighbor is an expansive term. It is not a term based on xenophobia, jingoistic beliefs. It is the idea that we are responsible for each other. Our destinies are tied together. Love your neighbor means all of our neighbors, regardless of where they come from, what they look like, who they love. This is a shameful day in this body. And I'm angry, and I will wrap up, Mr. President. I am angry because my majority leader had a gun put to her head, and she's going to take a vote on this, knowing that her caucus does not support this because she wants to make sure this budget is passed. It is a shameful day, Mr. President.
Members, as a gentle reminder, the member must speak only to the question under debate and avoid any personalities. Senator Grudenhagen.
Well, thank you, Mr. President. Yeah, I rise in support of this bill, and I have a number of reasons. One, they are human beings, okay? I agree with that. And I'll put my record of caring about human beings with the jail ministry, writing out checks, and I could go on, give specific examples against anybody in this room. I've spent a lot of time caring about human beings who find themselves in desperate situations. Number two, illegal immigration is bad for our state and nation, and in a number of ways. One, think about the victims of, because they're unvetted when they come here, think about the victims that have been raped and murdered, children, and the crime and the sex trafficking of illegal immigrants, okay? We need legal immigration. That is the compassionate thing to do. I understand the stories that you're telling, but they're misplaced empathy, because you're creating an incentive for them to come here illegally through the benefits that they give. And what I mean by that is they go through a gauntlet of the cartels who are being enriched by millions or billions of dollars. Fentanyl's coming in, killing our young people, and I happen to have some in my district who have died. That's what we're doing because it's unvetted. Now, they have an excellent program to go back to their country from the Trump administration, to fly back for free and get $1,000 and get in line to come here legally. We are all the great-great-grandchildren, and some have come here sooner, of legal immigration. We need legal immigration. Members, when you kill 64 million unborn children, you need legal immigration, okay?
Senator, you and I had this discussion before.
Yep.
And remember, I gently reminded you over the mic, and then I came to you personally and said that I would just caution you to remember that you're only supposed to speak to what's under debate. Illegal immigration is not under debate. Other things. We're talking about Minnesota care and coverage eligibility. So if you be so kind, because I know you mentioned before that I always remind you of that little saying, and I did it to remind everybody, but I'm just reminding you again. Sure. I'm not suggesting that you don't have a right to your feelings, but we as the Senate must, pursuant to Rule 36.2, must speak only to the question under debate. Senator Grudenhagen.
Yeah, it's not my feelings, it's my thoughts, okay? Feelings are secondary, thoughts are primary. But anyway,
well, my feelings and thoughts are we want to stay on topic. That's it. Okay? Thank you, Senator Grudenhagen.
Mr. President.
Senator Grudenhagen has the floor. That is who we're going to listen to at this point. Senator
Mr. President, point of parliamentary inquiry.
I'm going to, if it's something that cannot be, if there's no emergency, then I'm going to let him finish on the floor, Senator Lucero. Senator Grudenhagen.
Well, point to parliamentary inquiry, Mr. President.
I'm going to answer you later. Senator Grudenhagen.
Oh, thank you, Mr. President. Yeah. So members, let's support legal immigration and understand the devastating consequences of illegal immigration. The sex trafficking, over 300,000 children are missing at the border. 300,000 members. So I know there's some sad stories that have been shared, but it's nothing compared to the U.S. citizens who've been murdered or raped, or the illegal immigrants themselves and the exploitation they receive. And when they come here legally, they have a better chance of becoming part of the middle class and covered by our laws. Again, I understand your empathy for the stories you've told, but it's misplaced empathy. Care about the immigrant to come here legally, just like your great-great-grandparents came. And when they come, they'll be eligible for our benefits. They'll be eligible to be protected by our laws. When they come here illegally, not only can they be exploited along the way, they can also be exploited when they're here by employers and other people. Please come to your senses. Legal immigration we desperately need. Illegal is bad for our state, nation, but it's especially bad for the illegal immigrant. Care about them as human beings, please, especially the children and the women who are being terribly exploited. Please vote green on this amendment. We should eliminate housing, education, and college payments also. We should stop incentivizing them to come here illegally. God bless. Thanks.
Senator Seeberger.
Thank you, Mr. President. And I rise to remind
Mr. President,
Senator Lucero.
I was waiting for you to come back to me.
For what purpose do you rise?
The point of parliamentary inquiry, which is a privileged motion.
Yeah, but it requires, in order to be recognized. Senator Lucero, for what purpose do you rise?
A point of parliamentary inquiry.
Tell me what your point is.
So the question I have of inquiry is when I'm reading Mason's here, it is in order to discuss the consequences of the question before the body. The outcome, the consequences.
Where are you referring?
Where am I referring? It is Mason section 101. It's under the section where
101 says debate is limited to proposals before the House, which is what I read. Which
correct.
Is our rule. Yes.
So what I'm.
If you're not going to speak, Senator.
Would you like my question, Mr. President? That's what I'm trying to get to. A point of parliamentary inquiry, Mr. President.
You are rising for that purpose, and I read to you what Section 101 is, just so that we're on the same page. Yeah. So if you have a question that you'd like for me to respond to, Senator Lucero,
Thank you, Mr. President. This can literally take about 30 seconds. So, Mr. President, my point of parliamentary inquiry, which is a privileged motion, which you're aware of, is in order. My inquiry is, when you, Mr. President, interrupt a member as he's discussing, what motion is a other member supposed to make when you're giving advice to a member, such as Senator Gruenhagen here, when he was in the middle of a debate? How is a member, or the question would be, what is the process or the order for a member to rise to a question when another member believes that the president, the presiding officer, is out of order by interrupting a member?
Senator Lucero, I'm going to answer this, and I hope that you would also take a read of the very rule that you put forward. So the first thing is, under Rule 36, a member is only supposed to speak to what is before debate. The very rule that you refer to is Section 102. Excuse me, Section 101. It says a member, in fact, it's 101.2. A member who resorts to persistent irrelevance or to persist repetition after the attention of the House has been called to the behavior may be directed to discontinue speaking by the presiding officer. The matter that is before the body is what is done. Now, if you look at 101.1, it says debate must be confined to the proposal before the body. That's Mason's. We also have a rule. Now, that's why I gently reminded him, because we were not talking about immigration. We're not talking about those other things, because what's before the body is whether we should discontinue eligibility. That is what is before the body. And I gave him lots of latitude. Senator Lucero.
Thank you, Mr. President. And to further my point, and I'll end with this, is to me, and this was why I was rising to inquire of the presiding officer, Senator Gruenhagen's argument was, and the eligibility had been changed. That eligibility creates an incentive for illegal immigrants who come to Minnesota to take advantage of the eligibility. And so in my mind, it is directly connected and relevant to the question before the body. I believe that the presiding officer was out of order by interrupting Senator Gruenhagen with a very logical path in his comments. It was directly pertaining to the question before the body. And so that is my parliamentary inquiry, is what would be the proper order for a member to rise when the presiding officer is interrupting a member, when the member believes the presiding officer in that interruption is out of order.
Thank you for the inquiry, or thank you for the question. I believe it's been answered. I'll now turn back to Senator Seeberger is who I'm recognizing. Senator Seeberger.
Thank you, Mr. President. My concern with respect to the bill that is now before this body has to do with what I'm going to be seeing in the back of my ambulance. What I see when people are not able to get preventative health care, when they're not able to go to the doctor, when they're not able to get treatable conditions treated, when they are most treatable, they wind up in the back of my ambulance. I get people who are sicker than they need to be, who are have an advancement of a medical condition far beyond what it should be because they were unable to seek care. And this is what's going to happen with this bill. We are not saving money, we are losing money because the cost will be borne on us as a whole because it's more expensive. It's more expensive when you take an ambulance, it's more expensive when you're seen in the emergency room, it's more expensive when your disease progresses to the point where you need more aggressive medical intervention. That is my concern with this bill. Thank you, Mr. President.
Senator Ress.
Mr. President, point of parliamentary inquiry.
For what purpose do you rise there, Senator Pratt?
Thank you, Mr. President. Mr. President, I just wanted to follow up on Senator Lucero's questions. If we're going to follow Mason's 101, then I know a couple of members have referred to the health care bill, and I just want to refer you to 101.4 and 101.5. Debate on a bill is confined to the bill under consideration, does not extend to criticism of other bills, and it is out of order to refer in debate to a bill other than proposals not yet reported to the committee, or other bills not yet reported to the committee. So, Mr. President, if you're going to correct the minority members on debate and make sure that and interrupt them, then I hope that we're going to be fair and enforce the entire Section 101 in Masons. Thank you.
Senator Ress.
Thank you, Mr. President. I have no story other than I own my own. And it happened not 300 years ago when my ancestors fled persecution from the Catholic Church in France to protest their Protestant faith. It happened here in this building. I offered a way forward to House DFL members to care for these folks without jeopardizing our budget solution. I was rebuffed. I have a responsibility to support a solution for our budget, and this is it. I will be voting yes. Courage or cowardice? I cannot vote to shut down our state. I just can't. And that's all I have to say about that.
Senator Port.
Thank you, Mr. President. I rise in strong opposition to this bill. The district that I represent is full of small businesses, of schools where dozens of languages are spoken, of multi-generational housing and faith communities of every kind where people come together in community to worship and express their faith. My district is also full of people who need us here at the legislature to be focused on solving problems, investing in working families, and bringing our neighbors' visions for Minnesota forward. The emails, calls, and conversations that I have are asking for investment and support, not for cruel attacks on our neighbors. It pains me when young families, young parents struggle with how to afford housing for their families and getting their kids the daycare that they need. It pains me when seniors on fixed income have to weigh the challenges of increasing property taxes and the realities of needing to pay for more medications. But while new homes and free health care would be difficult to achieve, This one is easy. It is our job to make things easier, not harder. During COVID, when we couldn't go door knock, I did these meet and greets in parks and would have sort of these mini town halls where people could come and talk to me. And that is where I met Julia, who's a 17-year-old in a mixed documentation family. She has documentation, but her parents don't. And her mother was ill, and they didn't know why, because they were too scared to go to the hospital because they didn't know what it would cost. I met Julia again after 2023 when we passed the bill, and she told me that her family was like waiting with bated breath for the day that they could sign their mom up for Minnesota Care so that she could get the care that she needed. It was a day that my constituent felt like we had heard them. We had heard the thing that was weighing on their family, and we had offered them a path. We should expand access to care and coverage, not deny it. Minnesotans come from every corner of the world and choose our state to make it a beautiful and incredible place to live because of them. We don't have to be cruel and hateful. We can do better. This bill does not make healthcare more affordable for anyone. It does not make health insurance more affordable for anyone. We do not have to do this. I've taken a lot of votes that I'm proud of, and I've had a lot of high points during my time at the legislature. 2 years ago, when Senator Wiklund brought this policy idea to allow for undocumented people to access Minnesota Care to our caucus, I will say we don't agree uniformly on nearly anything. But that day, the support for this bill, for this policy to move it forward, was unanimous and overwhelming. It was one of the proudest moments of my career. This will be the worst. It is a disgrace. Please vote no.
Senator Umu Verbaden.
Thank you, Mr. President. I also want to rise in strong opposition to this bill. I have been blessed this year to be expecting my first child, and that has really put things into perspective for me. And as I was listening to Senator Herr read Michaela's story, it really reminded me of my mom, Rama Verbaden, who, like Michaela, is an immigrant and a small business owner who spent years doing very physical work. My mom became a citizen. She's retired now. Most importantly, she has health care. But when I hear that story, it reminds me of our shared humanity and that we are so much more alike than we are different. And that Michaela is no less deserving of health care than my mom. She's no less deserving of health care than any of us. Health care is a human right. So many of us here are children of immigrants, and I think feel this so personally. My heart really breaks for these kids who are going to watch their parents lose health care coverage and are going to worry about their parents who they know won't be able to get the care that they deserve, who aren't going to be able to focus on just being kids. We know that because we've been there, we worried about our parents, and we saw the struggles that they went through. And I promise you that those kids know this is a life or death issue. This bill, just to put it simply, is cruel, it's racist, it's deadly. I hope that
Mr.
every
President,
single
point of
one
order.
of you, I hope that every single one of you thinks about those kids and thinks about families when you vote today.
Members, when someone stands, I want to make sure that I hear what they have to say, and if you would stop talking at that time, that would be helpful. I know this is a tough issue. For what purpose do you rise, Senator Lucero?
Mr. President, I rise to a point of order under Mason Section 124.3.
Give me one moment so we can see where you are now. 124.3. I'm there.
Thank you, Mr. President. There's been a number of times during this debate that I've had some restraint, but this one was over the edge. I've heard the term cruel, I've heard the term hate, and I now have heard the term racist. It is not acceptable to question the motives of anyone, but we must confine our remarks to the question before the body. I would encourage you, Mr. President, to remind the body of this very important rule. Thank you.
As I've been reminding you you all for quite some time, under Rule 36, I said your debate must be focused on what is before the body. The other thing I want to remind you of is Section 124.3, which is where I thought Senator Lucero was going. Just remember this, and I'm not speaking to anyone in particular. What I try to do is make sure I'm as general as possible for every member that's in the body, because we all must function under these rules. Section 124.3 says it is not the member, but the proposal that is subject of debate. It is not liable to impugn the motives of a member, but the nature or consequences of a proposal may be condemned in strong terms. Now, I'm not going to make the cross-reference to strong terms because it talks about, in Mason's, profanity, terms that are out of order, and you guys are great senators. So I need us, even in these challenging moments, to function at our highest level, and that's not to anyone in particular. Thank you so very much. Senator Umu Verbatim, were you done?
Thank you, Mr. President. I would just ask members to remember everyone's humanity as they vote today. Thank you.
And the last thing I will say, because I wish I would have said it before Senator Verbatim's last comments, members, when you yell in the microphones, it doesn't help. It really hurts our ears. And in fact, they told me before that I should say something about it because it also distorts the audio as well. Okay, so just be mindful. I want to be able to hear you clearly. With that being said, I'm now going to Senator McQuaid.
Thank you, Mr. President. Oh, the unimaginable cruelty of this bill. 15,000 Minnesotans, and that's 15,000 right now. Because I said earlier, they're making more immigrants undocumented every day, trying to take away birthright citizenship. It's 15,000 today. Who knows how many it will be? 6 months? In a year? This is a shameful day. It was brought up by the bill author that Minnesota stands out here. We're the only state. I am proud to be the only state that sees immigrants, regardless of their status, as full people who deserve health care and to live and not suffer and die. I am proud of that. And we will remember this day, Minnesotans will remember this day, that while Republicans in Congress are working to kick 15 million people off of Medicaid, Republicans in Minnesota got there first to kick 15,000 off. This is not happening in a vacuum. The author can dress this up about an economic argument, and I hate having to turn people into economics to make other people care about their existence. But we will remember that while masked gangs raided elementary schools and kidnapped students for writing op-eds and disappeared toddlers and high school students who coach volleyball and play in the streets with their friends while they trafficked kids with cancer and arrested U.S. citizens, that the Minnesota Republicans' #1 priority was to take up that mantle of cruelty and inhumanity and bring this vote to the floor. That when the mom who's getting dialysis loses her health care, and her kidneys start to fail, and the toxins build up in her body, and the fluids amass, and it makes it hard for her to breathe, and then she will finally go to the ER, and her kids will miss school and band practice and tests to sit there and hold her hand and weep while her body shuts down. And after she has died and she is buried, her kids and her husband and her community members, her church, they will be able to look at that board and they will be able to see who did it. When the construction worker who's building houses in Owatonna hurts his back and he can't see a doctor and he can't afford a PT and he wastes away in a recliner every day, unable to pay for his family, and they lose their housing, they can look at that board and see whose fault it is. This is grief, it is rage, and the only modicum of relief I have from this is that this vote is public, and it will live on. People will ask us, what did we do at this time when people were getting disappeared and trafficked to detention camps in third countries that no one's ever been to? They will ask us what we did. That board, that's what we did. My grandfather he was in World War II, and I remember learning about World War II, and I remember asking him, what did he do about the bad people? I was really young. And he said, baby, I fought him. He pointed to his Purple Heart. Some of us in this room will be able to show our kids videos, or our grandkids, or our great-grandkids. Our descendants will be able to pull up these videos and see what we did here today. But for those of you who are part of the badness, you better start practicing your explanation right now. This is 15,000 people today. It could be 30,000 in 6 months. Mr. President, I don't often bring my faith into things. It's something that is strong. I lettered in Fellowship of Christian Athletes in high school. It has long been a part of my life. I prayed with my pastor this weekend, and we read Matthew. For the king will answer them, truly I tell you, just as you did to the one of the least of those members of my family, you did it to me. This is a horrible day. This is a horrible priority. It's a horrible thing to do to people. To call them illegal, to say they don't matter, to say that their taxpayer dollars somehow don't exist, that their families don't matter, that their pain and their suffering doesn't matter. I have taken a lot of votes that I like. I have taken votes that I don't like. I have never taken a vote that asks me to rip away people's life and dignity, their humanity. This is not happening in a vacuum. I don't even know how to strongly say anymore, we should not do this. This is not a political game. These are people's lives. People will die. There's a reason the Rural Hospital Associations oppose kicking 15 million people off of Medicaid. It's because it will devastate those hospitals. What do you think will happen to the hospitals in Minnesota when we take away Medicaid from people? We should not do this. And of course, there's a contingency plan right in the next bill that if we don't do this, that the Minnesota Department of Health won't get funding, that no health funding for the entire state of Minnesota, a shameful priority. And we shouldn't do it, Mr. President. I urge members to vote no.
Senator Mann.
Mr. President, point of parliamentary inquiry.
For what purpose do you rise, Senator Pratt?
Thank you, Mr. President. Just a quick question under Section 101 on Masons. Is it appropriate to refer to other bills not under consideration?
Senator Pratt, I noticed that we are making a mockery of our process, I feel like, right? When it comes to other bills, I try to give everybody a little latitude when it comes to things, and I still try to make sure that it is tied to the matter that is before us. Members, will you please do not just keep standing just to interrupt debate or to take us off kilter. So to your question, If here's what you said under 101. What was the site? Was it section 101, Senator Pratt?
Yes, Mr. President, section 101, it's 4 and 5 that talk about debating bills in front of the House and debating bills that are not in front of the House. And the only reason I asked, Mr. President, is that we had an interruption of a member of the minority, but we've not seen that same type of holding to the rule as tightly for the majority, and I'm just trying to find out where that line exists.
Senator Pratt, I take exception with that, is because whenever there's this thought that I'm going to treat one party or one side better than another side, so I reject that, and I wish that you would change that because that's so untrue and unfair. I'll go against my caucus as I will anyone else. I'll read the rules before our caucus, my caucus, and any other caucus. So I reject that, first of all. But respect the fact that you're entitled to your opinion, and just because you say it doesn't necessarily make it right. Now, to the specific notion that you put forward, under debate, it says debate on the bill is confined to the bill under consideration and does not extend to the criticism of other bills before the House or in committee, or even though they relate to the same subject. I would hope that you'd have that same criticism when I'm talking to another member who's on the GOP side, where they go and start talking about things on a federal level, and they start doing those other things. So the same consideration you want to give me, I would hope that you would give your members the same thoughtfulness. So with that being said, members, we are only supposed to debate what is before the body. With that being said, and I hope that Senator Pratt will look at the rules and also listen to the debate and be thoughtful about it. Senator Mann.
Thank you, Mr. President. I would like to go back to the very opening statement of this bill, and that we are doing this because we have to, quote, hold back taxpayer dollars. Well, by doing this, we just doubled taxpayer dollars. We just tripled taxpayer dollars. We just increased costs to our hospitals, who now have to pay for more uncompensated care. In turn, you just increased our ER wait times, as people have to wait longer now to see an ER physician because people are getting primary care in the ER. You just made sure that clinics have longer wait times, because now hospitals have to pay for care instead of staffing their clinics. And as healthcare systems have to pay for care, prices go up. And then you know what happens when the hospital increase their prices? The insurance companies increase their prices and premiums go up for everybody. So this bill just increased healthcare costs for everyone. You just made sure that people can't go to work, and employers now have to eat that cost. And you know who they pass those costs down to? The taxpayers. You just made sure that work productivity decreases because people don't feel good and can't get care. This does not hold back taxpayer dollars. This significantly increases taxpayer dollars across the board for everyone, and we all know it. So we also continue to hear the outright lie that this will cost hundreds of millions of dollars. Today, the number that was said out loud, because this number changes weekly, was $240 million. And that if we do nothing, we're going to add millions of dollars to this number. This amount will triple. So, Mr. President, will Senator Rasmusson yield for a question?
Senator Rasmusson, will you yield? He will yield. Senator Mann.
Thank you, Mr. President. Senator Rasmusson, now that we are going to pass this monstrosity, we have captured those savings. Can you tell the body how much we are saving by removing health care from 16,000 people?
Senator Rasmusson, to the question, sir.
Thank you, Mr. President, and thank you, Senator Mann, for the question. If we go back to the February forecast, the Walz administration said that this program over 4 years was going to cost Minnesota taxpayers about $220 million. And, Mr. President, that was assuming that in the first year you'd have fewer than 5,800 enrollees. And by mid-April, we know that we have more than 20,000 illegal immigrants enrolled in this program. And we have seen, Mr. President, by looking at other states, to California, to Illinois, that their experience has been similar. In California, the cost overruns have been in the billions of dollars. And so while we don't know exactly how much this measure will save taxpayers, we do know that it'll be hundreds of millions of dollars. And Mr. President, again, the February forecast was from Minnesota Management and Budget. That is what they put forward for the taxpayers, and that was assuming a much lower enrollment rate than what we've seen in actuality.
Senator Mann.
Thank you, Mr. President. Well, Senator Rasmusson, you were wrong. You made several assumptions there that were all incorrect. And in fact, because this bill is passing, we have the savings captured in writing here. So the first year, this year, we are going to save $13.2 million. Not hundreds, it's right on the line. It's right here. Everybody has it. $13.2 million. And next year, it's going to be $43 million. So even if we do this year, next year, the year after that, and the year after that, we still will not reach the $240 million that we are just throwing up in the air. So I'm not sure why these assumptions are being made and why these false numbers keep being brought up, but it is so false because, again, it's right here, $13.2 million this year. So that's the cost of ruining the lives of 16,000 people. That is wonderful. We must be missing some zeros in our spreadsheet here. I don't know what else the discrepancy could possibly be. So if you take this number, the actual number in real life, which is barely a rounding error in the state's budget, and you add all the expenses that we talked about, we just increase costs to all Minnesotans. And I would be remiss if I don't mention the fact that people do not immigrate for health care. They're not going to leave a country with universal health care, which is like every country except for ours, to come to a country where they have to pay for their health care, and if they don't, they die. That's not why people immigrate. And the fact that these wildly erroneous things are said about immigrants on this floor repeatedly just goes to show you that you know nothing about immigrants. And I wish that you did, because your lives would be so much richer if you did. And also the concept of misplaced empathy. Our friends are going to die. Our neighbors are going to lose their limbs. Our family members are going to suffer. And you call that misplaced empathy. Empathy is not a weakness. Empathy and compassion are integral parts of this job. Empathy is literally our responsibility. Today we heard stories from Gabby, who is scared she's going to lose another limb, and she wants to continue working and raising her family. We heard from Manuel, who was able to seek life-changing care to treat his back pain, which allowed him to return to work. We heard from Michaela, who has lived in Minnesota since 1994. And she says, please allow me to get the care I've been waiting for so I can continue running my store, or I will lose my income. You are preventing people from working. You are cutting off our tax base. You are decreasing state revenue. You are making healthcare more expensive for all Minnesotans. And perhaps the most important thing is that you are increasing human suffering, and people will die. Colon cancer, breast cancer, cervical cancer, all these things will go undiagnosed. And the numbers which you use to sell this are all made up. This has nothing to do with fiscal responsibility. This is sick. This is a sad day in the Minnesota legislature where we have definitively put politics over people. Thank you, Mr. President.
Senator Murphy.
Thank you, Mr. President. Stripping the health care coverage from undocumented Minnesotans was the chief goal of the negotiations in this budget cycle. And I, in order to fund the government, struck a deal, and I gave my word, but I do not support this proposal. And I believe your political calculus, for those of you who support this, is wrong. And I believe it's wrong because Minnesotans are compassionate people. And for all of my career in politics, before I was elected and since, Minnesotans have showed up for one another, and they've fought for one another. This proposal is a wound on the soul of Minnesota. I was a very young nurse and a very young organizer when I stood in the governor's reception room in Minnesota Care was signed into law in 1992. I had no business being in that room, and I had no business being in that photograph, but I had a shit-eating grin on my face, recognizing that I was in a place and astonished by the power of a compassionate people who decided to lead the nation and make sure that people who worked for a living but didn't have employer-based coverage would have the means for access to pay for it with premiums. They would have access to care. We did that in Minnesota. We led the nation. And as a young nurse who believed then, as I do now, that every person is entitled to health care, I became very committed to the kind of politics that showed me and the kind of politics that I believe in today. Since 1992, those enrolled in Minnesota Care have endured political attacks and suffered budget cuts. We've expanded coverage, we've retracted coverage, and we've expanded coverage again. It is the nature of our politics, and it's not all based in budgets. So in 2023, Melissa Wiklund, Senator Wiklund, in 2023, I was astonished again by the power of a compassionate people, compassionate Minnesotans who chose, through the actions of this legislature, to expand coverage to undocumented Minnesotans, people with whom we work, people with whom we worship, people with whom our children go to school. We live side by side in our communities across the state of Minnesota. They are every bit Minnesotan, as am I. You've heard my colleagues today talk about the fiscal impact and the rationale for a financial decision, and it's just false. And those of us who have spent our career in health policy, we know that when people lose coverage, they still get care from people like me, and Senator Klein, and Senator Mann, and Senator Bolden, Senator Liskey, Senator Abler. We still provide care. It just doesn't get paid for anymore. It eats at the system, especially now in rural Minnesota, where we're seeing more and more of the system caving under the pressure of an insurance industry that doesn't give a dang about people. The people who are going to lose their coverage because of this action today work for a living. They pay their taxes, and for some reason, that's some hallmark of goodness in government. Like it matters more if someone pays their taxes. And the people who are losing their coverage work and they pay their taxes. And yes, they pay premiums for their coverage. This is not free care. Minnesota Care's never been free care. None of it's free. They pay their premiums. Just like you and just like me. They're just like us. They're just like us. Minnesotans are compassionate people. Over and over again, in the many years that I've done this work, they have shown us that they do not, they will not support this. And your political calculus on this is wrong. And we'll test that out with the people of Minnesota. But let me say to those who may be listening or not, because they're caring for their children and they're at work, but those who are losing their coverage, know this: you will get care. Our hospitals will care for you. The providers, doctors and nurses and others will care for you. And just like we have in the past, when we have lost coverage for people, we have continued to fight. And we win. And we will regain coverage for people because we are a compassionate people, and that's what we do in Minnesota. I made an agreement. I gave my word. I will vote for this. It's among the most painful votes I've ever taken. Thank you.
Members, the last two speakers we're going to have is that of Senator Johnson. Senator Westrom, did you want to go before Senator Johnson? Because the last two that we had on the list were Senator Johnson and then Senator Rasmusson. Senator Westrom.
Mr. President. Members, I rise in support of Senate File 1 to put Minnesotans first in the long list of priorities that we as legislators elected from our constituents, the residents in our district, send us here as a representative democracy, a constitutional republic, to decide matters for the state of Minnesota and its residents. We have heard an awful lot of hand-wringing going on here, questioning priorities. And if money grew on trees, we may be able to provide health care for everybody in the world. That seems to be the argument we're hearing from the Democrats, that it shouldn't be Minnesotans first, but everybody else should be first. And if we have enough money left over, we'll help Minnesotans. So members, let's dial this back. Let's focus on our priorities. The Minnesota residents, the Minnesota taxpayers, the legal voters that call Minnesota home and are legal residents in our state. We have to have a place and a way to sort out who are we going to prioritize. And I'm standing here to tell you it is a red barn question that everybody should be able to get right, that taking care of Minnesotans first ought to be our first priority. That's the taxpayer money we are using, we are elected here to spend. And you might say, what is a red barn question? Well, when I went to high school, we had a choir teacher who would often bring up red barn questions because the answer was so obvious you questioned yourself of whether you're missing something. And so whenever he'd bring up the statement, this is a red barn question, you'd almost get so nervous that you're saying the wrong thing that you'd almost say the wrong thing because you didn't want to say the obvious thing because is it a trick question? It's not a trick question, members. Let's see if everybody can get it. What color is a red barn? A red barn is red. That's the right answer. You got it right. Who should Minnesotans prioritize first? When you've got a only set amount of money, should we prioritize Minnesotans first or the rest of the nation and world? This is a red barn question, members. Minnesotans first ought to be the priority. It's their taxpayer money that we are deciding on here today. I remember, too, when Minnesota Care was developed or passed for the first time, probably similar age to Senator Murphy. I was in college at the time. Remember, it was very controversial. But it was passed for Minnesotans to have health care that couldn't afford private policy, but could afford some premium, and it would give them some coverage for health care. The priority was for Minnesotans, the Minnesota residents and taxpayers. It wasn't called Iowa Care because we weren't setting it up for people that snuck over here from Iowa. It wasn't called Florida Care because it wasn't eligible for those from Florida. It was Minnesota Care. Again, a red barn question. That's who Minnesota Care should be for. It wasn't set for other countries if they could find their way to sneak into Minnesota. It was for Minnesotans. And so, members, supporting SF1, Senate File 1, is a red barn question. We should all be able to support taxpayer dollars going towards Minnesota Care for Minnesotans. The idea that the Democrats funded illegal immigrants, making them eligible for our Minnesota Care healthcare system, is unsustainable. And so that's why I rise and urge your support of Senate File 1 as we try to balance the budget, but with common sense priorities of making Minnesota Care a priority for Minnesotans first, the same people that are the taxpayers that work so hard to pay their state taxes. It's kind of a no-brainer. It's really not that complicated. It's as easy as answering, what color is a red barn? I urge your support, members.
Senator Johnson, I'll now go to the author of this bill, and then we will vote. Senator Rasmusson.
Thank you, Mr. President. This bill is about fiscal responsibility. It's about fairness, and it's about putting Minnesota families first. I'll first talk about the fiscal responsibility. This expansion of taxpayer-funded health care to illegal immigrants is clearly a failed experiment. It has only began in January 1 of this year. Enrollment started for illegal immigrants. Democrats told us that in the first year there would be 5,800 enrollees. By mid-April, we exceeded 20,000 illegal immigrants enrolled in this program. Well, the initial cost estimates from the Walz administration were $220 million. We know from looking at other states that this is going to cost taxpayers much more. And that, Mr. President, is why no other state does this in the country. The other two states that have tried this, California and Illinois, have liberal Democratic governors that are proposing rollbacks. Governor Newsom in California, after this program, a similar program, cost their taxpayers billions of dollars in cost overruns. Governor Pritzker of Illinois is proposing rollbacks to their program as well. And so, Mr. President, when this bill is signed into law, Minnesota will do what the vast majority of states do that are run by Democrats. This is not a radical proposal. What's radical is to leave this special session without fixing this failed experiment and this problem that will continue to grow our deficit and put a burden on Minnesota taxpayers. Mr. President, the savings from this bill are being absorbed in the Health and Human Services bill. And many of the dollars that are spent in our Health and Human Services bill are eligible for a one-to-one federal match, a one-to-one federal match. And so, by redirecting the savings to that bill, we are doubling the impact for Minnesota taxpayers. Mr. President, but this isn't just about numbers. It's also about fairness. I got a call from a constituent who's a small business owner who, him and his wife work very long days running their small business. They're there from start to close, and they don't make a whole lot of money. They told me and shared with me that they themselves can't afford health care right now. And he asked me the question, why are my tax dollars going to incentivize illegal immigration, going to pay for a health care benefit that is more generous than what most Minnesotans can afford? And I couldn't give him a good answer, Mr. President. I also want to say very clearly that illegal immigration is not compassionate, and incentivizing it is wrong and leads to human suffering. In my hometown of Fergus Falls, we saw a trial and a conviction and a sentencing recently of human traffickers who were bringing an immigrant family into this country, and they left them to freeze and die. We have stories, not just in Minnesota, but across the country, of how illegal immigration leads to human suffering, and it's wrong to incentivize it. Mr. President, this bill, this proposal, is about priorities, and it's about putting Minnesotans first. And during this debate today, Minnesota Democrats made their priorities clear. 2 years ago, our state had an $18 billion surplus. Now we're facing a $6 billion deficit because of reckless spending. And Minnesota Democrats, during the regular session and during this special session, are proposing cuts to Minnesota nursing homes. They're proposing hundreds of millions of dollars in cuts to disability services for Minnesota families who have disabilities. They're increasing taxes on nursing home residents today. They're proposing cuts to special education. And Mr. President, we've seen that Minnesota Democrats are okay with that they're supportive of that. We've seen actions in this special session that will show that. But I didn't hear a single Minnesota Democrat stand up today and talk about putting Minnesotans first. The most vigorous defense that I've seen this year is on behalf of illegal immigrants and having taxpayer-funded benefits go to them, while we are facing tough budget decisions that will lead to critical services for Minnesota families being cut. So, Mr. President, I would urge members to vote yes. This is fiscally responsible. This is about fairness. This is about putting Minnesotans first, and I would ask for your support. Thank you, Mr. President.
The Secretary will take the roll on House File 1.
Mr. President.
Senator Rasmusson, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Drazkowski votes aye.
Senator Drazkowski votes aye.
And thank you, Mr. President. Senator Lang votes aye.
And Senator Lang votes aye. Senator Bowden, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes no.
Senator Mohammed votes no.
And Senator McEwen votes no.
Senator McEwen votes no. All senators having voted who desires a vote, the Secretary will close the roll. There being 37 ayes and 30 noes, the bill is passed and its title agreed to. Remaining under motions and resolutions, we'll revert to the 8th order of business, introductions and first reading of Senate bills. The bills listed on today's introduction addendum are given their first reading and referred as indicated. Members remaining under motions and resolutions, we will revert to the 3rd order of business, messages from the House. The Secretary will read the first message.
Mr. President, I have the honor to announce the passage by the House of the following Senate file herewith returned. Senate File Number 3, a bill for an act relating to state government appropriating money for environment and natural resources. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
No action required. The Secretary will read the next message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted. House File Number 2, signed Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, no action is required. We'll now go to the next order of business, which is the fourth order of business, first reading of House bills. The Secretary will give the bills its first reading.
House File Number 2, a bill for an act relating to state government, amending provisions on the Department of Health, Finance, and Policy, health licensing boards, pharmacy benefits, the Office of Emergency Medical Services.
The House files have been given its first reading. Remaining on motions and resolutions, I'm now calling on Senator Murphy for a motion.
Thank you, Mr. President. I move that an urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to House File Number 2, and that the rules of the Senate be so far suspended to give House File Number 2 its second and third reading and place it on its final passage, and I ask for a roll call.
Roll call requested, roll call granted. The Secretary will take the roll on the motion to suspend the rules. Senator Broden, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
And Senator McEwen votes aye.
And Senator McEwen votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Dames votes aye.
Senator Daines votes aye.
Senator Lang votes no.
Senator Lang votes no.
Senator Drazkowski votes no.
Senator Drazkowski votes no.
Senator Abler votes no.
Senator Abler votes no. All senators having voted who desires to vote, the Secretary will close the roll. There being 45 ayes and 22 noes, the motion to suspend the rules prevails. The Secretary will give House File its second reading.
House File Number 2.
The House File has been given its second reading. I'll now go to the author, the chief author of the bill, to explain the bill. Senator Wiklund.
Thank you, Mr. President. House File 2 is the HHS Omnibus Finance and Policy Bill. And this is a bill that is made up of 3 sub-targets, just to bring this back to your attention again. We had 3 sub-targets to meet in addition to the overall global agreement target. There was a target for the health section of the bill. There was a sub-target for the children and families portion of the bill. And then there was another sub-target for items that crossed over between the Health and Human Services Committee and the Human Services Committee in the House. So we worked diligently to meet the targets as needed, worked with the House and the Senate together with the administration to come up with the bill that you have before you. We worked to make the most of these targets that we were given. Each of them had to be addressed separately within the specific guidelines that we were given by leadership. Leadership decisions had an influence on this bill in significant ways. As has been referenced, one of the things that is not carried in the language in this bill, but the spreadsheet contains the accounting for the elimination of access to health care coverage for undocumented adults. That was not a decision I supported. Also, there is language in this bill that will make, that is contingent language, that makes the Department of Health's budget contingent on passage of that bill and enactment. While the Senate brought in a bill that did not make cuts to public program benefits, we unfortunately couldn't maintain that goal with the health target, and that is an area that I am concerned about. Other target areas faced constraints, and overall we had to be very selective about what we included in terms of priorities from the House and the Senate and the administration. However, there are numerous things in this bill that address critical concerns for our state and will improve the lives of Minnesotans. I'll just go through a few highlights from the various sub-target areas. In the health area, I'd say in the big picture, some of the things that I'm really most pleased about are inclusion of the rates proposal to allow the Department of Human Services to apply for a directed payment program to address our medical assistance rates. When the bill left the Senate, we were intending this proposal to cover not only mental health rates, but also outpatient services and providers. So it would have been a broad ability to address the rates for these providers across Minnesota. Through negotiations, we were unable to retain the provision or the part of the proposal that would increase rates for physicians outside of mental health. And so what is contained in the bill is that the department can request a directed payment program for mental health services that have Medicare codes, and then also removing the 20% master's level cutback that was enacted into law some time ago. And it was disappointing not to be able to include all the other rates, because I think strengthening our mental health system is certainly a high priority and one of my highest priorities. But we also need to consider that mental health is connected to physical health, and our providers, physicians in rural areas desperately need to see rate increases as well. There's also funding in this bill to support federally qualified health centers. That will be a very helpful increase for really essential providers in communities across the state. Also some funding for community clinics as well. Another highlight for me is the support in the bill for pharmacy services. We have included a directed payment program in the short term, and also a move to a state PBM, and Senator Mann will discuss these provisions further. In another funding area in the bill, is expanded funding for EMS. That was a very high priority for the Senate, and we were including it in the rates proposal at that time, but now we brought in House proposals that will fund the operating deficit program and also a rural uncompensated care program. And there is over $32 million over 4 years included in this bill. Some of the concern areas that I have in the health area, we had a lot of discussion about facility fees when the bill left the Senate, and I had really hoped that we would be able to retain some form of facility fee prohibition and greater notification processes, but those were not accepted by the House. We were able to include funding that will require reporting by hospitals on facility fees for these provider-based clinics. And so we will be able to get a better understanding of how much revenue is coming in through the facility fee process to these locations. Also, I just want to mention that the House had brought in more cuts to the Department of Health, and we were able to avoid taking some of those proposals. We retained, I think one of the things I'm glad about is that we were able to retain all of the long COVID grants that the House had proposed eliminating. We also added funding for infectious disease prevention and a dementia services program and an epilepsy state coordination plan. This bill contains some additional coverages for medical assistance that will benefit maternal and baby health. There's additional rates increases for home births, birth centers, phototherapy services at home, and there is Senator Miller's provision for the newborn screening addition. I mentioned in the beginning that the Senate wasn't including any cuts to medical assistance benefits. We did, through a governor's proposal that the House accepted, unfortunately have to include a cut to the chiropractic services for adults. This is not something I desired or wanted to include. We worked in the Senate to, we didn't accept that proposal, but unfortunately in trying to meet the target and meet the offers that came over from the House, that was one that we included. And we also included a soft limit on occupational therapy and physical therapy services that introduced savings for our budget. In terms of the children and families area, the two big successes, I think, from this bill with the target we had were that we were able to retain $12 million in funding going towards addressing food insecurity. Money will go to food shelves, food banks, and prepared meals, and also to tribal or food sovereignty programs. Secondly, we were able to attain and have available $35 million to go towards the IT modernization of the child welfare system, which we hear a lot about SSIS and how it is so lacking in what it can do. It needs to be modernized, and while we came in with $10 million that was the governor's proposal, the House had come in with a much higher number, and through much negotiation with the House, I was happy to work with them to advance or increase the number, and we were able to get to $35 million, which will allow the Department of Children, Youth, and Families and Minute to proceed with that system development. This is a system that affects the lives of 150,000 kids who are in our child welfare system. And so being able to move that project forward was a really important item to us, and I'm really glad that we were able to get to that level. It goes along with other system modernization work that we started 2 years ago. It's been a priority for me as someone who has worked in the IT area to try and help our Minute and the agencies work with the legislature to come up with better sustainable ways to enhance or to modernize our current systems. Areas of concern with the children and families aspect of the bill, we weren't able, with the small target, we had only a $6 million target the first biennium and a $15 million cut target in the second biennium. We were not able to provide any additional funding for much needed child care programs such as early learning scholarships or CCAP or other ways to address provider salaries, and that is something that we will continue to struggle with, and we need to try to figure out ways to make child care affordable for families and allow providers to receive adequate compensation. Another troubling proposal that I wasn't that interested in including, but was added as part of the leadership agreement, is a requirement to implement video cameras in a subset of child care centers based on their having a maltreatment memorandum. I appreciate that the implementation date for this program is not until July of 2026. And I think in the next session, we will definitely have discussions in the Senate about the proposal and ways to investigate and address concern areas that I have. The other parts of the children and families section of the bill address kinship modifications. There is a change in definition of neglect for children that are stuck in hospital situations. So some policy language there. There's also some child care regulation policy language. Not as much as it would have been nice to include, but we tried to include as many proposals as we could. In the human services HHS section of the bill, two large areas of success there were attaining the ability to provide $6.5 million per biennium of funding for HIV grant programs. We know that there will be and have been federal cuts, and it's really necessary for us to try to put as much state funding towards this as we can, and I wasn't able to achieve the level that we came in from the Senate, but we were able to secure $6.5 million per biennium. There's also additional funding for homelessness programs such as the Homeless Youth Act and the Safe Harbors program, which are very important, as well as grants to support a pilot of family supportive housing and also a homeless elders program. In mental health, there are several initiatives that the Senate supported, money for a mental health collaboration hub, a pilot project for the Lower Sioux tribal community, and also additional funding for school-linked behavioral health grants. We reduced the cliff for that program. And both the House and Senate carried a proposal for the Clay County PRTF, and that funding is in there. And then in this section of the bill, there's also the full funding for the governor's program integrity proposal, which will bring funding to the Department of Human Services to strengthen the fraud and program integrity units in the OIG. So those are some of the highlights, and be happy to answer any questions.
Members, thank you so very much. We're going to go to amendments first, and then on third reading, if individuals want to speak, you're more than welcome to do so. We'll begin with Senator Gruenhagen.
Well, thank you, Mr. President. Yeah, I'd like to offer the A4 amendment.
Senator Gruenhagen offers the A4 amendment. The Secretary will report the A4 amendment.
Senator Gruenhagen moves to amend House File Number 2 as follows, page 438 after line 21, insert. This is the A4 amendment.
Senator Gruenhagen, specifically to your A4 amendment, sir.
Okay, thank you, Mr. President. Yeah, members, this amendment was generated by a retired state employee who follows my email updates and follows me on Facebook. She was a member of the state employees for over 2 decades. And she lists a number of reasons why she left Minnesota. And I'm not going to cover them all, but I just covered one that this amendment relates to. She said, again, this comes from a retired state employee who worked for the DOC, the Department of Corrections. She said, your criminal inmates are now getting $100,000 transgender surgeries that you, the taxpayer, Minnesota taxpayer, are being billed for. She adds, yes, this happens. Male offenders are given laser hair removal, and you, the taxpayer, pay for this service. Two paid officers escort these offenders in handcuffs to the doctors for these services. Minnesota is crazy, out of control. So members, what this amendment does, it says that health care does not include gender-affirming care for criminal inmates. I think if you check with your constituents, independent, Democrats, or Republicans, for them to realize that they're paying $100,000 for these transgender surgeries for criminals, $100,000, members, when we're facing a $6.1 billion deficit, I think 80 to 90% of them would oppose that. When we're cutting nursing homes, cutting the disabled, cutting our education program, and yet we're turning around here and spending $100,000. I know it's difficult to break promises, but members, I believe this is a matter of urgency, and we need to stop this spending. These inmates that want transgender surgery, they should get treatment for gender dysphoria. So members, roll call, and please vote green.
Roll call requested, roll call granted. Senator Klein.
Thank you, Mr. President. I rise to a point of order under our rules 35.2, germaneness. This amendment pertains to statutes governing the Commissioner of Corrections and our judiciary system. The Commissioner of Corrections is identified within the amendment as the entity to enforce this amendment. I ask you to rule the amendment out of order.
Senator Gruenhagen, before I rule.
Yeah, advice, Mr. President. Yeah, I was hoping Senator Klein would be in your position substituting so that he couldn't do that. But he has a habit of doing that on our amendments, mine in particular. Anyway, you know, we're talking about health care. This is an HHS budget, and it's referenced right in the amendment, Section 8, and it applies. And I've had staff review this, and they say it is germane to this. So, Mr. President, I urge you to rule that this point of order is not in order. Thank you.
The point of order is well taken. Senator Gruenhagen, you have another.
Mr. President, I appeal the ruling of the President and ask for a roll call vote.
Okay, we have Senator Westrom who wants to appeal the ruling of the President. He asks for a roll call. A green vote supports the ruling of the President, and a red vote goes against the ruling of the President. The Secretary will take the roll on the appeal of the decision of the President. Members, please vote. Senator voting. For those voting pursuant, okay, you need a little more time, no problem. Senator voting. For those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
And Senator Fateh votes aye.
And Senator Fateh votes aye. Senator Jasinski. For those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes no.
Senator Abler votes no.
Senator Dames votes no.
Senator Dames votes no.
Senator Drazkowski votes no.
Senator Jaskowski votes no.
Thank you, Mr. President. Senator Lang votes no.
And Senator Lang votes no. All members having voted who desires to vote, the Secretary will close the roll. There being 34 ayes and 33 noes, the decision of the President is upheld. Senator Gruenhagen, you have another amendment?
Yeah, thank you, Mr. President. I'd like to offer the A6 amendment.
Senator Gruenhagen offers the A6th amendment. The Secretary will report the A6th amendment.
Senator Gruenhagen moves to amend House File Number 2 as follows. Page 435, after line 23, insert. This is the A6 amendment.
Senator Gruenhagen, to your A6th amendment.
Oh, thank you, Mr. President. Yeah, I hope I can explain this before it gets ruled out of order, okay? Just kidding. No, what this amendment does, it prohibits puberty blockers, cross-sex hormones, and gender and mutilating surgery and castration of minors for our children 18 years and younger. So this would prohibit this, which we know in the last biennium we passed legalizing this. Now, members, I would offer a study that's been done. I believe it was by the National Library of Medicine, and they said that people and children that go through the puberty blockers, cross-sex hormones, the castration and sterilization, they have a 12-fold higher chance of attempting suicide. So this transgender thing, far from reducing suicide, is actually increasing it, according to this study. So members, these are our children. Their brains are not fully developed to weigh the consequences. And we've heard the testimony at the federal level of people detransitioning, complaining about that their therapist and other people encouraged them to do this, and they have strong regrets now. The least we should do is prohibit this on 18 years and younger. It's child abuse. I could call it other things, but we'll leave it at that. The other thing, these behaviors, cross-sex hormones, gender-affirming care, mutilating surgery, and castration, you cannot change your chromosomes, members. It's anti-biology to believe so. And to have Minnesota taxpayers or insurance companies cover this is ridiculous, especially on minor children. Members, I've seen how these amendments go. I'm raising this that hopefully some of you will have your conscience stung, and next session we can stop this type of abuse on minor children. So with that, Mr. President, I'll withdraw that amendment.
The A6 amendment is withdrawn. Senator Gruenhagen, do you have another amendment? Senator Gruenhagen.
Oh, thank you, Mr. President. Yeah, I'd like to offer the A1 amendment.
Senator Gruenhagen offers the A1 amendment. The Secretary will report the A1 amendment.
Senator Gruenhagen moves to amend House File Number 2 as follows. Page 338 after line 13, insert. This is the A1 amendment.
Senator Gruenhagen to the A1 amendment.
Thank you, Mr. President. Yeah, what the A1 addresses is in the previous biennium, we made Minnesota a gender-affirming care state. What that does is that if a child wants to go through this type of abuse of mutilating surgery, cross-sex hormones, and puberty blockers, the state can actually take the child away from the parents and do that to the child and then give them back to the parents. I hope Minnesotans are paying attention, because I don't believe Republicans, Democrats, or independents would support that, to undermine parental rights. So members, I hope that I'd like to have a vote on this, but I know what's going to happen. So appreciate the chance just to explain it. So members, it was the Democratic majorities in the last trifecta biennium that passed this to undermine parental control, mutilate and castrate our children, and that needs to stop. If you care about the children and parental rights, please allow them to be involved in this life-altering surgery. With that, Mr. President, I'll withdraw the A1 amendment.
The A1 amendment is withdrawn. Senator Uckey.
Thank you, Mr. President. I want to go back and just talk about the bill a little bit in general. The last time we had this bill before us back in regular session, I did talk a lot about transparency and accountability. Well, nothing changed as we move this thing forward. This bill was 100% negotiated in private. Just the way, we've been hearing the same process across many of these bills. It's just a horrible way to do business. We are here to represent our districts, but we're here to represent the citizens of Minnesota. And when we do these things behind closed doors, they have no ability to see what's going on, and they are not happy. And you know what? We're not happy either, because we are all here and we all want to participate. So hopefully going forward, we will see things change so that we do have input and we can have a change and bring these things to the table and hopefully work out something better. But some of the pieces in the bill, where this bill shifts almost $700 million of taxes, fees, and assessments onto our healthcare system that's already struggling. We hear about it all the time. Things are going up. People can't afford their health care. The providers we're losing providers, or they're cutting services, but yet this is layering some of those same extra costs on top of what is already breaking the bank. And in the end, there's nothing that improves accessibility and affordability. And that's what I think we all came into the session talking about, is how can we make healthcare more accessible and more affordable. But there's some things in this spreadsheet that we have before us that are even more concerning. We're proposing a single administrator for the non-emergency medical transport. We've removed the chiropractic care for adults covered under MA and Minnesota Care, the single PBM, and more. But if I just take a quick look and I can add up only 4 lines, it's over $200 million. I don't think we're going to see those savings. The care that we are so-called saving, the people, Minnesotans that want and desire that care, are going to go find another way to get it. Whether it's chiropractic care, rides to their medical appointments, and more. So it isn't just money that's going to go away. It's going to be spent in other means, and I'm afraid it's even going to cost us a lot more. can look at the agency. This bill is like a lot of others. We are reducing funding in a lot of areas, and we're trying to save money, but yet there was no cuts, no savings at the department level. In fact, we are seeing a proposed increase of, 76 FTEs. We aren't even holding steady, we're increasing. And then we can go to the fees that we all talked about when that bill was here on the floor, which was showing us at about $70 million. It comes back in the neighborhood of $91 million. It grew while it was off on recess here. We've got assessments to the MCOs, which again, anytime we assess these different groups, these different plans, it's us as the citizens of Minnesota that are going to pay the bills. So in this case, premiums are going to go up, and people are going to have to pay for it. The provider tax is expansion. There's an expansion there, not in the amount of the percentage, but the fact that it's taking in additional pieces to collect money on. There are things in there that we're all happy with. Ambulances, EMTs, there's proposals there for additional trainings and monies, etc. They were in dire need, and that's a good deal. And there's also some other pieces to it. So I don't want to make it all sound like doom and gloom, because people will benefit from some of the services being offered. But I do want to drop back to the one thing that I think is pretty important, because I don't see any savings in this, because these people are going to require care, and that is going back to the topic of the chiropractic services. Just because we pull that out and we're not going to cover it, those people are going to seek out care. They're going to take and go into the emergency rooms. They'll go anywhere and everywhere and do whatever they can to get help and get care. And so with that, Mr. President, I would like to offer the A2 amendment.
Senator Utke offers the A2 amendment. The Secretary will report the A2 Utke amendment.
Senator Utke moves to amend House File Number 2 as follows. Page 237, delete Section 12. This is the A2 amendment.
Senator Utke, specifically to your A2 amendment.
Yep, thank you, Mr. President. The two different sections there that are deleted in the amendment just refer to the deletion of chiropractic care for adults. One section was for the MA provided care, and the other one is for Minnesota Pay care. So that's what it is. Chiropractic care is quality care at an affordable rate. We're looking to save, I believe it was about $12.3 million over the 4-year term. I'm being told that this would about triple, because they're going to go seek out care at more expensive providers and actually probably get not the type of care that they should have in the first place. They're going to the chiropractor because the chiropractors can take care of these particular ailments. So with that, members, I'm just removing those two carve-outs and reinstating the coverage. Thank you, Mr. President.
Senator Wiklund to the A2 amendment.
Thank you, Mr. President. Well, members, I did express that I have concerns about this, but this bill and this budget reflects a bipartisan agreement, and it reflects the work of Republicans and Democrats through tough negotiations and budget work. And I'm going to ask members to vote no on this amendment and help us prevent a government shutdown.
Senator Friends. Senator Friends.
Mr. President, I request a roll call.
Roll call requested, roll call granted. Senator Westrom.
Mr. President, members, I rise in support of Senator Utke's motion or amendment and urge you to support restoring assistance, medical assistance for those that need it but can visit a chiropractor for relief. Cutting that health care out from Minnesotans seems ridiculous. And we just heard all the members of the DFL party tell us how important it was to keep health care for illegal immigrants. And here we've got a bill that the DFL is bringing forward that's cutting health care for Minnesota residents. Not putting Minnesotans first. And so we have the opportunity to correct this injustice. On a priority list, it seems like the Minnesota taxpayers, Minnesota residents and citizens should be the priority, and that's what Senator Utke is doing here, helping bring back health care for those that need it through medical assistance, for chiropractic care, which in a lot of cases, if that can help relieve the pain or the health care problem they are having, is going to be cheaper than going to an emergency room or more traditional medicine that is oftentimes more expensive. So why would we take away the cheaper alternative health care for Minnesota citizens while we just heard an argument from the Democrats on why they have to keep health care for illegal immigrants, and the bill they're bringing forward is cutting health care for Minnesota citizens and Minnesota residents? It doesn't make any sense. Anybody in the public ought to wake up to this ironic contrast that we are seeing right before our own eyes here today. Members, put Minnesotans first, restore this affordable health care for those that need it, for Minnesota citizens. Support the Utke amendment.
The last voice we'll hear before we vote is that of Senator Utke, if he has anything else to say, or we can go straight to the vote. Senator Utke.
Thank you, Mr. President. I'll just jump up quick and ask everyone to please support the amendment. Vote green.
The Secretary will take the roll on the A2 Utke amendment. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Drazkowski votes aye.
Senator Drazkowski votes aye.
Senator Lang votes aye.
Senator Lang votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
And thank you. One more second. I'll let you know as soon as I get the vote.
Senator voting for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes no.
Senator Mohammed votes no.
Senator McEwen votes no.
Senator McEwen votes no.
And Senator Fateh votes no.
And Senator Fateh votes no. Senator Jasinski.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye. All senators having voted who desires a vote, the secretary will close the roll. There being 31 ayes and 35 noes, the A2 Ucky Amendment is not adopted. Senator Liskey.
Thank you, Mr. President. Mr. President, I'm pretty frustrated listening to the body's excuses as to why we're not accepting any kind of amendments, especially when they're good amendments. Being that there's a bipartisan agreement, there's nothing saying we can't amend these bills. There's nothing saying in the agreement that we have to stick to exactly the same thing. If it's a good amendment and both bodies agree, there's no reason not to send a better bill to the governor's office. It's frustrating because it hurts a lot of people, and I understand listening to both sides of the aisle today that there's been frustrations over we don't like the agreement. And so we all have election certificates, and we're all here to participate in the process. And so that's something that we should be doing, and we should be listening to what everybody else has to say. With that, I offer the A5 amendment.
Senator Liskey offers the A5 amendment. The secretary will report the A5 Liskey amendment.
Senator Liskey moves to amend House File Number 2 as follows. Page 279, after line 27, insert. This is the A5 amendment.
Senator Liskey to your A5 amendment.
Thank you, Mr. President. Mr. President, I offer the A5 amendment in hopes that Senator Wiklund can maybe listen to this part and just hear it, and we'll see where we go with the debate and understanding what this is thought of. The purpose of the provider tax was to help fund Medicaid and the Minnesota Care Network and to help the state fund those things. It created the Healthcare Access Fund, and it is a very well-funded fund that providers have to pay a fee basically to provide medical services to their patients. You know, our side of the aisle, we generally nickname it the sick tax, because unfortunately the only people that end up paying this tax are those that are ill or seeking medical services. And so with that, I offer the A5, which is describing the removal of healthcare providers having to pay the provider tax if they can't provide the services that the provider tax was designed to fund. And so with that, I look forward to a green vote. Thank you.
Senator Wiklund to the A5 amendment.
Thank you, Mr. President. Well, this bill, as I said before, this budget reflects agreements from Republicans and Democrats through tough negotiations and bipartisan work. I'm going to ask members vote no, and we are working to prevent a government shutdown.
Senator Klein.
Mr. President, I request a roll call.
Roll call requested, roll call granted. Any other discussion before we go back to the author? We are going back to the author. Senator Liskey.
Thank you, Mr. President. Mr. President, just because we accept an amendment or we move forward on amendments, I'm not sure how that railroads us into a government shutdown. We have until July 1st for a government shutdown. Last I checked, this special session could go and we can have the discussion and we can make better legislation. Rushing legislation never functions well. It continues to function poorly, and it continues to do bad things and a disservice to our constituents. So with that, I urge a green vote just to show that we can accept amendments and that we can make better legislation. Thank you.
The secretary will take the roll on the A5 Liskey amendment. Senator Brodin, for those voting pursuant to Rule 40.7, you need a little more time. Okay. Senator Brodin.
Thank you, Mr. President. Senator Mohammed votes no.
Senator Mohammed votes no.
Senator McEwen votes no.
Senator McEwen votes no.
And Senator Fateh votes no.
And Senator Fateh votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes aye.
Senator Dame votes aye.
Senator Drazkowski votes aye.
Senator Drazkowski votes aye.
Senator Lang votes aye.
And Senator Lang votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There being 31 ayes and 35 nays, the A5 Liska Amendment is not adopted. The Secretary will give the bill its third reading.
House File Number 2, a bill for an act relating to state government, amending provisions on the Department of Health, Finance and Policy, health licensing boards, pharmacy benefits, the Office of Emergency Medical Services, etc.
Third reading. Senator Uckey, did you have any comments on third reading, or you gave your comments earlier? Are you okay? Great. Senator Kroon.
Thank you, Mr. President. As with all omnibus bills, even if I don't support the bill, there are usually some good provisions in there, and that is the case with this bill. And I thought I would rise to point out that I have a couple of bills in this omnibus bill. One of the bills establishes requirements for video security cameras in child care centers in public and shared areas, and at least one video security camera in each room designated for infants and toddlers. Mr. President, my bill derives from incident in Blaine, where I live, at a daycare center, where there were a couple of employees who were abusing helpless infants, of multiple children, multiple sets of parents, including one of my state representatives. And the bill also requires retention of that data for 28 days, which is also really important. And I think that this bill will help save many infants from that fate, and it will help deter this kind of abuse of infants and also help prosecution of the monsters that do this in the event they still do it. And so I think this is a really important provision that I'm glad to see in the bill. And related to that, Mr. President, is another one of my bills that provides for education for all hospitals and birth centers to provide to parents of newborns with written materials to educate parents on how to recognize signs of physical abuse with their infants and to report the suspected abuse when they see it. And that goes hand in hand with the other bill. Sometimes new parents aren't quite sure. They think they can't possibly be abused, and they may brush it off to other things. They're not, because they don't know exactly what to look for. And in this case, early reporting of this abuse may have saved abuse in subsequent cases. So to educate parents to recognize abuse of their infant, I think will also save many infants in this state from that same fate. So I'm glad to see that those provisions are in this bill. Mr. President, though, I still cannot support this omnibus bill overall. There's just too many problems with this omnibus bill, and I just want my constituents to know that I support those two provisions, and I don't enjoy having to cast a vote against my own bills, but that's just the way that this state operates in its abuse of omnibus bills. And so I can't support the bill due to the shifts of almost $700 million over the next 4 years and taxes, fees, and assessments onto our healthcare system, which is already struggling to maintain its accessibility and affordability. And I can't support the fact that there's various fee increases totaling over $90 million over the next 4 years, given the state where we came from an $18 billion surplus to facing a $6 billion deficit, the tax increases over the last few years. I simply cannot support those provisions, and I cannot support this bill, this omnibus bill overall, but I wanted to rise in support of the two bills that I have in this, and thank you, Mr. President.
Senator Wiklund, you're the last voice that we're going to hear before we vote on the bill. I see Senator Mann is standing now. Senator Mann.
Thank you, Mr. President. I just wanted to mention a few other provisions in this bill that are very good. We are going to be establishing the Office of Dementia Services. We all know someone whose life has been touched by dementia and whose families are often left navigating a confusing maze of services, and now they will have a place to go for answers. We will establish the single state PBM, so pharmacy benefit managers once served a function to lower the cost of prescription medications. Unfortunately, they are now have morphed into profit-making machines on the back of sick people. If they were standalone company, the three biggest PBMs would each rank among the top 40 U.S. companies by revenue, which is insanity. So we are following the steps of Louisiana, Kentucky, and Ohio in forming a single state PBM where transparency is increased, reimbursement to pharmacies are increased, nefarious practices like clawbacks and spread pricings are stopped, and we save money. The states that have done this have collectively saved hundreds of millions of dollars. Actual hundreds of millions of dollars. This, along with establishing a directed pharmacy dispensing fee, will also in this bill will go a very long way in stopping the alarming rate of pharmacy closures across the state. We have the hospital-directed payment program, where Minnesota hospitals will be able to leverage up to $1 billion in federal funding to stabilize MA funding for Minnesota's hospitals and keep doors of our rural hospitals open. This is a very big deal for our hospitals. We also have funding for our food shelves at a time when federal government is cutting access to food for Minnesotans. We have stepped up. We have funding for Change the Outcome so we can educate our kids about opioid use and overdose prevention. We have the International Medical Graduate Provision, which will increase the number of qualified physicians practicing medicine across Minnesota at a time of a physician shortage, and open up residency slots for new graduates. And we have the formulary change bill, where when you go to the pharmacy to get your medications, you will no longer hear the words, "Your formulary has changed, you can't get your medications anymore." This will be huge for patient care. So there are many, many things to get behind, but just as like any other negotiation, there are many things I don't agree with. But I was very happy to hear today that Senator Uckey and Senator Restrom said that people who have needs will find other ways to get it. And they will go to the emergency rooms and find ways to get this care, and it will cost us more money. I could not agree with you more, Senators Uckey and Westrom. And you also said yesterday, Senator Uckey, and I wrote this down because I agree with it so much, just because we remove something doesn't mean that the need goes away. And again, I love that quote. So the $13.2 million that we will save this year by ripping away healthcare from 16,000 people will actually cost us more money. I'm glad we're all on the same page. So I hate this line item in the bill, of course, but I'm glad that we agree that removing care from people will actually cost us more money in the long run. And that is fiscally irresponsible to do. And I absolutely agree with you that we have to prioritize Minnesota residents, and that is exactly what we're doing for all Minnesota residents. So all in all, there's many great things in here. I want to thank the committee members for their year-round work, for the conferees, and most importantly, I want to say thank you to our staff who go above and beyond for the people of Minnesota. Your sleepless nights, your time away from your family, your sacrifices, and your expertise does not go unnoticed. Thank you, Mr. President.
Senator Murphy.
Thank you, Mr. President and members. At the start of this session, we would hear, and I've been hearing it today, that we are facing a $6 billion deficit in the out years, the planning years, also known as the tails. But if you strip inflation away, that number is $2.3 billion. Now that's a lot of money. And our caucus, this caucus, decided that we wanted to attack that in the out years. And when we look at the spreadsheet that represents the work of this budget, when we go all the way out to those tails, those planning years, that $2.3 billion becomes $289 million. We have attacked the structural deficit and significantly, which means we had to do a lot of spending reductions. Overall, in the general fund, about $1.3 billion in general fund spending reductions over the next 4 years, much of it in Health and Human Services. So I wanted to get up and make sure and call out the committee, all of you who have done this work, and Chair Wiklund for what I think is a magical effort here to stabilize a healthcare system that has been flagging across the state for people, particularly rural communities. Your attention to funding for hospitals, for mental health care, for federally qualified health centers, for emergency medical services has been inspirational, and for our pharmacies. It will serve Minnesotans across the state. It was the work of an architect who understands the Health and Human Services system and the need for health care across the state, and I wanted to thank you for that, all of you.
Senator Wiklund, before we vote, your comments, please.
Thank you, Mr. President. I think I've conveyed some of the high points in this bill. I just want to say I believe it is an important bill that will help Minnesotans across the state. It addresses critical concerns, and it will improve the lives of Minnesotans. There are shortcomings, as with any negotiation and with any set of constraints that we had to work under. But overall, I believe that things like being able to address mental health rate increases for medical assistance is really going to be transformational for our mental health system. I would say that the bill reflects compromise by both bodies. It reflects inclusion of leadership agreement items like funding operating adjustments and the fee increases. And I just hope that members will vote to support this bill today. I want to say thank you to all of the staff, nonpartisan staff, who put in so many long hours, both in the Senate Council and Fiscal Analysis, and the House Research and Fiscal Analysis, and the Revisor's Office. As with anything that becomes a 500-page bill, you can imagine the number of hours of work and the attention to detail that is required. And I truly appreciate all of the time and effort that has gone into making this bill possible. My thanks also to our staff in the Senate, our committee staff and committee administrator and legislative assistant especially, and also all of the committee members. We had many, many hours of thoughtful debate about key issues that are facing Minnesotans related to healthcare, child welfare, social issues that are confronting us, and I appreciate so much having committee members who are interested and really want to get into the detail level of how can we work to solve these problems. So thank you, and members, I hope you can support the bill. Thank you.
The Secretary will take the roll on final passage of House File 2. Senator Brodin, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
And Senator Fateh votes aye.
And Senator Fateh votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes no.
Senator Abler votes no.
Senator Dames votes no.
Senator Daines votes no.
Senator Drazkowski votes no.
Senator Jaskowski votes no.
Senator Lang votes no.
And Senator Lang votes no. All senators having voted who desires to vote, the Secretary will close the roll. There being 34 ayes and 33 noes, the bill is passed and its title agreed to. Members remaining on the motions and resolutions, we will revert to the third order of business. Messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted. House File Number 4. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, no action is required. The next order of business is the fourth order of business, first reading of House bills. The Secretary will give the bill its first reading.
House File Number 4, a bill for an act relating to commerce, establishing a budget for the Department of Commerce.
The House file has been given its first reading. Remaining on motions and resolutions, Senator Murphy for a motion.
Thank you, Mr. President. I move that an urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to House File 4, and that the rules of the Senate be so far suspended as to give House File 4 its second and third reading and place it on its final passage, and I ask for a roll call.
A roll call requested and a roll call granted. The Secretary will take the roll on the motion to suspend the rules. Members, please vote. Senator Brodin, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
And Senator Fateh votes aye.
And Senator Fateh votes aye. Senator Latz, are you voting? Senator Young, are you voting? Senator Limmer, are you voting? Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes aye.
Senator Daines votes aye.
Senator Drazkowski votes no.
Senator Jaskowski votes no.
Senator Lang votes no.
And Senator Lang votes no. All senators having voted who desires to vote, the Secretary will close the roll. There have been 47 ayes and 20 noes. The motion to suspend the rules prevails. The Secretary will give the House file its second reading.
House File Number 4.
The House file has been given its second reading. I'm calling now on the author to explain their bill. Senator Klein.
Thank you, Mr. President. Thank you, members, for hearing the Commerce Omnibus and Consumer Protection Omnibus Bill this year, House File Number 4. I'd like to begin with thanks to Vice Chair Seeberger and Ranking Member Dames for their help, and a thanks, of course, to our assiduous staff, Committee Administrator Bill Lunzer, CLA Ellie Thibodeau-Lissick, our researcher Amanda Peterson, our counsels Olivia Siverson and Nolan Hudla, fiscal analyst Krista Boyd, our Republican caucus staff Wendy Havisto and Linnea Michelson, and our committee pages, Jillian Cherney, Sydney Tiffany, and Mitchell Winter, as well as our office intern, Sarah Schaefer. Members, the Commerce Bill has two significant provisions that will stabilize healthcare markets within the state of Minnesota. Two different markets, the individual market with the reinsurance provision, where reinsurance is authorized for an additional 2 years of its waiver, and some language that we instituted around the supplemental Medicare or Medigap market, where we tried to preserve the idea that there should be improved access to that market without completely destabilizing it and escalating premiums for members who wish to join that market. We came to good bipartisan compromise with the wisdom of the Commerce Department weighing in, and I think we reached an agreement that, while some will be unsatisfied with, will accomplish those goals. We have significant provisions around lead keys and cadmium paint, which will allow everyone in this chamber to continue to use their keys that they currently use for their house or their car. And in 2026, we will move to a slightly more rigid lead key standard, which is supported by the industry. 2028. We also will continue to allow cadmium paints for professional painters. Thank you to Senator Draheim for your work on that. We've got a provision in here that will allow water, or require actually water at large-scale events for entertainment events, and we have established an ombudsperson for the HOAs in our state of Minnesota. That is the Commerce Omnibus Bill. Members, I encourage a green vote.
Senator Liskey, we are doing amendments first, and then anyone that wants to speak after third reading, please. Senator Liskey.
Thank you, Mr. President. I will try to make this as quick as possible, but of course this is always good discussion because I think it's something that we should be talking about. It affects the entire state of Minnesota. It affects those of us that love the environment. It affects those of us that like recycling, and it affects those of us that just like small businesses. I'm going to offer the A1 amendment.
Senator Liskey offers the A1 amendment. The Secretary will report the A1 amendment.
Senator Liskey moves to amend House File Number 4 as follows. Page 102, after line 16, insert. This is the A1 amendment.
Senator Liskey, to your A1 amendment.
Thank you, Mr. President. Mr. President, this is the language from a bill that I introduced here towards the end of session. It's relating to the copper licensing that I spoke heavily against on the Senate floor last biennium. There's reasons why that I believe that that was installed is because there's some criminal issues and things like that here in the metro. But of course, we didn't think too much about the broader state of Minnesota when making that licensing change, and it is negatively impacting recycling of copper here in the state of Minnesota. It has dropped drastically the amount of copper being recycled. It's about 30% reduction, of which 33% of all copper in products these days is recycled copper. And so with that being said, this is extremely important, and I think it's very important to understand the reasoning why the $250 fee or license is not attainable. I talked about last time how much copper you would have to recycle just to make up the difference in the cost of the license. It's a lot. It fills up a large space in this environment. And so with that being said, I urge a green vote in support, and I look forward to some debate. Thank you.
Senator Klein.
Thank you, Mr. President, and I'll depart only briefly from our amendment script to say that I'm committed to working with Senator Liskey and Senator Pappas on some provisions regarding copper wire next session, but this current budget reflects agreements from Republicans and Democrats through tough negotiations and bipartisan work. I'm asking members to vote no on the amendment to prevent a government shutdown.
Senator Miller.
Thank you, Mr. President. Under Rule 41.2, I move to be excused from voting on the amendment.
To Senator Miller's motion to be excused. All in favor say aye. All those opposed say no. The motion prevails. Senator Miller is excused pursuant to Rule 41. Senator Klein, Senator Frentz.
Thank you, Mr. President. I'd like to request a roll call.
Roll call requested, roll call granted. Senator Uckey.
Thank you, Mr. President, and thank you, Senator Klein, for your response. I truly hope that next year this does get some time in committee. I would rather see a green vote right now and get it added on. That would be the cleanest and the fastest, because when I do go home, what I have heard over the last year or so about this bill, I can't repeat on the Senate floor, as far as, you know, basically how stupid it was. And the only good thing from where I'm at, it's only 90 miles to Fargo. So guess where they're taking their recyclables? And it's like everything else we see. When they go there for one thing, they do all of their shopping. They do everything that they need to do. Our small towns continue to lose because of some of these crazy things we've done. So I truly hope, whether it's today or next year, that we can get this thing fixed and get back to where people can sell their small amounts of copper, get it into the recycling system like it should be. They'll be happy getting a few bucks for it, and it's a win-win for all of us. So thank you, Mr. President.
Members, we're on the A1 amendment. I am now going to Senator Howe.
Well, thank you, Mr. President. And I truly believe that we need to address this because, you know, we started with a problem that was basically in Minneapolis, St. Paul, and we now license these recyclers, and we've issued, I believe, Mr. President, somewhere around 414 licenses. That's not many for the entire state of Minnesota. So many of us are not recycling the copper that we used to. I've got copper sitting at home. I just did a plumbing project. That copper is going in the garbage because I'm not going to go get a license to recycle that. That doesn't make any sense for the small amount of copper. But it makes a big deal throughout. If you took that little bit of copper and you added it up throughout the state of Minnesota, it would make a huge difference. So, Mr. President, I believe we should do a green vote on this bill, this amendment, and let's rethink what we're doing with recycling in the state of Minnesota.
Senator Kroon.
Thank you, Mr. President. I just would like to add a little bit of context to Senator Klein's response to this amendment, where he said that this was part of the negotiations, the tough negotiations between Republicans and Democrats. Missing is the context there. What he means is House Republicans, not Senate Republicans. We did not have a seat at the table for this. And so you can hopefully understand our frustration when an eminently reasonable amendment is brought by the Senate Republicans that with all of us having equal election certificates, to just have it summarily rejected because the House Republicans had a seat at the table and were part of the negotiations. So I've not heard any good reason to not vote for this amendment other than an agreement that was we were not a part of. I could see it if we were a part of it, because then we could go to our respective person that did have a seat at the table and advocate for this to be included, and maybe it would be, maybe it wouldn't be. But that wasn't the case. So I just wanted to provide that context. It sounds like Senator Liskey's amendment is abundantly reasonable, and so I will be supporting it. Thank you.
Senator Lucero.
Thank you, Mr. President. And if you recall, when we discussed this provision originally, I gave several examples how this was an absolute insane provision. Since that time, I've received a number of people reaching out to me, corroborating how misguided this law was. And I'm going to read just a snippet here from one email on how poorly thought through this was. It's just shocking. Senator Lucero, I'm a member of the Hanover Lions Club. And for the last 15 years, we have been recycling Christmas lights from the cities of Hanover, St. Michael, Albertville, Buffalo, and Rockford. Each year, we collect around 4,000 pounds of lights that are taken to recycling business, and the money we receive is placed back into our community. Mr. President, there's copper in the Christmas lights. And the email goes on to discuss the lack of clarity that the law had. The provision that was passed into law was rushed through committee, lack of voices of those in the industry. It sought to deal with an issue that is happening largely in the metro area of Minneapolis and St. Paul. And when this was pushed through, the chief author and the supporters didn't care about the unintended consequences. They didn't care how wide the net that they were casting would ensnare so many other aspects. And I stand strongly in favor of the amendment. We need to roll this back and actually have a thoughtful, deliberative conversation and target what we're trying to achieve rather than all these unintended consequences that adversely impact Minnesotans. And it's just, again, asinine what was pushed through. Please, Mr. President, members, support the Liskey amendment. Thank you.
Senator Heisman.
Thank you, Mr. President. I'd like to rise to support the A1. This language and this law that was enacted in 2023 is harming our recycling centers. It's harming Minnesotans. Like others have mentioned, there have only been 414 licenses that have been issued since January 1st. In any given year, we normally have tens of thousands of Minnesotans that go in and recycle copper. This is something that needs to stop. We need to change this. This year, we need to vote green now and not wait till next year. This is a resource that we depend on. 33% of copper materials, copper items are produced using recycled materials. We can't afford this. Our recycling centers can't afford to have the copper items going in the garbage, having them just lay in people's fields, or going across the border like Senator Utke said. So please vote green.
Senator Eric.
Thank you, Mr. President. I appreciate Senator Liskey bringing forward this amendment. Many of us that understand and are involved in the recycling industry, especially through construction materials where there is a lot of copper that needs to be recycled, we talked about what was going to happen. I think as Senator Utke mentioned, you know, his area, they're pretty close to the North Dakota border. It's pretty easy to go over there. Much of the problem that we talk about that was happening in Minneapolis and St. Paul, it's not very far over to Hudson, Wisconsin. Why are we seeing such a huge decrease in recycling in Minnesota? It's because people who are close to the border are just going across state lines to do the recycling, where they don't have to meet this. But I think the other question that we should be asking is the 414 permits or licenses that were given out, that was over $100,000 that's going to our agency to administer this, rather than going back into the pockets of the people who are recycling. Let's go after the people who are doing criminal acts to get the copper. Take care of that problem. But especially, you know, for someone like myself with an electrical license, I'm exempted from this. My electrical license covers this. But there are a lot of people that do their own home remodeling. That copper pipe from their old houses, the copper wire, as Senator Howe said, if you're looking at that and thinking, I'm going to get $50 for recycling this, but it's going to cost me $250 to get this license from the state, why in the world would you do that? But as we look at expand this to the energy sector. We need copper for our energy future. We have to recycle as much as we can. We can't see it going into the garbage and into the landfills. We need to make sure recycling is a viable option for all of this copper to make it back into the system. Unfortunately, we fell short on making changes to it, so this amendment right now is the right thing to do. Let's stop this. Let's get people recycling. Let's readdress the problem that's out there. We already know that so many of these places are switching over to aluminum wire, just as plumbing has switched over to plastic. Industries will figure this out. We don't need to create more licenses that the state has to administer and make things so much more difficult for people. Vote yes on this amendment.
Senator Liskey is the last voice we'll hear before we vote. Oh, I'm sorry, Senator Pappas is waving, and she's waving profusely, and I want to make sure that I don't ignore her. Senator Pappas.
Thank you, Mr. President. The reality, members, is that copper wire theft is down 60% in the city of St. Paul. Copper wire theft in the last few years has cost cities millions and millions of dollars in having to repeatedly replace the copper wire in city streetlights. And there's even been one fatality because of the darkness. Someone walking in near Como Park was not visible to a car, and there was a car accident because of that. So it's very dangerous when copper wire is stolen from street lights, and people can't see where they're going and what they're doing. Some of these arguments, I have to say, are ridiculous. Of course, Christmas lights can be accepted. We're looking at scrap copper wire stolen from street lights. Now, the concern was brought up that there wasn't clarity in the law. I met numerous times throughout the session, starting in January, with the scrap dealers, the police from Minneapolis and St. Paul, the city public works officials, trying to work out a compromise. But members, the scrap dealers decided to sue the state. And when there is a lawsuit, our hands are tied. I was not able to talk to the AG, talk to Commerce, talk to Public Safety to figure out if there was a solution. And the scrap dealers dragged their heels in coming back with suggestions. Weeks would go by. We're waiting for them to come with suggestions on language, suggestions on online options that then all the stakeholders could review until finally the committee deadline went by. The Commerce bill went by. Now we're in special session, and now we're going to fix the problem. There still is an outstanding lawsuit. I'm waiting and waiting for them to decide. They already lost the first round, then they decided to appeal. So it's impossible to resolve this situation anyway. Now, I also want to tell people that there are 2 free days a year, one in the fall, one in the spring, when people without a license can bring their copper wire into the scrap dealers to sell their copper wire. And there's no reason that you can't donate your copper wire to a recycling facility. They will still take the donations, members. So I have to tell you, I am so tired of this issue. I want it to be resolved as well as all the members do here, but we cannot resolve it while there still is an outstanding lawsuit.
Now, Senator Liskey, last voice we'll hear before we vote on the A1.
Thank you, Mr. President. Thank you, Senator Pappas, for giving us your view on how negotiations went this year. Of course, I've also talked to a lot of the interest groups that are around this, and they said that they brought language to you in March and that they had agreements close to nearing agreement, and it fell apart. And I don't know if it's because deadlines weren't met or if things weren't done, but at the end of the day, this is still a problem. I would attribute that the crime reduction is more related to the law enforcement and our amazing law enforcement and how well they are at stopping organized crime and crimes that are running around taking this copper wire out of lights. I would like to attribute that to our great men and women in law enforcement. I don't think it had to do with a license, because at the end of the day, St. Paul's not that far away from Wisconsin where they can still go and sell their copper if they need to. So I don't think that the license had all that much of an impact on theft. The reality is that the people that are hurting most are those that are in the communities, small communities, like Senator Utke's, or like My own, which isn't all that far away from the border either. In fact, one of my townships, Ravenna Township, borders the state of Wisconsin. So with that being said, I urge a green vote. I think that this is the best time to do it because we didn't have time during regular session to negotiate the Commerce Bill. That's why it's here today. I truly believe that the Commerce Bill was probably a lot closer in negotiations than most of the other bills that are here. It's just we ran out of time because things were done at a snail's pace at times. And so with that being said, I urge a green vote, and I look forward to your support.
The Secretary will take the roll on the A1 amendment. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes aye.
Senator Daines votes aye.
Senator Lang votes aye.
Senator Lang votes aye. Senator Bowden, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes no.
Senator Mohammed votes no.
Senator McEwen votes no.
Senator McEwen votes no.
And Senator Fateh votes no.
And Senator Fateh votes no. Senator Jasinski.
Thank you, Mr. President. Senator Drazkowski votes aye.
Senator Jaskowski votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There being 31 ayes and 35 noes, the A1 Liskey Amendment is not adopted. The Secretary will give the bill its third reading.
House File Number 4, a bill for an act relating to commerce, establishing a budget for the Department of Commerce, appropriating and transferring money for other commerce and Office of Cannabis Management activities.
Third reading. Any other speakers before we go to the vote? Senator Latz.
Thank you, Mr. President and members. The Commerce Bill this year is missing one important component, and that is what has usually been the annual special liquor provisions to help out organizations, retailers, businesses in our local districts, municipalities, and so on that want to facilitate economic development or expansion of a business or the opening of a new facility that would provide jobs and retail experiences and so on. There were a couple of controversial provisions that were introduced in the Senate side in the liquor bill as it came together, and in the other body's side also had a controversial provision. I had one in the bill that was non-controversial, and so did many members of this body. I had a food hall license for a new proposed restaurant and liquor establishment in the west end of St. Louis Park that would have filled some large and currently vacant space in a major retail hub in our community. Senator Dibble had a large food hall special license in Minneapolis that would have filled a much, much larger space in downtown Minneapolis. Senator Pappas had a special liquor license provision for the Science Museum and for the Union Depot. Senator Clark had a number of provisions relating to the University of Minnesota and facilitating the opening of liquor establishments or adjustments to the licensing terms in a number of places on campus, including opening up the agriculture campus in St. Paul, which for some reason historically had a complete ban on liquor establishments. Senator Frentz had a provision for the Mankato relating to the Minnesota State Mankato down there. Senator Nelson had a provision in Rochester that was also, Senator Bolden was a part of that effort. Senator Wiklund had a Bloomington provision. Senator Utke had a provision in Lake of the Woods County. Senator Dames had a provision in Springfield. And Senator Westrom had a food truck license in Douglas County. These were all non-controversial provisions. And in an effort to try to unlock the passage of these provisions for the benefit of all of our local communities, which has typically been what we've done with the liquor bill, I packaged the non-controversial provisions into a bill. I introduced it near the end of regular session, and I reintroduced it in this special session today. Obviously, I'm standing up here on third reading. I'm not offering it as an amendment, and I'm not asking you to vote against the Commerce Bill because of its absence from the bill. But I want to point out that even the authors of the provision in the Senate that had some controversy associated with it having to do with social districts, we're not trying to stand in the way of the passage of the non-controversial provisions. Unfortunately, the chief author of the controversial provision in the House, of the other body, who happened to be the GOP chair of Commerce Committee in the other body, had authored a provision to allow 17-year-old servers in bars and restaurants. Now, that is a highly controversial provision, and based on what I've learned along the way here, probably wouldn't be able to get a majority vote in either body to pass and become law. But that chair has somehow successfully locked his caucus down and refusing to let through all of the bipartisan, non-controversial liquor provisions that would benefit our individual communities. To me, that's a very dangerous precedent to set, and it also means that in some communities, establishments will not be able to open or will be delayed at least a year or however long it takes for us to try to get past the non-controversial provisions if we ever get to it. Might not be till next spring. It might delay investments. There might be investments that are lined up that are simply not going to materialize, financing that won't materialize because the retail establishments can't get the license or will be too delayed in their ability to get the license to open those establishments. So I stand here very frustrated that on a bipartisan basis, quite a few of us here are not going to have that opportunity. Senator Westrom's food truck is not going to be able to have the flexibility that his constituent wanted to have. Senator Dames' provision in Springfield will not have that flexibility that they would like to have. And in Rochester, Senator Nelson, I know, was really hoping, and in fact, she just assumed that the liquor bill was moving along without any issues whatsoever, till I approached her and said, can you help me out with this? And we realized, and she became aware, that it wasn't even in the Commerce Bill. A lot of people had just assumed it was coming through the Commerce Bill, because that's usually where it is, and it just moves along without any hiccups. So I'm telling you, I have tried every angle I can possibly think of to open the door in the other body. I've talked with, even the hospitality industry opposes the 17-year-old server provision because of insurance consequences. Their own members don't want this, but apparently the rumor is there's one establishment in one district that has got this hung up. So I've talked to quite a variety of business groups. I've talked to others. I've talked to authors and individual communities. Just can't overcome that one barrier in the other body right now. And as a result, all of our non-controversial liquor provisions are going to die this special session, just like they died this regular session. So I beseech those of you who care about the provisions in this bill or in this liquor bill this year, and all of you who may want to have a provision in some future bill, maybe between now and whenever we come back together, some other city or township or establishment's going to come to you and say, can you help us get this exception to the statutory liquor provisions? No one's going to have any issues with it. You want to help out your community. You want to make it possible for a new business to open and hire people and generate more economic activity. You don't know it yet, but maybe tomorrow, maybe next week, you're going to get that invitation, that request to introduce your own provision, your own bill. This is a really bad precedent, members. I beseech you to talk to your members in the House, in the other body, so that maybe next time we come together, we'll be in a position to pass these non-controversial provisions to benefit all of us, including, of course, my food hole provision in St. Louis Park that I have been spending hours and hours trying to find a way to get it through. And it just can't happen right now. I'm not going to stop until we do get it through, but it's going to take a collective effort, I think, for all of us to get past this barrier in the other body. Thank you, members.
Senator Duckworth.
Thank you, Mr. President. I appreciate it. When I was just beseeched, so I'm going to speak to it a little bit as well. I really wish Senator Latz would have brought that bill forward because I think it would have passed. And if we're going to engage in a little bit of speculating, I'll add to it, but very briefly. I think a non-controversial, likely bipartisan liquor bill would have been great. However, I did hear that one of the other obstacles that stood in the way of that bill passing and becoming law was there was another chair in the other body who happens to belong to the party opposite of mine who wasn't necessarily thrilled with the idea of sharing the notion of social districts. How would I know this, Mr. President? Well, because the great city of Lakeville would love to have a social district when it comes to liquor laws or have the ability to do so. As a matter of fact, I believe the city of St. Cloud would as well. How do I know this, Mr. President? Because I partnered with my colleague across the aisle to say, let's pass this and get it done, only to find out that there's somebody in the other body who just doesn't like to share. And that's not right, Mr. President. So hopefully we can beseech all kinds of people here in the legislature to get this done next year, whether it's non-controversial liquor provisions for our specific Senate districts or just operating fairly when it comes to social districts. So there's that, Mr. President. The real reason I stood is to talk about the content of the Commerce Bill. I do appreciate your patience, sir. Here's what I'll say. On behalf of our caucus, reinsurance is a big deal. The fact that all of us continue to talk about keeping insurance premiums low for the people of Minnesota, making sure that they're not overly burdened with the costs of health insurance, and making sure that they have the maximum options to choose from for them and their loved ones is extremely important. And every year it seems that we do battle when it comes to reinsurance. We're either trying to steal money from it, we're trying to tax people for it, we're trying to increase the cost of health insurance premiums while we're also trying to tell them we're going to keep them low. It's a good thing that we are preserving the reinsurance program in this bill. There are plenty of other fees in the bill that we don't agree with and we may not like, but the reinsurance provision is a big one. And here's why we have an issue with other fees, Mr. President. I heard somebody earlier talk about really praise themselves and their caucus for attacking a $6 billion deficit. Good on you. The only reason we have a $6 billion deficit is because you spent $9 billion of taxpayer surplus. So it's hard to congratulate you for trying to solve a problem you created yourself on behalf of the people of Minnesota. So with that being said, Mr. President, reinsurance, that's a great thing. Some of the other fees and our incessant need to tax people, increase fees on folks, and make it harder and harder for them to provide for their families as the cost of living continues to skyrocket in our state does make it challenging to support all the provisions in this bill. Thank you.
Senator Kroon.
Thank you, Mr. President, and thank you, Senators Latz and Duckworth, for this conversation. I'm learning some things here. I didn't know anything about this non-controversial liquor bill being held up in the House and about a certain representative who doesn't like to share social districts. Didn't know about that either. I found that very interesting. And geez, what can we do about it? I don't know. What can we do about chairs that are holding up bills in backroom deals in special session? I don't know. Maybe we can just vote on individual bills in this chamber. How about that? Solve all of our problems. This legislature has a real problem giving a lot of power to all the chairs in this institution to go out and negotiate deals. And inevitably, when you do that, they have their own little personal things that they really care about that hold up bills that would pass with overwhelming support in this body. And this isn't the first year that this has happened, I'm sure. And it probably, unfortunately, won't be the last. But you want to get these out-of-control chairs in line? Stop abusing omnibus bills, particularly policy omnibus bills. Be very, very simple. So I probably, the sounds of that non-controversial liquor bill, I'm pretty sure I would have voted for that. It sounds pretty good. Social districts, I know my own city in Blaine wants to have one of those too. That sounds good. Would probably vote for that. But because we have an absolutely dysfunctional system of legislating in Minnesota, that isn't going to be the case. As to the Commerce Bill, I too really do like the reinsurance provisions. But unfortunately, as this is being an omnibus bill, there's also over $1 million of new or increased fees that are being added in this Commerce Omnibus bill. And so whether you want to calculate our $6 billion budget deficit based on inflation or not, to me it really doesn't matter. With the $10 million of tax increases over the last 2 years, we shouldn't be raising taxes, nor should we be raising fees like this. So that makes this bill a little bit more complicated despite some of the good things in it. So thank you, Mr. President.
Senator Aaron McQuaid.
Thank you, Mr. President. I want to speak briefly to a provision that did not come from the Senate, and I want to thank Chair Klein for doing such a great job of keeping this out of our bill as it left our floor originally, but it has come back in and at the request of our Republican colleagues, and it is reinsurance. It is $500 million to insurance companies. You know, the good guys who deny 1/3 of our insurance claims, who had a Blue Cross Blue Shield CEO have her pay increased by 34%. Those are our premiums, by the way. Like having large health insurers who engage with data companies to reduce payments to providers, deny claims to patients so they can reap some of their own money and drive up profits for insurance companies. Those guys get $500 million. Now, if we gave $500 million to individual people to pay for their health care, that'd be socialism. When we give it to rich CEOs and insurance companies who literally do not give us the health care we need, what is that? Capitalism, I don't know. So I loathe this part of the bill. I think it is horrible that we continue to give money to insurance companies. They are not providing us with the care we need. They just aren't, flat out. They're bilking us for money, denying our claims, and making it harder and harder and harder to live in this country. If there's anybody in this room who is super thrilled with their insurance, please raise your hand. I would love to talk to you and find out how that is happening. Because I have a daughter who has asthma. She has had asthma since she was under a year old. And somehow, more than once a year, I have to prove that my daughter needs an inhaler in order to get the inhaler. Even though she's had asthma every year she's been alive. It is absolutely bonkers. And that is but one example. So, I loathe giving $500 million to insurance companies. They are literally ruining society. And we should not continue to do this. And I look forward to solutions in the future that don't have this system anymore. Thank you, Mr. President.
The last voice we'll hear before we vote will be that of Senator Klein.
Well, thank you, Mr. President. We discovered on the floor today that members of both parties have frustration with House chairs. To Senator Kroon's comments about the passage of this particular bill and liquor provisions, I agreed with him, and that's why I brought a liquor omnibus bill during regular session. We did debate that, and it was passed off the Senate floor, and Senator Kroon voted yes on that. So he had the opportunity to pass that forward, as did all members. I do want to say that there's something significant missing from this bill. I wanted to mention it in opening remarks, but forgot. Senator Duckworth had a provision that would have banned the sale of nitric oxide inhalers at retail stores, these little whippets that are kids are abusing to get high and is causing a public health scourge. I thought that was a pretty well-crafted and important provision. At the very last minute, we realized it captured an industry that we didn't intend to capture, and we didn't have time to get it right. So took that off the table, but I have committed to working with Senator Duckworth and with the industry to protect our kids from those in coming sessions, and it was a miss this year. Having said that, I think we're doing some good things in this bill, and I encourage a green vote.
The Secretary will take the roll on final passage of House File Number 4. Members, please vote. Senator Bowden, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
And Senator Fateh votes aye.
And Senator Fateh votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes aye.
Senator Daines votes aye.
Senator Drazkowski votes no.
Senator Drazkowski votes no.
Senator Lang votes aye.
Senator Lang votes aye. Members, please vote. All members having voted who desires a vote, the Secretary will close the roll. There being 48 ayes and 18 noes, the bill is passed and its title agreed to. Senator Murphy for a motion.
Thank you, Mr. President. I'm going to move a recess to the call of the President. We'll recess for about 30 minutes. DFL members, we will caucus. That's the plan.
Senator Johnson.
Thank you, Mr. President. And Senate Republicans will caucus as well up in our 323 caucus room.
On the motion for recess, all in favor say aye. All those opposed say no. The motion prevails. The Senate is now in recess to the call of the President. The Senate will come to order. Members remaining under motions and resolutions will revert to the third order of business, messages from the House. The Secretary will read the first message.
Mr. President, I have the honor to announce the passage by the House of the following Senate file herewith returned. Senate File Number 1, a bill for an act relating to higher education. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, no action is required. The Secretary will now read the next message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted. House File Number 14. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, no action is required. The next order of business is the fourth order of business, first reading of House bills. The Secretary will give the bill its first reading.
House File Number 14, a bill for an act relating to transportation, establishing a budget for transportation, appropriating money for transportation purposes.
The House file has been given its first reading. I'll now turn to Senator Murphy because we are remaining on motions and resolutions. I call on Senator Murphy for a motion.
Thank you, Mr. President. I move that an urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to House File 14, and that the rules of the Senate be so far suspended to give House File 14 its second and third reading and place it on final passage. And I request a roll call.
A roll call requested, a roll call granted. The Secretary will take the roll on the motion to suspend the rules. Members, please vote. Senator voting for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Latz votes aye.
Senator Latz votes aye.
And Senator Marty votes aye.
And Senator Marty votes aye. Senator Jasinski, for those voting pursuant to Rule
40.7. Thank you, Mr. President. Senator Abler votes aye.
Abler votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Drazkowski votes no.
Senator Drazkowski votes no.
Senator Lang votes no.
Senator Lang votes no.
And I'm waiting on one.
Senator Jasinski.
Mr. President, Senator Coleman votes no.
Senator Coleman votes no. All senators having voted who desires to vote, the secretary will close the roll. There have been 45 ayes and 21 nays. The motion to suspend the rules prevails. The secretary will give the House file its second reading.
House File Number 14.
The House file has been given its second reading. Seeing no amendments, the secretary will give the bill its third reading.
House File Number 14, a bill for an act relating to transportation, establishing a budget for transportation, appropriating money for transportation purposes.
Third reading, Senator Dibble.
Thank you, Mr. President. Mr. President and members, before you we have House File Number 14, otherwise known as Senate File 18. This is the Transportation Finance and Policy Bill. Just for those, for the information of the body, the Transportation Finance and Policy Conference Committee Working Group was charged with meeting a target of a reduction of $115 million in the coming biennium and then $133 million in the tails. I am happy to report that we did meet that goal, and just a sense of proportion and magnitude, Mr. President and members, that's about over 25% of the entirety of general fund that transportation actually utilizes across both transit, active transportation, as well as roads and bridges. Transportation at this point in time uses about 0.6% of all general fund resources in the state of Minnesota. And it also took responsibility for about 11% of the reduction targets across the entire, all of the budget goals that we had throughout the entire other bills that we had in front of the legislature this year. Mr. President, members, the principles that we brought to this work and to the conference committee, similar to the principles that emerged from the Senate bill that we passed, was that we really strive for balance across the state. We really strive for balance among all Minnesotans and what they need in terms of mobility and access and opportunity and transportation, whether that's folks who drive on local roads, folks who drive on our state highways, folks who use active transportation, folks who use transit and the like throughout all of Minnesota. And we were able to do so for the most part. We were actually on a good path of really striking that balance in both investments as well as reductions for the most part until there was a little bit of a change over the weekend. And so at this point, it gives me no pleasure to report that, in fact, a disproportionate share of the cuts that are going to occur on an ongoing basis will be borne by transit systems and those who rely on transit in Minnesota, particularly in the metropolitan area. There are some temporary cuts, if you will, to the Highway User Tax Distribution Fund and some of the road systems, but those are actually offset in large measure by some new revenues, which I will talk about in just a minute. And in fact, roads, bridges, state counties, cities, townships, et cetera, will experience continued growth. I will say, though, that I'm happy that we did fend off some pretty deep and pretty draconian, pretty damaging cuts to active transportation, disability transportation, and transit, both in greater Minnesota and in the metropolitan area. And so that was some hard work, some hard-won negotiation, and it could have been proverbially so much worse. I'll just turn very quickly, Mr. President, to some of the key elements of the finance. In greater Minnesota, we do experience some cuts from some of the one-time general fund dollars that were appropriated in 2023. That's in the coming biennium, but there will be no cuts to the base. And the major achievement that we made in 2023 in advancing the transit needs in greater Minnesota with substantial support, pretty much fully funding what greater Minnesota transit needs, that will continue on in the base. Likewise with active transportation, some pretty big cuts in the first biennium, but we protect the gains that we made in 2023, and there are no cuts after that, no cuts in the base. Metro Transit is a somewhat different story. We did cut almost all, not quite all, but most of the general fund appropriation that's made to the Metropolitan Council for the purpose of supporting transit system operations in the first biennium. Then those are reduced somewhat in the next biennium, and those are permanent cuts in the base there, Mr. President. And then we do have some cuts, a pause, if you will, to the auto part sales tax. And this, of course, was, again, a major achievement of 2023. But those cuts are temporary, and the migration of the auto part sales tax from the general fund to transportation purposes. Currently, some of it flows to the Highway User Tax Distribution Fund. That's been true for a while. And what's coming from the general fund goes to what we call the Transportation Advancement Account, the TAA. And so those cuts actually that are occurring to the auto part sales tax won't actually affect the expected increases that go into the TAA and all those uses of those revenues, which of course include counties, cities, small cities, and townships. So that funding and those levels of increase are secure. And ultimately, the entirety of the transportation auto part sales tax will come to transportation purposes, but slowed down a few years, 4 years. So was it on a 10-year cycle? It'll now be a 10-year or a 14-year process. But it was an important principle that we continue to bring those funds over. We have, in the years past, when we've dedicated general fund to transportation purposes, we've seen those funds slip away fairly quickly when things get a little bit tight, and that was the danger that we ran. So that's the bulk of the cut targets. There are some additional, a little bit of spending, some traffic calming, a little bit of support for empowering small Minnesota communities as they try to prepare for infrastructure grant opportunities, working in conjunction with the University of Minnesota. We do put $3 million towards local wetland replacement, which will complement the $5 million that I know is coming through the capital investments bill. I know there are also some substantial funds that are coming on a one-time basis to the local bridge replacement program, local road improvement program that'll be coming there as well. Some dollars that are coming through the bonding bill. So those will be some major achievements. Again, roads doing very, very well overall in our budget across the board. Transit taking a disproportionate number of cuts, which is unfortunate, but it could have been worse. I'll just look very quickly, Mr. President, at the Trunk Highway Fund. Again, experiencing some very, very robust growth across the board. And so we deliver a base increase to the state road construction program, as well as the state road construction operation and maintenance program. We set some dollars aside for what we call the priority trunk highway projects, community requests, et cetera. There's a list of 5 fairly substantial projects that will be funded through those dollars that are targeted for that purpose. As well, making use of the Trunk Highway Fund, some pretty robust investment in the State Patrol's recruitment and hiring process, including doing a second academy, and we pay for that in the second biennium. And we do pay for the State Patrol headquarters with what we call Trunk Highway Fund cash, as opposed to general obligation bonding or Trunk Highway Fund bonding. And that comes in the amount of about $97 million or so. And we'll pay for that over the course of 2 years in the coming biennium. Very quickly, we also have responsibility for the Driver and Vehicle Services Operating Account. Probably the most important initiative that comes out of that is providing some reimbursements to the deputy registrars and driver's license agents for transactions that they take care of on behalf of the public for which they receive no reimbursement. At this time, that comes to about $2.5 million per year. And then another major fund over which we have responsibility is the State Airports Fund, and a couple of initiatives there, paying for an automated weather station at the McGregor Airport, and $10 million over 2 years in the coming biennium for the expenses related to the replacement of the Duluth Airport Tower. And if anyone's seen that tower, it's in pretty rough shape, and so we're pretty happy about that, and I thank Senator Hochschild for some of his leadership in making that happen. Turning our attention very quickly to some of the policy elements, Mr. President, there are 77 or so items on the policy side. I'm not going to enumerate all of those. I would invite anyone who's interested to take a look at our hearing of last Friday, in which we did have a very detailed and thorough walkthrough of the bill, and so you can listen to that if you want to hear all the details on every aspect. So I'll just hit on a few of them quickly that might be of interest to members and to the public. There's been a lot of discussion about the Washington Avenue Bridge and the tragedy of the suicide that's occurring at that site, and so we are going to be paying for, through sources of the metropolitan area sales tax for transit, some of those dollars that accrue to active transportation purposes, and then some that are allocated specifically for Hennepin County. And so we'll be combining those funds to make those, put those barriers in place on that bridge. I mentioned the Empowering Small Communities program grant, and we have the program language as well in the policy section. I mentioned the revenue that is coming in to help replace and offset some of the temporary cuts from the auto part sales tax pause. That will be coming from a new surcharge that owners of electric vehicles as well as hybrids will be paying. That will be calculated similarly to how we pay our tab fees. It's a percentage based on the value of the automobile, and it will also follow the same depreciation schedule. So as that value of that car decreases over a period of 10 years, that surcharge will decrease along with that. But it also is important to mention that ultimately the vision is that what electric vehicle owners are paying approximates a gas tax, and so it would make sense, of course, for electric vehicle owners to be paying a tax on the power, the fuel that powers their vehicle, which in this case, of course, is electricity. So we do establish a work group to take a look at a kilowatt per hour tax, and we do actually start the initial process of collecting that tax, but that's postponed for 2 years. In the meantime, there will be a work group to look at a more robust application of how that might work, both at public charging stations, which is what will go into effect in a couple of years, as well as all other area spots in which people receive their charges for their cars, whether that's public stations, private stations, residential, et cetera. And so we have a really robust work group to take a look at all of the complications. It's a very, very complicated area to figure out. I mentioned the payments to the deputy registrars and the driver's license agents, and we have the policy language in here as well. If you recall, we enacted the retail delivery fee a couple of years ago, and there were some applications of that didn't quite make sense in the way it was originally envisioned, so we have some exceptions for deliveries of things like liquefied fuel products that are subject to the state general sales tax, road construction materials, things like that, just some common sense changes there. We have a farm product special permit to allow crude soybean oil to be transported on limited routes and special overweight vehicle permit for farm products. We extend the valid length of a time for a commercial driver's license learner's permit. initiative of my vice chair. We provide some work zone safety, driver's education instruction, and include some of those elements in the driver's exam. The electric bicycle rebate will be changed somewhat, leadership of Senator Abler, in which those who are interested in having some assistance with purchase of an electric assisted bicycle, those folks will be, there will be an income eligibility element, a disability element. It'll be done on a lottery basis, and I think that it'll work, it'll target those dollars more appropriately to the folks that we're trying to help, and I think that program will function better. In another exciting initiative serving those with disabilities, we will establish free regular route transit in the Twin Cities for those who are certified to ride Metro Mobility. We've heard a lot about the motorcycle filtering and lane splitting. We had hoped to perhaps delay that by a year, but that is not going to happen, but we do modify all the places where folks can do lane splitting and lane filtering and the like. Senator Jasinski and his autonomous mower research, we've got that, as well as an initiative, a pilot to start that. We do include, of course, the memory of our beloved Majority Leader, Senator Carrie Diesick, will be naming the 10th Avenue Bridge in her honor, and I'm very, very proud that we were able to do that. Another initiative to serve people with disabilities, we're going to try to finally figure out how people with disabilities can be well served by the transportation network companies. There are some models from around the country that seem to be working very, very well in activating more wheelchair accessible vehicles in those kinds of networks so that folks can have that option when a particular trip is needed that particular type of service suits. And then I think that's the overview of all of the policy items that I wanted to touch on. Like I said, there's 77 of them, and so there's a lot more that we could talk about, and I'm happy to respond to any questions. Thank you, Mr. President.
Senator Jasinski.
Thank you, Mr. President, and thank you, Senator Dibble, for going through the bill. I was prepared to stand here and pound on my desk and say, vote no on this bill, but we had a meeting on Friday, and we brought in the stakeholders. I want to thank all the county commissioners, county engineers, and everyone who came in to talk about the metro area sales tax theft. We had some robust discussion. It was frustrating. This is something that came out with no bill, no committee hearing, came in from left field and was presented that would have stole $93 million from our collar counties. Dakota County, Scott County, Carver County, and Anoka County would have lost funding that they could use for roads and bridges with their metro area sales tax. This was not a good provision. Thank God it was removed this weekend and it came out so I can stand up a little bit easier today. I'm still not in favor of the bill because of the theft from the Highway User Tax Distribution Fund by many different areas, in my belief. I do want to thank Senator Dibble, though. He has been a great chair to work with, along with his vice chair, Senator Johnson Stewart. We've worked good through the whole year, had some great meetings. I want to thank Senator Dibble for hearing many Republican bills. There are a lot of our provisions in this bill, so I want to thank him for that. That's really I believe is the way you should do a bill each year. We've had that relationship over about 9 years. I hope to continue to do that, so thank you, Senator Dibble. But there obviously are some things we disagree on. I mentioned the main one on the metro area sales tax shift that was eliminated, so I want to thank for that. There are some road projects that got included. One important one is County Road 50 and I-35. That was an important project that I pass by every day and see how unsafe that interchange is and what improvements we'll do for it. I also want to thank Senator Dibble for the deputy register language in there. We've been working on that for a couple years. These are private businesses, counties and cities that are doing business and are not getting paid for the transactions. They have not been getting paid for over years. A lot of times someone will start a transaction online, cannot get it completed, go into their local deputy registers, who are usually, as I said, private businesses, counties and cities, to correct the issue, and that have not been getting paid for. This bill allows about $2.5 million per year to reimburse through the DVS account, not taxpayer money, through the DVS account, to reimburse these deputy registers for those transactions. I also want to thank Senator Dibble for the fee increase for electric vehicles. This was $75 for many years. It was proposed at $200. There was some language that we got done, or that they got done in the conference committees. Again, this was no bill. Again, frustrating. There was no bill, no input put in towards this. We were not allowed to discuss this, but it changed to a value-based way instead of just a flat fee. Some of the bad things, and again, $97 million is being stolen from our highway fund for roads and bridges. The State Patrol headquarters is getting funding out of this fund that should be used for roads and bridges. Now, I want to make it clear, I am fully supportive of the State Patrol headquarters and that facility, but that should come from bonding. It should not be coming from our highway funds. There was an agreement a few years back. We gave them money for the acquisition and design for new headquarters with the understanding that the money to build that facility was going to come out of bonding money, not out of trunk highway funds. That is a theft from our highway user tax distribution fund that is being used for a building that should have been done for bonding. Auto parts sales tax being paused, I think, sets a bad precedent. We worked hard to get that initiated over the years. There was a way that we would extend that out to 100% over time, and that has been extended. So I think it sets a bad precedent. I know I've talked to Senator Dibble. I know the governor had proposed actually freezing that, so I want to thank Senator Dibble for just extending it versus stopping it. But again, that is a bad precedent. We are taking money away from our roads and bridges. Some of the greenhouse gas language has been improved, but the greenhouse gas language that was put in 2023 is going to cost our cities, our counties, our taxpayers more money to build roads. It's going to take longer to get them approved, and it's frustrating to see that happen. Also, the NLX money, that was $108 million for a train to Duluth. That money did not get spent. That is sitting there for a possible train to Duluth. That money could have been used to solve our budget deficit. I don't think that project will ever come to fruition. We could have used that money. Approximately $77 million was taken for the UI insurance with our K through 12 schools, so it was used for that. But that $108 million could have balanced our transportation budget without stealing from that trunk highway funds and without delaying auto parts sales tax. Also, the provision that we had in the Senate was to use the 15% efficiencies, put that towards corridors of commerce to have some great projects that could have helped all of Minnesota with some road projects. So that's the majority of what I want to go through. It's going to be a long night here. So again, Senator Dibble did a great job going through the bill, but those are my concerns. I cannot vote in favor of this because of all the money that's coming out of our highway tax distribution fund that should be being used for roads and bridges and not leakages. Thank you, Mr. President.
Senator Carlson. Senator Carlson, you're on the list, so no problem if you have to think about it. No problem. Senator Clark. All right, Senator Ann Johnson Stewart. Senator Clark is off my list also.
Thank you, Mr. President. I just want to stand up and acknowledge all the hard work that went into this bill and to say that even though there are some things in it that I don't like either, I'll be voting yes. It's been a real joy to be back on the Transportation Committee with Senator Dibble and even, yes, Senator Jasinski. I think we all bring different gifts as well as different ideas, but mostly different expertise. And we work together. It has been really a very good working group, and also with Senator Howe. I don't want to leave him out. There's a few things that I've really enjoyed this time around. I'm looking forward to continuing work on work zone safety. We have a small movement in that area now requiring students that are studying for their driver's exam to learn about work zones, and that's really, really important. So I'm grateful that that's in the bill. I've known Commissioner Daubenberger for decades. We well, actually, I'm older than her, but we've almost went to school together. Anyway, she and I are working together to continue moving forward on the resilient pavement and long-term pavement performance projects, and also on state aid standards. So I will be voting yes. I'm grateful for the collaboration and for the latitude that Senator Dibble has given me, and please vote yes on this bill.
Senator Gustafson.
Thank you, Mr. President, and a big, big thank you to Senator Dibble. One of my favorite things about working with Senator Dibble is that he always takes the time to learn the nuances of our district, and I have a district that has kind of a transportation puzzle to solve that we don't have to go into now, but he's always taken the time to go through it. In the past, we've got White Bear Township funding that was desperately needed. And this budget session, he also found a way to make our License Center in Circle Pines a full-service provider. That's a big deal. And both of those examples that I cited are real things that people feel in my community and makes a difference and solves a problem. So thank you so much to Senator Dibble. And I cannot go without thanking him for being flexible and a problem solver over the weekend. There were several of us who, as Senator Jasinski pointed out, live in Anoka County or represent Anoka County and Ramsey County, and we were about to lose a lot of funding. He was able to sort of help us solve that problem. He was flexible with it, and I really appreciate that because our counties just cannot afford to have money taken from them right now. So thank you so much. I'll be voting yes and encourage others to do the same.
Senator Krohn.
Thank you, Mr. President. I also want to be thankful that the cost shift to the Met Council from our counties, particularly our collar counties here in the Metro, was removed from this bill. But I do need to emphasize that I watched the working group meeting from last Friday, and was pretty alarmed at what I was watching and kind of how the process of this played out, and was more convinced than ever that this institution needs to move away from these backdoor deals in conference committees, or in this case, working groups, with no transparency to the public, no opportunity for public input, and the provision that shifted the money from the counties to the Met Council was done without any of the counties even knowing about it and without their input. And then you find out that the provision, not only did it not get a hearing at any point during the regular session, there was never even a bill introduced on the topic. And apparently, we're just introducing new bills after session is over, behind closed doors, and we're just going to make that the law. That was the process. Thankfully, our counties spoke up, and I want to give a special thanks to Anoka County and all 7 Anoka County commissioners who spoke with one voice in opposition to that unconscionable provision. We need to do a better job in how we do government in this state. Everybody's got their own pet projects. Everybody wants to do certain things, but there's a right way and a wrong way to do them. And introducing a brand new provision when you didn't even introduce a bill or have a hearing without giving the public or the stakeholders any opportunity to comment is the wrong way to go about making law in this state. We need to get away from backroom deals. And to compound this further, is Senate Republicans didn't even have a seat at the table. We had one representative at the first meeting and at the last meeting, but when all the decisions were being made behind closed doors, Senate Republicans were not even allowed to be in the room. So much for bipartisanship that started this session out. It's an embarrassment to the state of Minnesota what was they tried to pull in this transportation bill. Getting to the bill itself, there are, of course, some good things in here with the deputy registrars, some money to other things. Getting the cost shift to Met Council out of the bill is a good thing. Some other things that are good, but the main problem as I see it, well, two big problems. The money left for the NLX account, the train to Duluth, that could have fixed a lot of our transportation issues, as Senator Jasinski said. And what we're saving that for, I don't know. Maybe people don't see the writing on the wall with this, but that project should be dead. And we shouldn't keep money allocated for it. The other problem here is the $97 million of trunk highway funds for the State Patrol headquarters. And I'm a big fan of the State Patrol, and by all accounts, it's a needed project. But trunk highway funds should not be used for it. Not only is it bad policy, Mr. President, I think it violates our state constitution. Article 14, Section 6 of our Minnesota Constitution spells this out, that it says that, that the trunk highway fund should be used solely for the purposes specified in Section 2, which is the trunk highway system. And it goes on to describe what the trunk highway system is. And on no reasonable interpretation could you say a State Patrol headquarters meets the definition of what's laid out in our Constitution. And I know that we have enacted a statute, 161.045, that says a commissioner may expend highway user tax distribution funds only for highway purposes and may expend trunk highway funds only for trunk highway purposes. And then there's some limitations, which as a lawyer, I'm looking at it saying, well, if it can only be used for trunk highway purposes, why are we putting a laundry list of things that aren't trunk highway purposes? There's a whole universe of things out there that aren't trunk highway purposes. So it's a completely poorly written statute that needs to be fixed now that I see this. But the bigger picture here is that I believe spending this $97 million for the State Patrol headquarters using trunk highway funds violates our state constitution. And it's also bad policy. These are dedicated funds that should be going to our trunk highway system, which is critically important in Anoka County, particularly in my district, that still has pressing needs on its trunk highway system. I've got an intersection up in Ham Lake at Bunker Lake Boulevard and Highway 65 that desperately needs to be fixed, that wasn't included in this bill. And we're raiding the trunk highway funds, which could be used to rebuild that intersection. And so we need to be constitutional in how we make laws, and we need to make good policy and use the trunk highway funds for our trunk highways. There's other things in here that I have a problem with, but in the interest of time, I'll just leave it at those two things. I think we need to do a lot better job in how we make laws in this state, and the transportation bill in particular has a lot of problems with it as well, so I will be voting no. Thank you, Mr. President.
Senator Carlson, are you ready?
Thank you, Mr. Chair. I am ready. I was looking for my prepared notes and didn't notice that I was up next. So I just wanted to say mainly that this is a bill that reflects the committee chair in its level of compassion for everyone, inclusiveness. Senator Dibble does not have a total dedication to the cities because he's actually a rural person at heart. I've been in the Senate Transportation Committee this is my 17th year, and with 3 different committee chairs. Every one of them I've agreed with and disagreed with at times, but there's no chair that was really as helpful as Senator Dibble was. When we had a tough problem to resolve, Senator Dibble was always there with understanding and sometimes with money as well. So I really appreciate Senator Dibble. I appreciate this bill, and I strongly recommend that we get a green vote on it. So thank you, Mr. President.
The last voice we'll hear from, let's see. I thought we were going to the last voice that we were going to hear from was Senator Dibble, but we have another who wants to speak. Senator Nelson.
Well, thank you, Mr. Chair. I just wanted to speak a little bit to this bill and also really the joy of being on the Transportation Committee. The first time in 17 legislative sessions I've been on the Transportation Committee, and I do want to thank Senator Dibble for really leading a well-run committee, and one in which I learned a lot. With that said, however, I will not be able to vote for the bill tonight, and I did want to explain briefly why, but I also wanted to offer thanks for a couple pieces in the bill that I think were good bills, good positions. The Southeast Minnesota Transportation Management Organization, I appreciate Senator Dibble's support of that. That's an innovative way to maximize transportation of many different kinds in oftentimes rural areas, so I was very glad to see that. And I also appreciated the traffic calming infrastructure to cities of the first class. But there's some things that really concern me. Specifically, delaying the highway user dedicated trust fund from the auto parts sales tax. We have worked for years on that. We started that my first year here in the Senate. So much needed, and it's so disheartening to think that this year, here we are delaying that transfer to our roads and bridges. So I find that disheartening, especially when you think last year we had this huge over $18 billion surplus, and now here we are really delaying the transfer of the auto part sales tax. So I am very sad about that. And I also, the cuts to corridors of commerce, that's very important for my district, so I do not like to see that. And I'm concerned about the cuts to the Greater Minnesota Transit account. So while I definitely appreciate the good way the committee was handled, the bill before us today includes too many things that are problematic for my constituents. In spite of the couple of the good things I mentioned, I just will not be able to vote for this bill.
Senator Johnson.
Thank you, Mr. President. Appreciate that. So first of all, I just wanted to say a public thank you to Senator Dibble and Senator Frantz for working to get into the initial bill that left the floor, an amendment that Senator Jasinski and I had worked on for something that's pretty near and dear to me, industry up in my district, Polaris Industries and others, that build these Articat and Polaris ATVs side-by-sides that have been a big economic boon for the state of Minnesota. We see trail networks that clubs are maintaining and doing a lot of work on across the state, a big recreational issue that we have in the state, and actually a lot of ATVs and UTVs are here in the Twin Cities area, registered within the 10-county metro area. So it's a big issue for them as well. What we were trying to do is simply raise up the weight limit. As they're turning over a lot of the new industry over to electric vehicles, electric-powered UTVs, the weight gets a little bit heavier with those larger batteries on there and the accommodations with that. And so hopefully that's something we can work on going forward. Just appreciate that effort, and maybe next year we can get closer into that and get that across the finish line.
Senator Dibble, for your final comments, because I know that you gave us an extensive version of the bill. Senator Dibble.
Thank you, Mr. President. Thank you, members. Appreciate all of the comments and all of the participation in this discussion. I just wanted to respond very quickly, Mr. President, just to a couple of things. It's important to note that while the auto parts sales tax is used to help balance both in the next biennium and the tails, something that I don't think perhaps people paid as close attention to is the fact that even with just that temporary pause of money flowing to the highway user tax, we created a whole new tax to backfill that. Meanwhile, transit is experiencing a permanent cut to the base. I didn't hear any concern about that expressed by my colleagues, and I wish I would have, because of course we strive in Transportation Committee and in this bill to serve all Minnesotans who need mobility, who need access, who need opportunity. And members, roads over time are being treated in a very, very robust way. We have the revenues that flow from the 2023 bill, of the gas tax, license tab fees, and motor vehicle sales tax increases, as well as the new sources that we created, as well as the one piece that we're talking about, the dedication of general fund that's coming over from the auto parts sales tax. With respect to the county's piece, completely understand that this came in the result of negotiation and not in the process of committee deliberation. I am wide open to that criticism, that critique, and appreciate that as well. But let's understand the proportionality of what we're actually talking about. In 2023, again, in that historic bill, that historic year, the metropolitan area counties realized a windfall to the tune of hundreds of millions of new dollars. And over time, if you look out over the next 10 or so years, billions of dollars that are coming to the counties. This is a small piece. I hope we can continue to have that conversation because, of course, that's about making sure that we can build out the bus rapid transit system in our regular route system, our disability transportation, as well as microtransit throughout the entire metropolitan area. Counties had an opportunity to do that, coordinate that regional investment in the form of the County's Transit Improvement Board that was established in 2008 with a quarter-cent sales tax that they were asked to levy. And they did that for a few years, and then they completely disbanded that effort and kept those dollars for themselves and indicated that they weren't interested in all in coordinating together and building out and cooperating with Metro Transit on that piece. And so much so that Ramsey County, which was saving money to build Transitway down the Riverview corridor, accumulated $730 million from their sales tax source. The decision has been made to shift that mode, and rather than save that money to build what is likely going to be bus rapid transit down West 7th and Riverview corridor, they're going to take that money back and spend it on county road projects throughout all of Ramsey County. So it's a little bit hard to believe that suddenly Ramsey County is going to be poor when they have $730 million that they can just take back and spend as they see fit. Likewise, members, it's important to know that Anoka County, Dakota County, some other counties have the opportunity to raise a full half-cent sales tax, and they decline to do so. They only raise a quarter-cent sales tax. They have the ability to raise the wheelage tax from $10 to $20. Dakota County still raises only $10. Anoka County has completely turned its back on those revenue sources that they can generate on their own behalf. So they're not fully partnering with us on those kinds of investments in transportation and transit. So that was the genesis of the idea. And if you look at the charts, the amount of revenue that's coming to counties, both presently, here's the chart, you probably can't see it, as well as what would have happened after the proposal. All the lines still go right on up, kind of fairly healthy slope. So again, it wasn't ready for the prime time. Process was flawed. We didn't lay the groundwork or build the conversation. Totally legitimate criticism and critique. But the claims on the counties that somehow they're going to have to raise property taxes or they're going to become impoverished as a result of this proposal, that's just not the case. So I just needed to settle that discussion, Mr. President. I do want to say thank you very much to my friend and partner, Senator Jasinski. We have a very positive relationship. The bill is very bipartisan. I think fully half of those policy proposals that I ran through, half the proposals in the bill do come from the Republican caucus, and appreciate the great conversation we have. Thank you to all of our committee members, Senator Carlson, Senator Hurst, Senator McHugh, Senator Paugh, and then our conference committee members, Senator Clark, as well as Senator Lang, Senator Nelson, Senator Farnsworth, Senator Howe. A huge thank you to our staff. We are nothing and are nowhere without our staff, Beth Ethier and Alex Will, who work in my office, do a tremendous job. Danny Gillis, who's my partisan researcher, phenomenal work, and I'm so deeply appreciative to all of his work. Tom Sheeta, who works with Senator Jasinski, Dave Reisanen, and of course, the amazing Krista Boyd, and we have to, of course, salute Tim Greenfield. This is his final hurrah. He is moving on to the city of St. Paul, but he has been a phenomenal Senate counsel, and I couldn't thank him enough for all of his fine work. As a matter of fact, this is his last day. right here. This is it, final hurrah. So, Mr. President, if I could just take one moment, a point of personal privilege. Everyone knows that I had experienced a pretty profound and unexpected loss in my family, the loss of my beloved sister, Deanna Lynn Dibble West, and the help that Danny Gillis and John Marty and our professional staff, Krista, Tim, and others provided to me working through that period of time, negotiating this bill. I couldn't express enough gratitude, and I cannot express enough gratitude to everyone in this chamber who has been so kind and so loving to me and my family. Deanna was an amazing human being. Many of you knew her. She showed up at a lot of events, and she was a really, really wonderful, happy, dear, sweet soul. If you're not too exhausted tomorrow, you're welcome to join us at her celebration of her life at Plymouth Church in Minneapolis. We'll get going at 2 o'clock. We have a visitation at 1 o'clock. But if you're exhausted, I totally understand. I feel your love. You've been fantastic. With that, Mr. President, I would encourage a green vote on this great bill. Thank you very much.
Our condolences to your family. Needless to say, the Secretary will take the roll on final passage for House File 14. Members, please vote. Senator Bowden, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Latz votes aye.
Senator Latz votes aye.
And Senator Port votes aye.
And Senator Port votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes no.
Senator Dames votes no.
Senator Drazkowski votes no.
Senator Drazkowski votes no.
And thank you, Mr. President. Senator Lang votes no.
And Senator Lang votes no.
Let me help you out. That's a positive.
All senators having voted who desires to vote, the Secretary will close the roll. There being 35 ayes and 32 noes, the bill is passed and its title agreed to. Remaining under motions and resolutions will revert to the third order of business. Messages from the House. The Secretary will read the first message.
Mr. President, I have the honor to announce the passage by the House of the following Senate file herewith returned. Senate File Number 17, a bill for an act relating to state government establishing a biennial budget for jobs, labor, and economic development. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
The Secretary will read the next message.
Mr. President, I have the honor to announce the passage by the House of the following Senate file herewith returned. Senate File Number 2, a bill for an act relating to energy, appropriating and transferring money for energy and renewable development account programs and activities. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
No action is required. Members, I believe there is one more message. The Secretary will read the next message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted. House File Number 3, signed Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, no action is required. The next order of business is the fourth order of business, first reading of House bills. The Secretary will give the bill its first reading.
House File Number 3, a bill for an act relating to human services, amending provision on aging and older adult services, disability services, health care, etc.
The House bill has been given its first reading. Members remaining under motions and resolutions, I now call on Senator Murphy for a motion.
Thank you, Mr. President. I move that an urgency be declared within the meaning of Article 4 and Section 19 of the Constitution of Minnesota with respect to House File 3, and that the rules of the Senate be so far suspended as to give House File Number 3 its second and third reading and place it on its final passage. I request a roll call.
Roll call requested, roll call granted. The Secretary would take the roll on the motion to suspend the rules. Senator Bowden, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
And Senator Port votes aye.
And Senator Port votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Drazkowski votes no.
Senator Drazkowski votes no.
Senator Lang votes no.
Senator Lang votes no.
I'm still waiting on two more.
Senator Jasinski.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes aye.
And Senator Dames votes aye. All senators having the desire to vote and has voted, the secretary will close the roll. There being 45 ayes and 20 noes, the motion to suspend the rules prevails. The secretary will give the House file a second reading.
House File Number 3.
The House file has been given a second reading. With no amendments, the secretary will give the bill its third reading.
House File Number 3, a bill for an act relating to human services, amending provisions on aging and older adult services, disability services, health care, etc.
Third reading. Senator Hoffman.
Mr. President, thank you. This is a special session, Human Services. We had a real task, difficult charge, crafting a budget that reduces spending by $1.1 billion. There are a lot of things in here that are exactly how they left the Senate floor. And with that, Mr. President, I would want to forego my 25-minute speech regarding how today marks a day that a certain musician wrote a song for a certain band called Manic Monday. I don't know if you know who that musician is, Mr. President, but I do want to thank gratitude to our Senate staff, David Zack, Cassie Soar, researchers Emily Spatero and Bryce Hickst. A big thank you to our interns, Amanda Riviera Torres, Amber Dunham, and Cal Luttrell, and to our pages, Chloe Adele, Olivia Anderson, and Roan Chaffee. To the House staff, the other body, Nick Stuma-Langer, Megan Rosbach, Elijah Henderson, Joseph Frauhoff, and our researchers, Molly Peterson and Tom Brennan. Your professionalism and actually being able to leave your ego in the hallway made a lot of sense to us. I want to thank the House legislative analysts, Danielle Pinelli, Sarah Sunderman, fiscal analyst Doug Berg, and our Senate analyst, Leah Monahan, who's an amazing individual and a gift to the state of Minnesota, as well as our Senate fiscal staff, Kyle Raymond. So glad you moved from the great state of Washington to Minnesota. Your guidance and clarity have been critical every step of the way. A sincere thank you, Mr. President, to our partners at the Department of Human Services, Christy Grom, Elise Bailey, and Shireen Gandhi, the commissioner. The deep knowledge and responsiveness that they had, and added to that, Carrie Briones from the Direct Care and Treatment. Thank you for your leadership during these complex negotiations. It was not easy, Mr. Chair, Mr. President. This was not easy. We were able to do what we needed to do, and we didn't require anybody from mediation to come and hang out with us. So this process would not be the same without the priorities that we were able to establish, because we did leave with a unified result that reflected our collective effort and our willingness to compromise, and not needing that mediation, our shared commitment to the people of Minnesota. This is what governing looks like, Mr. President. Vote green.
Senator Rasmusson.
Thank you, Mr. President. First off, I just want to thank the engagement on the Human Services Committee, and every member of the committee on both sides of the aisle care a lot about the important work that we do on the Senate Human Services Committee. And the reason why it's so important to get this budget right and to get this policy right is because it directly impacts the lives of Minnesotans, Minnesotans with disabilities, Minnesotans in our nursing homes, Minnesotans who are the most vulnerable. And I want to call out a couple of provisions in this bill that I think are good, and that, in fact, Senator Abler was a champion of, and had an amendment here on the Senate floor for the Senate Human Services bill that established a strong position that we see still remaining in the bill before us. The first was a focus on eliminating county cost shifts. We saw Governor Walz propose $460 million in cost shifts to our counties that would have increased property taxes, at least in the areas I represent, by anywhere of 5 to 9% on Minnesotans who are on a fixed income, who are struggling to afford to stay in their home. Senator Abler brought an amendment on the Senate floor that eliminated that, and I'm glad that the county cost shift issue has largely been addressed in this bill. Second, also a part of the amendment that Senator Abler brought on the Senate floor that was adopted was expanding capacity for direct care and treatment. We heard from Minnesota's sheriffs. We heard from Minnesota's county attorneys. We heard from Minnesota families who have loved ones who are languishing in Minnesota jails waiting to get a bed at direct care and treatment. With the funding in this bill that was in Senator Abler's amendment and funding in the bonding bill, we'll be able to expand 50 beds in our state hospital system. That's really important. However, Mr. President, the main challenge with this bill is the Democrat-created deficit. When we go back to 2023, Minnesota Democrats had an $18 billion surplus. And after they increased state government spending by nearly 40%, we've now left us with a $6 billion deficit. And unfortunately, we see the real consequences of that spending spree in this bill. First, I want to draw members' attention to the fact that this bill will increase a tax on Minnesotans who are in nursing homes. I want to say that again. This bill will increase by about $137 million over 4 years a tax on nursing home beds. For Minnesotans who are private pay, who are using the remaining savings they have to pay for their stay at a nursing home, this will be additional money that's coming out of their pocket. It will impoverish Minnesota seniors. It will push them onto public programs quicker. And it's one of the consequences, Mr. President, of this $6 billion deficit. We also see additional cuts to Minnesota nursing homes in this bill. By putting the cap on VBR, we see $161 million in cuts to Minnesota nursing homes over 4 years. We also see in this bill hundreds of millions of dollars in cuts to disability services. Again, a result of the spending spree. Mr. President, we didn't have to have a big cut target for human services. If Minnesota Democrats would have showed fiscal prudence back in 2023 and not increased government spending by 40% over one budget cycle, maybe we could be talking today about how we're investing in Minnesota human services instead of clawing back hard-fought gains. And so, Mr. President, while I appreciate that there has been bipartisan collaboration on this bill, and I appreciate Senator Hoffman and Senator Abler working to find the best possible solutions given the cuts that they had to make in this bill. I do stand with these concerns, and I can't support increasing a tax on Minnesotans who are in nursing home. And so, Mr. President, I'll be encouraging members to vote against this bill today because we need to make sure that we're prioritizing the most vulnerable in society, and those are our seniors in nursing homes, those are families with loved ones who have a disability, and this bill, unfortunately, makes them worse off.
Senator Hoffman, your last words before we vote.
Thank you, Mr. President. All I wanted to say was we bring this to a close, the deep appreciation that's there. The co-chairs, Representative Mohamed Noor, Representative Joe Schumacher, it was a partnership, Mr. Chair. We were given a terrible, terrible target in that even though when we disagreed, we remained anchored in our shared purpose to deliver just a just and responsible budget for Minnesotans. To the Senate colleagues, Mr. President, Senator Jim Abler, Omar Fateh, Aaron May Quaid, Zainab Mohammed, thank you for bringing your perspective. And I just wanted to make sure with that, Mr. President, we did what you asked us to do. Thank you.
The Secretary will take the roll for final passage on House File 3. Senator Bowden, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Klein votes aye.
Senator Klein votes aye.
And Mr. President, Senator Dibble votes aye.
And Senator Dibble votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Dames votes no.
Senator Dames votes no.
Senator Drazkowski votes no.
Senator Drazkowski votes no.
Senator Lang votes no.
Senator Lang votes no.
And stand by, Mr. President. We gotta get one more. Mr. President.
Senator Jasinski.
And thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye. All senators having voted, who? Everyone voted. All senators having voted who desires to vote, the secretary will close the roll. There being 35 ayes and 32 noes, the bill is passed and its title agreed to. Remaining under motions and resolutions, we will revert to the third order of business. Messages from the House, the secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted. House File Number 5, signed Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, no action is required. The next order of business is the fourth order of business, first reading of House bills. The secretary will give the bill its first reading.
House File Number 5, a bill for an act relating to education, modifying provisions for pre-kindergarten through grade 12 education.
The House file has been given its first reading. Remaining on motions and resolutions, Senator Murphy for a motion.
Mr. President, I move that an urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to House File Number 5, and that the rules of the Senate be so far suspended to give House File Number 5 its second and third reading and place it on its final passage, and I request a roll call.
Roll call requested, a roll call granted. The secretary will take the roll on the motion to suspend the rules. Senator voting, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Klein votes aye.
Senator Klein votes aye.
And Senator Dibble votes aye.
And Senator Dibble votes aye. Senator Rest, are you voting? Senator Limmer, are you voting? Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Drazkowski votes no.
Senator Drazkowski votes no.
Senator Lang votes no.
Senator Lang votes no.
Still waiting on two.
Senator Jasinski.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes aye.
Senator Daines votes aye. All senators having voted who desires to vote, the secretary will close the roll. There have been 45 ayes and 20 noes. The motion to suspend the rules prevails. The secretary will give the House file its second reading.
House file number 5.
The House file has been given a second reading. I'll now call on the author of the bill to explain the bill. Senator Kunesh.
Thank you, Mr. President. Members, before you is the K-12 education budget bill. And I just want to remind everybody about the common sentiment about the value of education, particularly here in the United States, that is key to unlocking opportunities and a better future for our students, but not just for our students, but for our teachers, our paras, our hourly workers, and our communities. I'd like to start by thanking the incredible staff that made this committee so successful. My committee administrator, Emma Zellmer, and legislative assistant, Tessa Yeager. I thank them very much for keeping me on track and keeping me organized, as well as our researcher, Ryan Majers. We have a couple of Dynamo interns, Sequoia Ultramarino and Sam, and 3 Rockstar committee pages, Olivia Mackle-Winders, and Sine Amente and Michael Edwards. Thank you very much for all the hard work you did in getting us organized and keeping us on track during our committee hearings. Thank you most sincerely to our Ed Finance nonpartisan team, who hold an incredible depth of knowledge and organization. Fiscal analyst Jenna Huffer, analyst Bjorn Arneson, and counsel Anne-Marie Lewis. I have to say that this has been a particularly productive and rewarding partnership with Senator Swedzinski, the chair of education policy, and I so appreciate the collaboration of his team, Tristan Vogeli and Eileen Otto. I also want to acknowledge our GOP lead, Senator Rarick. I think we were a good team, and I enjoyed our collaboration as we co-chaired the committee in the early part of the session, and thank you for joining us at the end of our negotiation time. I also enjoyed working with his staff, Ed Cook and Karen Johnson. And then a final shout out to Commissioner Jett and his well-organized team who worked so very hard to ensure that our students and staff have the resources and the opportunities to thrive. Members, this bill, this budget reflects agreements from Republicans and Democrats through intense, productive, and bipartisan discussion with the House chairs Krisha and Joachim, and I hope that we have earned your support with a green vote. The Minnesota Department of Education reports that the total enrollment for the school year 23-24 had reached 943,220 students. Of this number, 870,693 students are enrolled in public schools, while 72,529 learners are registered in private institutions, approximately 8.3%. This Minnesota State Legislature holds a significant legislative responsibility for the public schools in our state through our constitutional mandate, Article 13, Section 1 of the Minnesota Constitution, that states, directs our duty of the legislature to establish a general and uniform system of public schools and makes provisions through taxation or otherwise to ensure a thorough and efficient system of the public schools through the state. This demonstrates that this legislature has a fundamental role in shaping and supporting public education. And so I am confident that these bills meet those expectations quite successfully. I want to talk now about the finance part of this bill because we merged the policy. We didn't get to hear the finance section on the floor before our session ended, and so I'd like to just go through that a little bit. This session, the state DFL has been focused on preserving the E12 investments from the 23 DFL-led education budget, which included the largest funding increase in state history, and we are committed to continuing to prioritize our students, our teachers, and our classrooms. We had a difficult budget cut target of $420 million in the future budget cycle of fiscal years 28-29, and had to make tough reductions that will hopefully never come to fruition if we experience a budget surplus in the next 2 years. We preserve funding for the upcoming budget cycle while acknowledging the need to curb spending growth in future budget years, and we are remaining committed to keeping cuts out of the classroom and focused on education reform. Keep in mind that our school districts will see a 2.7 basic education formula increase in 2026 and another inflationary increase of 3% in 2027, and that formula will continue to be tied to inflation into the future. The Senate DFL priority is to preserve funding for critical investments in English language learner aid, universal meals, student support personnel aid, library aid, the READ Act, teacher preparation and recruitment programming, and school infrastructure. And we did just this. Maybe not at the levels that we wanted, but we did the best that we could. I am very pleased to share that there is language to ensure continuation of funding for compensatory revenue, which is provided to schools with a greater level of students in poverty. With no change in this law, schools could have seen a $50 million reduction. This agreement will hold harmless funding levels for 1 year and then create a working group to determine the most appropriate formula for distributing compensatory aid in future budget. Senator Clark's proposal to create a working group to study compensatory aid also was included, and we're excited to hear their recommendations. We did have some difficult negotiations. For example, one specifically was on whether state subsidies for private schools should be reduced or eliminated. As our Constitution specifically states, public dollars, taxpayer dollars, should give priority to public school use, not private schools. But in the end, the Senate DFL agreed to continue to fund non-public schools at their current levels. Despite having to make difficult budget cuts, there were small areas where we were able to make beneficial improvements. We provide $880,000 to help school district purchase AEDs to be made available in school buildings and school-sanctioned athletic events. The schools will be required to adopt a model policy for cardiac emergency response plans to be prepared in instances of cardiac emergencies, not just for our students, but those who are in attendance. This funding will help save lives, and I'm proud to have helped shepherd this with the advocacy of Senator Bonnie Wiklund. We provide additional money for Math Corps, which provides critical tutoring services, ensuring every student is grade level proficient in math. Math Corps is a tutoring program that focuses on improved student math skills, particular for those struggling with foundational math concepts. This program is in partnership with the federal government through AmeriCorps and states like Minnesota, where it's operated by Serve Minnesota. The program uses AmeriCorps members to provide tutoring support, and this was spearheaded to get across the finish line thanks to Senator Heather Gustafson. This investment is especially vital as we have seen other federal programs like Peace Corps seeing its potential 25% reduction in global staff and more drastic cuts of 50 to 80% to its Washington, D.C. headquarters, and the termination of nearly $400 million in AmeriCorps grants without any notice. It's important that we as a state continue to support this. This bill also provides $4 million additional dollars in financial support for special education teacher apprenticeship program through our intermediate districts. This program graduated 30 students in the last biennium and has shown great success in recruiting and retaining SPED teachers. And if I remember, our committee members, and specifically Senator Rarick, was very impressed with the success of this program and expressed interest in a broader application across the state. And so hopefully maybe next year, if there is an additional funding, we can make that happen. Senator Hoffman's developmental delay work group was added during negotiations, and this establishes a working group to create awareness and recommendations to adjust the age limit for students and children receiving services for developmental delays. Senator Seeberger's seclusion working group to study the use of seclusion in our schools was included, and thank you for all of those that worked so hard, and Senator Seeberger for adjusting it to make this happen. We created a working group to look into dual immersion programs within the READ Act, and thank you very much to Senator May Quaid for her hours and hours of work on this issue. Senator Rarick's ice arena levy is included. This authorizes 2 or more school districts to appropriate the levy for the cost of cooperative operation of an ice arena among cooperating districts. Another provision from Senator Rarick is to double the support given to schools when undergoing the consolidation process. We ensure that school aid continues to be provided for our 4 tribal contract schools in Minnesota that have historically been excluded from access to the school trust land proceeds in spite of the vast majority of school trust lands being near or in our tribal reservations. And our tribal schools will now be eligible for programs that traditional districts and charter schools have been eligible for, as far as grants, PSEO, and more. We are able to authorize school districts to include roof repair and replacement costs totaling $100,000 or more per site in the district's annual long-term facilities maintenance, or LTFM, revenue authority. And for most districts, this specific authority would increase revenues potentially available for roof repair and replacement, thus freeing up money currently being spent for purposes for reallocation toward other deferred maintenance projects. This bill also expands eligible uses for nutrition funds to anything allowed under the federal law. There are very specific rules and laws when it comes to from the federal government on how those nutrition funds can be used. But we also lowered the extra school lunch aid amounts by 6.25 cents per meal beginning in fiscal year 2028 without affecting the universal meal program. We also included Senator Draheim's bill requiring schools to allow students to purchase a second breakfast or second lunch at full cost. But unfortunately, as with many areas of our education budget points, we needed to reduce, and one of the areas was our school library aid, which was a very difficult decision for me in our fiscal year 2026 and later. But we will continue to support our new library media specialist funding. The main budget reduction in the E12 education is tied to a new Blue Ribbon Commission on Special Education, which will be charged with finding $250 million in savings from our special education spending growth. And if that full saving is not found by the Commission and passed into law by the next legislature, there will be a corresponding reduction to SPED cross-subsidy aid. The Commission will be required to take public testimony and receive input from the SPED stakeholders from across the state, and the membership will include legislators, representatives from the governor's office, since this was his proposal, and the school special education administrators and experts. There is a reduction from 10% to 6% in charter school, special education charter school reimbursement in the tails, and this additional money is on top of what the districts already reimburse those charter schools. Student support personnel aid growth is seeing reduction. $17 this year will be, it'll be $17 this year, and then $30, up to $30 in fiscal years 26-27, and then $34 per student in the tails. Although this is an increase to current law, it is a decrease from the projected amount. We also increased the allowable uses of these funds, including a house child provision that allows the funds to be used to maintain current staff at schools with declining enrollment. As far as the special education transportation reimbursement, that is reduced from 100% to 95% in fiscal year 26 and then 90% after that. The increase in the SPED cross subsidy will probably offset this cut. Equity in telecommunication aid helps public schools and non-public schools in Minnesota pay for internet access and related connectivity needed to deliver instruction, but this receives a cut in the tails. This is a partial reimbursement to the districts for eligible costs and currently is a 50% reimbursement. We did sunset a majority of nonprofit grants in the tail. We increased accountability for nonprofits that receive grants from the Department of Education and ensure that the commissioner can cancel those contracts to bad actors. This was included with additional legal funding to hire more investigators and general counsel. We included some one-time funding for grants in our budget to the Minnesota Youth Council, MAP stars for our intermediate districts, and funding for the Electronic Library of Minnesota. We were creative in order to avoid major cuts to grow your own program by placing additional dollars in the special revenue account in 2027 to offset those the cuts in the tail. We made strides toward Senator Mann's bill to increase students' access to AP courses by allowing the commissioner to prioritize AP grants to schools who start implementing direct enrollment in AP courses and expanded eligibility for full-service community school grants. That was an Uma Verbaden bill. We also ensured that with the attack on education departments from the federal government, that MDE, the state academies, and PELSB could maintain the level of support that they provide our schools through an operating adjustment. Members, that is a brief overview of our finance bill, and with that overview, I would like to ask Mr. President if Senator Swazinski would yield to update you on the policy items that are attached to this finance bill.
Senator Swazinski, if you can share with us what was not shared when the bill was first here. Senator Swazinski.
Thank you, Mr. President, and thank you, Chair Kunesh. It's been a pleasure and an honor to work with you. It's my firm belief that the purpose of our role as chairs of policy and finance is to secure life, liberty, and the pursuit of happiness for our educators and our students. These are the values guiding the Education Working Group, that a strong education system empowers Minnesota's youth to participate fully in democracy, advocating for their rights and access opportunities that lead to economic stability and personal fulfillment. In our negotiations as the working group, the changes, as all of you may remember, we heard the policy bill a few weeks ago, and it passed off the floor with bipartisan support. I thoroughly enjoyed the working group that we had. It was bipartisan, bicameral, collaborative. It's not easy, as all of you know, we're having 101 legislators to 100. At times I felt like I was at an amusement park where at times my head felt like a pinball machine, or I was on a roller coaster or in a bumper car. And just like at an amusement park, I loved every single minute of this process. The bipartisan bill that passed off the floor is even more bipartisan now. The changes we made in the working group dealt with empowering more parents and students and helping us track chronic absenteeism. We streamlined the public data process. We've promoted health and mental, physical, and emotional well-being for our students. We've done some major charter school improvements. We took out some musts and replaced them with mays. We took out some cell phone policy. We made some compromises on the READ Act. The working group, and Senator Kunesh already alluded to this, but we've set up a seclusion room working group for next year, and we did some language we had to take out on catastrophic insurance injuries for our athletes. The bill is improved,
since we've last seen it on the floor, and at least with respect to the policy bill and the finance bill, we're urging members for a green vote. Thank you.
Members, we'll now only deal with amendments. After amendments, we'll go to third reading, and if you want to be on the list, then you can do so. Senator Lucero.
Thank you, Mr. President. I'd like to offer the A1.
Senator Lucero offers the A1 amendment. The Secretary will read and report the A1 amendment.
Senator Lucero moves to amend House File Number 5 as follows. Page 17, after line 15, insert. This is the A1 amendment.
Senator Lucero to your A1 amendment.
Thank you, Mr. President. Thank you, members. This is an amendment that you've seen before. The topic is general education disparity aid, targeting money at the bottom 20% of school districts across the state. This is a bill that I've turned into an amendment multiple times, and we have voted on. It has passed omnibus bills only to be stripped in conference committee. We've had conversations about this in committee. This is a bipartisan issue where the same school districts are consistently at the bottom, which robs students of academic opportunities. And this is a bipartisan solution. The underlying bill for this amendment has bipartisan authors. So members, I'm offering this because unfortunately, here we go once again in another funding year where we are ignoring this very real problem. This is a common sense solution, bipartisan. I'm hoping to gain your support. I'm asking for a green vote and a roll call.
Roll call requested, roll call granted. Senator Kunesh, or is it Senator Swazinski to the A1 amendment?
Thank you, Mr. President. And we, of course, have spoken about this very often and recognize the responsibility of the community to help support those schools and those students. But the budget that we have put together is a budget that reflects agreements from both Republicans and Democrats through tough negotiation and bipartisan work. And so I'm going to ask members to vote no on this amendment to prevent a government shutdown.
Any other discussion before I go back to the author of the A1? Seeing none, the Secretary will give the A1, will take the roll on the A1 amendment. Members, please vote. Senator Bowden, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes no.
Senator Mohammed votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Port votes no.
Senator Port votes no.
Senator Klein votes no.
Senator Klein votes no.
And Senator Dibble votes no.
And Senator Dibble votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Drazkowski votes aye.
Senator Drazkowski votes aye.
Senator Lang votes aye.
Senator Lang votes aye.
And still waiting on one. Thank you, Mr. President.
Senator Jasinski.
Thank you, Mr. President. Senator Dames votes aye.
Senator Dane votes aye. All senators having voted who desires to vote, the secretary will close the roll. There being 32 ayes and 34 noes, the A1 Lucero Amendment is not adopted. Senator Nelson.
Thank you, Mr. President. I have the A2 amendment.
Senator Nelson offers the A2 amendment. The secretary will report the A2 amendment.
Senator Nelson moves to amend House File Number 5 as follows. Page 38 after line 5, insert. This is the A2 amendment.
Senator Nelson, to your A2 amendment.
Thank you, Mr. President. Members, the A2 amendment is something that our recent polls show us that indicate that overwhelmingly the public supports a simple amendment like this. The A2 amendment would do two things. One, it would require that school-sponsored interscholastic, intramural, or club athletic teams be expressly designated as one of the following categories. Very simple: male, female, or co-ed. And then, of course, the second piece of the bill requires that obviously the Minnesota High School Athletic League would adopt language rules and policy consistent with this subdivision. It is very straightforward and certainly well supported by our constituents. It is important for girls to have sports that are designated for girl sports. I would ask for a roll call and look forward to strong support. Thank you, Mr. Chair.
Requested and the roll call granted. Senator Kunesh or Senator Swazinski? Senator Swazinski to the A2.
Thank you, Mr. President. And as Senator Kunesh already said, this budget, and both policy and finance, reflects agreements from Republicans and Democrats through the tough working group negotiations and bipartisan, bicameral work. I'm going to ask members to vote no on the amendment.
Senator Farnsworth.
Thank you, Mr. President. Mr. President, I've risen in this body before to speak about this topic. It's personal to me. I have two daughters, Mr. President, and both of them participate in track. Actually, they used to participate in softball. I'm kind of glad they don't anymore, but they both participate in track, and this is a timely amendment because I don't know if you know this, Mr. President, but the track state meet is happening this week, and so my oldest daughter will be traveling to, I think, Senator Lucero's district to participate in the state track meet, and we're excited about that. But if she was competing against boys, she wouldn't be going. So I looked, about 2 weeks ago, I had the opportunity to go to North Branch to the sectional meet, and it was noticeable how much faster the boys were than the girls. And so I just took some information down, Mr. President. In the 4x800 meter race, the boys won with, the winning relay won at 8 minutes and 14 seconds. The winning girls relay won with 9 minutes and 48 seconds, a minute and a half slower than the boys, Mr. President. The 4x200, the boys won with a minute and 28. The girls won with a minute 43. 15 seconds slower. And I'm going to keep going. I have a number of these. The 400 meter, the boy won at 49.73 seconds. The winning girl won at 58.76. Almost 9 seconds slower than the winning boy. The 1600 meter, this is a fast mile. The boy won at 4:15, Mr. President. The girl runner won her race and won that meet in 5 minutes and 3 seconds, 48 seconds slower than the boy. The 4x400 relay, the boys won at 3 minutes and 24 seconds. The girl relay won at 4 minutes and 5 seconds, 40 seconds slower. And it's not just speed, Mr. President, because in the field events, in the high jump, the winning boy jumped 6 feet 5 inches. The winning girl jumped 5 feet 3 inches. Not even close, Mr. President. I'm 6 feet, a little over 6 feet, so that would be about here versus about here. First scale. The long jump, this was a pretty big difference. The boy jumped 20 feet 9 inches. The winning girl jumped 17 feet 1 inch. The pole vault, the boy was at 13 feet. The girl was at 11 feet. And finally, the shot put. This is dramatic. Shows the muscular difference. The boy threw it 50 feet and a half inches. The girl threw it 37 feet. Mr. President, it is absurd that we would allow boys to compete against girls, that we would allow boys to stand on championship pedestals, that we would allow boys to take girls' scholarships. It is time to fix this wrong, Mr. President, and make sure that girls' sports are for biological girls. So I would encourage a yes vote on this. Thank you, Mr. President.
Senator Nelson, you'll be the last voice we hear before we vote. Senator Nelson.
Oh, thank you, Mr. President. Thank you, Mr. President. Well, members, you have heard examples of why this amendment is so important. And quite frankly, members, the NCAA has already adopted similar proposals. And as you know, federal law, Title IX, specifically requires, it was put in place for the very reasons that the good senator from Hibbing mentioned, that girls and boys have different levels of muscle development, capacity, breathing capacity, all of those things, length of limbs, all of those things are why Title IX was put in place in the first place. And for Minnesota to continue to allow boys to compete in girls' sports puts us in violation of federal law, certainly risk losing Title IX funds. It also is unfair to girls. It is unfair that girls need to compete against boys, and it is unfair in what we are doing to their future pursuits as well. I encourage a yes vote. Do what is right for your daughter, your granddaughter, who would want to participate in girls' sports. And again, I've asked for a roll call. Thank you, Mr. President.
The Secretary will take the roll on the A2 amendment. Members, please vote. Senator voting, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes no.
Senator Mohammed votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Port votes no.
Senator Port votes no.
Senator Klein votes no.
Senator Klein votes no.
Senator Dibble votes no.
Senator Dibble votes no.
And Senator Umu Verbatim votes no.
And Senator Umu Verbatim votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
I'm standing by for two more. Mr. President.
Senator Jasinski.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Drazkowski votes aye.
Senator Drazkowski votes aye.
And thank you, Mr. President. Senator Lang votes aye.
And Senator Lang votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There being 32 ayes and 34 noes, the A2 Nelson Amendment is not adopted. Senator Rarick.
Thank you, Mr. President. I'd like to offer the A3 amendment.
Senator Rarick offers the A3 amendment. The Secretary will report the A3 amendment.
Senator Rarick moves to amend House File Number 5 as follows. Page 22, line 19, after revenue, insert. This is the A3 amendment.
Senator Rarick to your A3 amendment.
Thank you, Mr. President. Members, when session began and we had co-chairs in the Senate, in both the Policy and the Finance Committee, we had a number of meetings where folks from our local schools came and not just asked for relief, but almost begged for some relief from the requirements and mandates that have been put on them, and not just from over the last 2 years, but for many years of this legislature putting different requirements on our schools as things they must do. Mr. President, virtually nothing in the bill in front of us is helping address those requests. Now, what we do have in the bill is a number of groups that have been put together to look into things. The compensatory task force, the Blue Ribbon Commission, we got a group looking at seclusion room reform. So I'm not bringing forward the amendment that's going to, our typical one we've done in the past, to require, or would allow school boards to take votes to relieve themselves of mandates they would pick or use flexibility of funds. But what this amendment does is it asks the task force that's been put together to look at the compensatory issue to look at these mandate issues as well, so that they can come forward with a recommendation to the legislature to offer some changes for these mandates that affect curriculum, personnel policies, classroom safety, budgets, and fund transfers. That's what the amendment would do, and I would ask for a roll call and members' support.
Roll call requested, roll call granted. Senator Kunesh to the A3 Rarick amendment.
Thank you, Mr. President. And I just want to remind folks that this budget reflects agreements from both the Republicans and the Democrats through really tough negotiation and bipartisan support. I'm going to ask members to vote no on this amendment and prevent a government shutdown.
Any other discussion before we go back to the author? Senator Farnsworth.
Thank you, Mr. President, and I will try to keep my comments just to the amendment, but I think I'll just make these my final comments on the bill. I do want to say, I've heard the chief author of the bill say a couple of times we have to pass the bill to prevent a government shutdown, and I think we all want to prevent a government shutdown, but that might be a small price to pay to save our schools from the disaster of the last 2 years. But Mr. President, early in session, when we still had the power sharing agreement, we had a lot of principals and administrators that came and testified in our committees, and they all begged us, pleaded with us for mandate relief. They knew the money was gone. They knew the $19 billion had been blown. Even though taxes were raised $10 billion, we're out of money, so they knew there wasn't a lot of new money for schools. So they said, what can we ask for that won't cost money that will help us? And so they asked for mandate relief. And Mr. President, they got none. They got zero mandate relief. In fact, they got more mandates. And I'm just going to use the Hibbing schools as an example. Mr. President, they're cutting 19 teachers. And Hibbing is not a huge school. They're cutting 19 teachers. They're cutting an administrator. They're cutting office staff. Mr. President, they're cutting, I think, 20 PSAs. And maybe if they didn't have to follow all of these mandates, they wouldn't have to make such deep cuts. But that's what they have to do. And they ask for mandate relief. Mr. President, I'm pretty certain that the other body is still in session. So if we accept this amendment, if we pass this bill, we can send it back over. They can concur. It will not cause a government shutdown. That is ridiculous. We are our own body. We can amend this bill, make it better. We can send it to the other body. They can concur. And we can help the schools with what they asked for. Thank you, Mr. President.
Senator Duckworth.
Thank you, Mr. President. I appreciate it. I would ask if Senator Rarick would yield for a question.
Senator Rarick, will you yield? He will yield, Senator Duckworth. Senator Duckworth.
Thank you, Mr. President, and thank you, Senator Rarick. Earlier, it was shared that there was a large target to reduce spending in this bill as it relates to education. I think it was 400-some million. Senator Rarick, to the best of your knowledge, what's the largest cut to education funding in this bill?
Members, I just want to remind you that we are on the A3 amendment, and if it's not connected to the A3 amendment, it's going to be problematic. But we will see what the answer is going to be. Senator Rarick.
Thank you, Mr. President. And I would believe the largest cut that we're looking at to get to that negative $420 million is the $250 million in savings that the Blue Ribbon Task Force is asked to try to find. Otherwise, it will come out of the special education cross-subsidy.
Senator Duckworth, we're on the A3 Rarick amendment.
Thank you, Senator Rarick, for that information, and thank you, Mr. President, for the reminder regarding the amendment. The amendment seeks to help provide relief as it relates to mandates in working group studies. Hence the question. Senator Farnsworth earlier mentioned that our school districts asked really for one thing this session, and that was relief from mandates. Not only did they not get relief from mandates that have put them into deficit, they actually are staring down the barrel of a massive cut as it relates to special education to the tune of $250 million, Mr. President. That's why this amendment is important. That's why making these folks also study the different ways in which we can provide mandate relief is extremely important. Mr. President, they asked for one thing. We didn't deliver. The only other thing I would add to the discussion is this. I feel that we have not done justice to, this was one of the main conversations we were supposed to have this session, funding and education. We never got the chance to do it in this body because the majority never brought the K-12 funding bill to the floor for a vote. And that's why you hear us talking about it, Mr. President. This amendment would try to help our districts in a pretty profound way. I hope members can be supportive of it. Our schools have asked for one thing. It's about time we deliver on it. Thank you.
Senator Nelson, we're on the A3 Rarick amendment. None, thank you. Senator Rarick, you're the last voice we'll hear before we vote.
Thank you, Mr. President. You know, I do agree with Senator Farnsworth's comment about the other body is still working. Accepting this amendment does not take us to shutdown. I believe this is an amendment that if this body sees worthy of taking, the other body would concur, because it's a message that has been sent loud and clear from virtually every school district around the state. This is just simply asking, let's look at this same issue like we're looking at the compensatory, we're looking at special education, and we're looking at the seclusion room issue. This is common sense. And again, you know, we probably could have come forward with so many different amendments trying to get at the things that schools have asked for, but as Senator Duckworth said, we never got that opportunity in the Senate. We're presented with this idea that here's a bill that was worked on by a working group that had, you know, only a few members. It really didn't have opportunities for the public to weigh in along the way. And now we're being told we can't really ever even consider taking an amendment because it'll blow the whole deal. Well, Mr. President, that's what we're here for. That's why we have election certificates. This isn't changing the budget that's in front of us. This isn't offering some new radical piece of policy. This is providing an opportunity to look into issues that our school districts have literally been begging for, because we've heard from all of our school districts, they are facing deficits because of so many of the requirements that have been put on them from the state level. This is simply asking, let's look at it, see what we can do to bring forward the idea of here are areas we can provide relief to give them this flexibility in their curriculum, in their policies, or in their funding. Please vote yes.
The Secretary will take the roll on the A3 Rarick amendment. Members, please vote. Senator voting. For those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes no.
Senator Mohammed votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Port votes no.
Senator Port votes no.
Senator Klein votes no.
Senator Klein votes no.
Senator Dibble votes no.
Senator Dibble votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
And Senator Fateh votes no.
And Senator Fateh votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Well, thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Drazkowski votes aye.
Senator Jaskowski votes aye.
And thank you, Mr. President. Senator Lang votes aye.
And Senator Lang votes aye. All senators having voted who desires to vote, the secretary will close the roll. There have been 32 ayes and 34 noes. The 83 Rarick Amendment is not adopted. The secretary will give the bill its third reading.
House File Number 5, a bill for an act relating to education, modifying provisions for pre-kindergarten through grade 12 education, providing policy and funding for general education, education excellence, etc.
Third reading. The bill's been given its third reading. Senator Westrom, are you up to speak, buddy?
I am.
Senator Westrom.
Mr. President. Mr. President, members, I rise to speak against passing this education bill because of the things that are missing from it. We had an opportunity with an amendment to make sure girls' athletics in the state of Minnesota remain for girls. Wasn't that many years ago that everybody poo-pooed that and said, oh, we're not going to have boys trying to get in the girls' locker room. We're not going to have boys trying to get in the girls' bathrooms or girls trying to get in the boys' bathrooms. Oh, we're not going to have boys playing in girls' sports. Oh, you conservatives, you're just making this up. Well, welcome to 2025, members. In just a few years, we are starting to see story after story after story of boys, in most cases, trying to get in the girls' locker room, girls' bathrooms, and girls' athletics. And we missed the opportunity to fix that and protect women's sports in this bill when the amendment didn't pass, and it failed on a party line. Democrats all voting against girls' athletics being protected. Can we not do better than that here in the state Senate? Who is going to stand up for the girls in athletics in our state of Minnesota? If the state Senate won't even pass a bill for education protecting girls in education. And so, members, I want to urge us to go back to the conference committee or the committee and get this bill better, fix it. The obvious things we know. Last week, I thought, what was going on? Because everybody where I went seemed to be wanting to ask me about this girls' softball tournament in Minnesota. And they were telling me bits and pieces and raising the issue, whether I was at a store downtown, at a restaurant, church. Something was going on, because you just know when people organically come up to you and talk about issues multiple times in just a few days or week. It usually gets your attention, and if it doesn't, as a legislator, you're out in Pluto. Because just a few consistent issues coming up so organically usually means there's something really concerning to the public. And sure enough, you look up Champlin Park, state softball champions, And they cheated to get there. Look it up. It's in the articles. There's a lawsuit now filed, according to one of the articles I read, by some courageous girls that are trying to protect women's sports in Minnesota. And we don't have the courage here in the Senate to protect women and girls' sports? Shame on us. Shame on you Democrats. This is serious. I'm a dad with 2 daughters that just graduated high school, love their athletic career, twins nonetheless. I don't want them getting hurt in softball, volleyball, or girls' athletics because some guy is trying to cheat and playing in girls' sports. It's that simple. So if you read some of the other articles that are out online, which I had staff help get me here, don't just believe me. But there's this little organization called NIH. Does anybody know what that stands for? I think Senator Hoffman does. National Institute of Health, Mr. President. Senator Hoffman knew. Little organization. Group I'm sometimes quite skeptical of. But let's give them the benefit of the doubt. The NIH describes the difference between a male and a female. It comes down to chromosomes. And their estimate is that, generally speaking, adult men are 10 to 30% stronger and bigger than females. This is the NIH. Just giving them the benefit of the doubt that this is real science. That is the difference between men and women. Nothing anybody's done, good or bad. It's just the natural reality from our Creator. You have male, you have female. It's right in the first book of the Bible. It's very simple, members. And yet we couldn't protect women and the difference between men and women in sports in Minnesota. As if it's not a big deal. And so, members, there's other things that need to be fixed in this bill, but protecting our girls and ladies in women athletics should be as simple as it gets. And so we can do better. And so, members, I urge us to go back to the drawing board. We've got several hours. The House is in session yet. We can get this fixed. But let's protect women's sports in Minnesota. Let's not put it off to another year till somebody gets hurt. Another school cheats and has a boy playing in girls' athletics to win the state championship like we just saw in Champlin Park. In fact, I would dare say we should go as far as adding a little amendment that let's just say if a school can't figure out that there's a difference between girls and boys, maybe they don't need state funding. They can do it on their own, or they need to get new staff because if they're not brilliant enough to figure out the difference, then maybe they need to start over. I urge a no vote.
Members, just so that you know, if you want to be on the list, let me know. But the list is growing, and I keep hearing about the other body, but it looks like the other body's getting ready to leave soon. So with that being said, I'm going to Senator Kroon.
Thank you, Mr. President. Another omnibus bill. Obviously, there's some good things in here. The cuts to the non-public school students being taken out, that's a positive, good development. I'm happy to see that. Our House Republicans fought for that. Adding a roof repair to the long-term facility maintenance is a good thing. The school food surplus options expanded, remaining in the bill, that's good. That'll provide some fun flexibility to one of the school districts in my district. The hold harmless for compensatory aid, but that's a bit of a mixed bag. It's a complicated issue. It seems like we're just kicking the can down the road by creating a task force to solve this problem, which was predicted 2 years ago when we passed the universal school lunch program. And there's some other good things that I won't get into right now, but there's more problematic pieces here. The biggest one, the glaring omission of any mandate relief. That's probably the biggest problem with this bill. That was the biggest challenge facing our schools going into the session, and this bill did not address that big issue at all. Of that, the unemployment mandate is still here. We use the NLX train funds to pay for it one time for 2 more years, but we still have no long-term funding source in place for this, which, as I've said many times, is financially irresponsible. There's no fund balance transfer relief. That could have been another easy thing to help our schools that just really wasn't seriously considered and is not in this bill. But the one thing I want to focus on here that was not either in the House bill or the Senate bill, well, we didn't have a Senate bill in the finance, that's another problem, but a brand new bill that came out as a result of the backroom closed door negotiating sessions, another one of those. And we here in the Senate didn't even get the benefit of having an education finance bill on the Senate floor during the regular session. So we had no opportunities to make amendments, and now today we technically had an opportunity to make amendments, but the deal that was cut automatically rejects all amendments. So there's been no real opportunity for the minority party to participate in this process at all. Sometimes I wonder why we even had committee hearings all year long. If they're just going to make up new things in backroom deals, closed-door sessions where the minority party here in the Senate was not allowed to participate. Mr. President, would Senator Rarick yield for a question?
Senator Rarick, will you yield? He will yield. Senator Gruen.
Thank you, Mr. President. Senator Rarick, when I left here in regular session, I was told that you were going to be on the working group as a member of the Senate Republicans. Can you let me know how that process played out for you on the working group?
Members, just a reminder, we're on the final passage of House File 5. Senator Rarick.
Thank you, Mr. President. And Senator Kroon, you know, I was under the impression I was going to be involved right from the get-go in negotiations. I was informed that the meetings that were not going to be in public were going to be for chairs only. After a couple of weeks, I was invited, but I would say 95% of the spreadsheet was completed, and there were just a few policy things to be wrapped up when I was brought in.
Senator Kroon. Thank you, Mr. President, and thank you, Senator Rarick. That's disappointing. 95% of this bill, Senate Republicans, 33 members in this body, and we had no representation at the table. We didn't get the benefit of a finance bill, no opportunity to participate, and yet we call this our government. It's really shameful how this played out, that they wouldn't even let our member of the working group into the room when the bulk of the important decisions were being made. It's very disappointing. No opportunity for public input either. And they come up with a brand new bill, just magically arises during these closed-door backroom deals, a blue ribbon commission of some sort who will attempt to find $250 million in savings to special education services here in Minnesota. And if they can't find these savings, then there will be real, actual, hard cuts of $250 million to special education services in Minnesota. These are provisional cuts at the moment. It appears, as far as I can tell, they're trying to appear to make cuts through some sort of aspiration of efficiency, when I fear that in reality they're likely just kicking the can down the road. They're called provisional cuts, but the most likely end conclusion here is that if this bill passes, we'd be cutting $250 million of special education services in Minnesota. And I would think that with a monumental decision like that, we should have been involved, the public should have been involved, and it's very disappointing that we weren't. So with that, Mr. President, I would encourage members to vote no on this bill.
Senator Seeberger.
Thank you, Mr. President. I'll be voting yes on this bill, and I want to thank Senator Kunesh and Senator Swonczynski for all their hard work in putting this bill together and getting it to a point where I think we have a really good bill. I want to thank Leader Murphy for all her work and support on the issue of seclusion. We've made a lot of progress this session, and we still have a ways to go. I want to highlight a provision in the bill that I think will save lives. It's a provision in the bill that allows students to self-carry Narcan in schools. Schools have rules about what students can carry and not carry when it comes to medication. They can't carry Advil, they can't carry Tylenol. They can't always carry an EpiPen. But something as simple as a dose of Narcan can save lives when we know that with fentanyl poisoning, seconds make a difference. So I want to thank the chairs for including that in this bill. And I will be an enthusiastic yes today on this bill. Thank you.
Senator Gruenhagen, we're on the final passage. Senator Gruenhagen, we're on the final passage.
Thanks for reminding me. Thank you, Mr. President. Yeah, I've got two issues, and the first one is a question. If Senator Kunesh would yield for a question.
Senator Kunesh, will you yield? She will yield. Senator Gruenhagen.
Oh, thank you. Thank you for yielding, Senator Kunesh. I had a school board member talk to me about 3 weeks ago, and he had an issue at school. It happened to be the school I was a school board member on for 16 years. And they had, I can't remember what grade, but it was elementary, if I remember right. They had a misbehaving child that was just extremely disruptive. And they had brought in a number of counselors. They had talked to the parents. And actually, the parents and the counselors thought that removing the child from school would be the best solution because it was just extremely disruptive. In fact, when the child would act up in the classroom under current regulations or law, the teacher and the children had to leave the classroom and leave the disruptive child in the classroom. And then when they attempted to remove the child from the school, the social worker said that under current regulations or laws, you can't remove that child, even though the parents agreed that the child should be removed. So my question for Senator Kunesh is that the current state of our educational system, that if you have a misbehaving child, that the teacher in the classroom and the rest of the students have to leave the classroom versus the child that's misbehaving? That's the question.
Senator Kunesh, to the question only.
Thank you, Mr. President and Senator Gruenhagen. As a teacher of 25 years, I saw a lot of different scenarios and situations, behaviors, de-escalation, opportunities to help children grow socially, emotionally, and behaviorally. And one thing I learned is that I am not a professional in that area. I don't have the training, I don't have the skill set, I don't have the knowledge. I don't know the situation. You can tell me this story and embellish it in any way that you would like to, leave out facts, and you weren't there to hear or to see what happened. And so I am in no place or situation where I can make that decision, and that would be something that the school district, the students, and the teachers and their families would make those decisions.
Senator Gruenhagen.
Well, thank you, Mr. President. Yeah, well, it sounds like I'm not going to get a direct answer on that. But according to the school board member, that in the last biennium, something was passed, or the MDE came up with some type of regulation that if a child is misbehaving in the classroom, the students and the teacher have to leave the classroom. I mean, he was quite frustrated about it, and was at his wit's end as far as what they should do, but it was being extremely disruptive in the classroom. So members, it seems like we've gone down a path of allowing chaos in our schools to the exclusion of education. Anyway, that's the first issue. The second issue that I'd like to speak to is the Special Ed Commission that is in the bill, the 18-member, and it's supposed to save $250 million. It's an area that I had a lot of interest in when I was on the school board. In fact, I participated in several mediation sessions, and plus I did a lot of reading and follow-up on it. The first thing I learned from the special ed teachers was that they spend more time filling out paperwork than they do with the student. Members, think about that. We're having special ed teachers spending more time filling out the paperwork and doing documentation and reporting to somebody who probably puts it in file 13 eventually than they do with the student. That's an inequity, and I hope it's addressed with this commission. The second thing, there was an OLA report, Office of Legislative Auditor report in 2013 that I got involved with when I was in the other body. In that body, according to that report, Minnesota has numerous, I'd say 10, 20, or 30 or more additional requirements on special ed than what the feds require, the federal requirement means. And guess what? According to the OLA report, they've never been evaluated for cost or effectiveness. So I actually drafted a bill, was the author, to have them evaluated for cost and effectiveness. It made it through the House on a bipartisan basis, but it got bottled up in the Senate that time. So members, one of the things government is good at is piling on requirements, well-intentioned, but they never evaluate them for cost or effectiveness. And the result is you just drive up the cost. So I hope this commission will address that. And during that period of time, I was approached by the Minnesota Physician, which is an article, a paper that goes to all the medical personnel in the state of Minnesota, to write an article about medicating and labeling students. I was co-authoring that with a Dr. Chris Foley, God rest his soul. It was in October of 2019. You can look it up on the internet. I encourage you to read it. Anyway, Dr. Foley was an expert in a number of areas, including pharmacological. He worked at the University of Minnesota Medical School. He was a lecturer, and he also lectured at the College of Pharmacy at the University of Minnesota, along with a number of other degrees. So he was no slouch, to put it mildly. Anyway, in that article, and I'll just mention one paragraph, here's what Dr. Foley stated. He said, the so-called medication use on children, long used for management of depression and anxiety, and he mentions Prolox, Zoloft, etc., in fact, have very little scientific basis for their action. They are routinely given for anxiety and depression, particularly in children who suffer various types of post-traumatic stress disorder and abusive homes, injuries, medical conditions, and other factors. There is very little validated evidence that they are safe or effective in children. In fact, there's a boxed warning regarding both homicidal and suicidal ideations on several of these drugs that are commonly used on children. A recent expo disclosed that a majority of mass shootings have been perpetrated by individuals taking these drugs. The breathtaking element here is the utter lack of scientific scrutiny for safety and efficacy, particularly when given on a long-term basis, longer than 6 months. End of quote. So members, one of the things you begin to become convinced of as you study this issue is that these psychotropic drugs are being used for behavioral rather than anything showing up on an x-ray. So the last thing I just say on this, in 2013 and 14, actually when we wrote the article, there was about 111,000 students in the state of Minnesota that were on these psychotropic drugs. About 13% of the student population. In 2022-23, it was 153,000 over 400, over 17% of the student population. So members, there's, I think, a severe problem in this area. Nothing shows up on an x-ray in most cases. I'm not saying it should never be used, but I think it's being given out. There's a lot of money in it, and I think it really needs to be looked at. So with that, I will volunteer to be on that committee, okay, and to take a look at that, because we really need to get to the bottom of it. I mean, we're almost at 20% of the student body being labeled and drugged. Think about that.
Senator French, for what purpose do you rise?
Mr. President, I was just rising to a point of order. I believe we're on final passage of the bill, and I believe these comments have strayed far enough that although I hesitate to interrupt another member, I wonder if we might get to the point. Thank you, Mr. President.
Members and Senator Gruenhagen, consistent with Rule 36.2, as I've mentioned sometimes, over and over again, the member must speak only to the question under debate, and it does feel like we have gone far off from the bill that is before us. So, Senator Gruenhagen, can you wrap up your comments, sir?
I'm just about done.
I'm sorry.
I'm just about done.
Okay, and if you're just about done, if you just stick to the bill, I'm okay. But it sounds like that you're going a little beyond the bill.
Well, Mr. President, my comments are tied to the 18-member commission that's going to look into special ed. I spent a lot of time in my life, both at the legislature and when I was on the school board, looking into this issue.
And I understand that you have a wealth of knowledge,
Okay.
but I don't know if we have anything to do with medicine and drugs and what they're on or not on. That seems to be outside of even our realm. So our legislation is not about that. So Senator Gruenhagen, I'm trying to be as kind as possible. So if you'll be so kind as to just wrap it up, that'd be great.
It does seem to be a habit, but anyway, we'll pass that. Anyway, the point is, what I'm trying to make members aware of is that we really need to look into this labeling and drugging. I think it's being done excessively. I have a medical expert here who says there's severe consequences to long-term labeling and drugging of children. And members, I hope that we can address an area of critical importance for our public schools and our children. Thank you, Mr. President.
Senator Clark.
Thank you, Mr. President. This bill helps students all across Minnesota and prioritizes those with the greatest needs. I'm pleased to see that the Compensatory Aid Working Group will get to work this summer, and in partnership with experts like our teachers, we need to keep identifying the best ways to strengthen how we educate our students with greatest needs. Let's keep improving our schools. Please vote yes to strengthen our schools.
Senator Pratt.
Thank you, Mr. President. I know the hour is getting late, and I'll be brief. 2 years ago, Democrats ran around the state patting themselves on the back for record funding to schools. With an $18 billion surplus, Democrats spent it and put us into a $3 billion structural deficit, and we're facing a $5 billion budget deficit in the 28-29 cycle. So now we cut education. Special ed funding, as Senator Rarick mentioned, will be cut $400 million. And you know what, Mr. President? We're not even doing all of it. We are tasking a blue ribbon task force or commission to go identify these cuts. We don't have our legislators doing that. We're assigning it to somebody else. That's our job, Mr. President. And Mr. President, I expect that these cuts will fall back on our local school districts in increased cross subsidies. Because we're not eliminating any of the requirements, we're just eliminating the funding. Mr. President, Shakopee Schools just recently announced that they're going to be cutting $7 to $9 million in the 26-27 school year. Prior Lake has made public, even before this bill came out, that they're going to be cutting about $4 million every year. We have cuts in special ed transportation. We have school districts across the state that have announced layoffs and cuts to the classroom. And yet, Mr. President, the Department of Education will see their funding increase by almost $9 million. We are asking schools to bite the bullet and cut, affecting our kids in the classroom, affecting our future generations. And our state agency isn't taking any of that pain. They're not sharing with what our school districts are having to deal with. Mr. President, that's just wrong. That's just outright wrong. The irresponsible spending of 2023 is now affecting our kids and challenging our ability to meet our constitutional obligation to provide an adequate education, Mr. President. I encourage members to vote no.
Senator Aaron May Quaid.
Thank you, Mr. President. I just want to speak briefly. It is always a pleasure to work on the READ Act, work with the READ Act Coalition. I was talking to a friend earlier this week or over the weekend, and I asked him how his daughter's reading was this year, and he said it's been such an explosion, and he knows that her first grade teacher has taken the training, and they've incorporated a lot of the elements of the READ Act. And we were just talking about how wonderful it is to watch kids learn how to read. It is such a joy, and that's happening across the state. And she's going to learn everything from her phonics and C-Spot run to maybe one day run for Congress and pass a bill as good as Obamacare. And bingo, we've done it, Mr. President. We have done it in the state of Minnesota. So I'm so grateful to work on this bill. I'm so grateful to our authors, and vote green.
Senator Nelson.
Thank you, Mr. President. Well, I rise to speak about this bill as a daughter of a special education teacher, as a special education teacher myself. And I have to say that the cuts that I see to special education are just not acceptable. This will be the very first education finance bill that I have not supported in this legislature. I am aggrieved to see what we are doing to our special education students, to think that we are taking the cuts out of the kids who need the education with the special educators the most. I cannot believe it. We can commiserate about the fact that we are not dealing with the mandates that were slapped on our schools. And yes, we should have had some mandate relief. And yes, I'm incredibly sad incredibly disappointed for my granddaughters who are growing up in a state that cannot protect girls' sports. But beyond that, the thing that I cannot support is taking $250 million of special education funding away from kids. And of course, we know that that will end up, or could end up, as a cross-subsidy for special education and increased property taxes. And we're not just taking away the education, we're also taking $48 million in transportation away. Why is this bill picking on special education kids? It's a rhetorical question. I think there is no good answer, and the answer I have is a bright red vote.
Senator Rarick.
Thank you, Mr. President. You know, I think the biggest disappointment that I see is the fact that we're here in special session in late hours taking up the education finance bill for the first time in the Minnesota Senate. Mr. President, this is still the largest budget issue area that we have in the state of Minnesota. I know projections are showing in the near future it may be surpassed by another bill, but as of right now, it's the largest budget issue. And we're here basically being rushed through. I know I have a lot of things I would have liked to have talked about where we've gone. I am convinced Senator Kunesh would love to spend more time talking about her proposals and what she wanted to do as well. The reality is that's not the situation we're up against. So I will just want to talk about a couple of things to hit on that I think are important. Senator Pratt hit on one of them. We have cuts that we know are coming. In the previous biennium, we increased agency spending by 40%. And I said all year long, if we're going to make cuts, that has to be one of the first areas we have to look at, cutting back at our state agencies. Instead of cuts, MDE is seeing the operating increases that they were asking for, 100% of what they were asking for. And yet we're going to be telling schools we're going to be looking at ways to cut back on what you're getting. I don't think that's the right approach. A lot of discussion has happened around the Blue Ribbon Commission. I'm not going to go into that one more deeply around the area of it, but I sure hope that the people who are picking the members of that commission are going to do their due diligence and put the experts on we need on that commission to truly look at ways we can be more efficient or places where the spending is not appropriate so we can focus this special education money to those most in need and not end up needing to make the $250 million in cuts that help our schools in their special education cross-subsidy. And then the last one, once again, our schools are asking for relief, giving them flexibility to do the things they know they need to do for their students to be successful. And here we are one more time, not listening and not giving them that flexibility. I sure hope in the future we will pay more attention to what they're asking from us, giving them more ability to do what they know their students need. Thank you, Mr. President.
Senator Swazinski.
Thank you, Mr. President. I realize I'm biased, but I believe that there's perhaps no higher calling for this legislature than to fight for a robust and well-funded system of education. It's enshrined in our words and our walls of our Capitol building, and of course, as my colleague Senator Kunesh mentioned earlier, Article 13 of the Minnesota State Constitution. I'd be amiss if I didn't once again thank the Vice Chair, our Senator May Quaid, my minority lead, Senator Coleman, Senators Abler, Bolden, Duckworth, Hochschild, Kunesh, Mann, Miller, Wiesenberg, the fellow members of the Policy Committee. I would encourage all members this fall, when you have some free time in September, October, November, December, that you take some time to visit the local schools in your district, see what the kids are thinking as they go through their K-12 education. And lastly, members, second to last, if you still have concerns about the policy components of this bill, I hope that next session and in the coming months, you reach out to Senator Coleman or I with your ideas, your suggestions, and your improvements to education. And lastly, members, vote green.
Senator Kunesh, you're the last person so that we can vote.
Thank you, Mr. President. While this bill has required many cuts in a wide swath of needs, I am really confident that the areas that we were able to protect and to shore up will do the least amount of harm to the educational system. As enrollment drops, as less and less dollars are coming from the federal government, it has created a very unstable and kind of at times very scary scenario for the future. But I know that we are all concerned about our students, want to do the best by our schools, and that is the work that we did together. One piece of good news is that the investments that we've made over the last couple of years are working. In 2024, Minnesota's high school graduation rate reached a record rate of 84.2%, a significant increase from 83.1 in 23. This marks a notable improvement after a slight dip during the pandemic. Increases are observed across various student groups, including our English learners, our low-income students, and students receiving special ed services. Due to unemployment for hourly workers, the retention of our bus drivers, our paras, our educational assistants, our cafeteria workers, and others have created consistent, stable, and positive learning environments. The shortage of special education teachers is decreasing due to our investments in training opportunities as our more teachers are enrolling in licensure for library media specialists. But personally, I'd like to recognize and encourage our students, encourage them to persevere, be resilient, embrace challenges, and embrace the power of learning. I continue to draw inspiration from our students and will always work for investments in their potential to pursue their passions and overcome obstacles. And lastly, I want to express my deep thanks and appreciation for the teachers, the hourly workers, the administrators, the volunteers, the community supporters who are preparing our students for the tumultuous world out there. At a time when there is more uncertainty due to unstable, destructive federal actions, not just the intentional dismantling of the Department of Education, but the work that is done to attack some of our most vulnerable student populations. Members, I would ask you to vote green for this bill. It's important that we get this information and these resources and funding out to our schools, and so vote green for our students.
The Secretary will take the roll on final passage of House File 5. Members, please vote. Senator Bowden, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Klein votes aye.
Senator Klein votes aye.
Senator Dibble votes aye.
Senator Dibble votes aye.
Senator Umu Verbatim votes aye.
And Senator Umu Verbatim votes ayes.
And Senator Fateh votes aye.
And Senator Fateh votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Dames votes no.
Senator Dames votes no.
Senator Drazkowski votes no.
Senator Drazkowski votes no.
Senator Lang votes no.
Senator Lang votes no.
Senator Abler votes aye.
And Senator Abler votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There being 35 ayes and 32 noes, the bill is passed and its title agreed to. Senator Murphy for a motion.
Thank you, Mr. President and members. We are going to take a brief recess till the call of the president. Members, we will caucus upstairs.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. The Senate is now in recess until the call of the president.